for this event. This is our ninth event, right now. Ninth. So 10th year, ninth event. We're continually growing, and we're happy to see all of you back. Those of you that have been here with us before, we have a exciting program. We have an exciting program for you here today, um, with speakers from a range of backgrounds, from regulatory and from industry side. And exciting as always, we have some speakers that have been on both sides. So we have very unique perspectives. And we're going to touch on many interesting topics that are affecting our industry. And with that, we're just going to go ahead and get started with our first speaker. So welcome to you all and to those online as well. So we're going to start off with our keynote speaker, and first tell you a little bit about our organization. We are the SoCal Dietary Supplement Consortium. It is a group of volunteers who come together to help get regulatory information, compliance information out to the masses, from small companies to large companies. Everybody has their own different struggles with compliance, and so we just want to make sure that we're all on the same page and we're getting the information out to everyone so that we can all put good, safe products out on the market. And so, as part of our group, it is a group of industry and FDA. We've partnered with FDA for many years. We've developed good relationships with our partners. And our first speaker is from that side of the organization. He was with us last year as well, so you'll recognize his face. Our next speaker is the acting director, deputy of Office of Human Food Inspections East, and acting. Oh, sure. Yeah. Oh, pause that one thing. Laura wants to do it now. Okay. Okay. We're going to introduce our committee members so you all know who we are. So hang on.
Thanks, Stephen. This is a problem in your short. So, thanks, Stephen. So, like Stephen said, this is our ninth conference. We started this in 2015. We started as a small group. Not really small. We were 120 first year. The FDA Irvine District Office. So, like Stephen said, this is a collaboration between the FDA and American Society for Quality. So, before I move on, I would like to actually see we have ASQ officers here, and we have people from the agency from the FDA here. Can you please rise to get recognized? So we have our FDA folks here, and we have some of our ASQ officers standing. Thank you. So these are the two groups. Thank you. So I'm Sumita. Som is our currently the chair for the ASQ Food, Drug, and Cosmetic Division. She's our own from elect. She's our own from Southern California. Lance is treasurer, past chair. He's also from Southern California. Who else do we have from ASQ? Tatiana, I see you're here. You're not here, you're outside. Tatiana is outside. We have one more officer from ASQ here. From the agency, I would like to recognize Glenn. He's already standing. So, Glenn is my co-chair for this event. He is currently the acting director for inspection and investigation for human and animal foods East Coast Division. We have Shuban. Some of you probably have known her. Shuban Taylor. Shuban Taylor is our national dietary supplement expert, so we're very lucky to have them. Gary Pisek. Gary Pisek is also our national dietary supplement expert. So we have a number of investigators that are joining us virtually. We have over 40 FDA investigators joining us virtually. So they're ready, like as you guys are. So just housekeeping. We'll have our first break at 10 o'clock, and then we have our lunch break at 12. It is a very packed schedule. We have our afternoon break, so probably 15 minutes. We will have a speed dating session. So for you guys, if you want to be able to interact directly with our speakers today, they will have tables and you can interact with them, ask questions. If you don't want they to know your company, you can just flip your cards. We also have time for Q&A. So during the presentations, if there is not enough time for the speakers to answer your questions, you can save that for Q&A. What else did I forget, Steven? I think that's it, right? So I just want to find out how many of you have attended this event in the past. Can you show of hands? Woo! Thank you for continuing to support us. How many of you actually have not, this is your first time? Welcome. Welcome. Hopefully this is not your first time. Okay, so, can you please move to the next slide? Next, I would like to thank our committee members. So these are all volunteer. And as you can see, all members that are have a big role in their organization. We meet every 2 weeks before the event, and they spare their time to make sure that we have a successful event for you guys. So Glenn, who is from the East Coast, our meeting is every 2 o'clock on Friday. He's on that every Friday, 2 o'clock. So anyway, so I chair with this event with Glenn as my co-chair. So I'm with International Vitamin Corporation. I'm also with the ASQ leadership. Committee members, we have Andrea Gronzi from Serial Global Account. Andrea, are you here? Yes. It's outside. They're still working. Andrea Pote is here. Andrea? Aura is not able to join us in person. Belle, are you here or you're still outside? Belle is here. Bomik is not able to join us. Caroline is outside. You saw her at the registration desk. Francis is also, I think, still at the registration desk. Or you're inside, Francis? I think I saw you. Or no? Gary, obviously, is in our committee. You have already met him. Jocelyn Johan from Now Foods. She's in the committee. Joy Joseph, you don't know, if some of you doesn't know Joy Joseph, I'm hoping all of you or most of you know Joy, right? She's the mother of our industry. Joy, I just want to share with you. Joy is one of the architects of our regulation of 111. Okay, so this is her knowledgeable. She's being knowledgeable. Kate is not here with us today. She's from Now Foods as well. Lance, you have met him. He's with ASQ leadership. Petra is there from Alchemist. Rakesh is not with us today. Shaban, you have met him, and obviously Stephen here. So the committee welcomes you, and also if you see some of them, just say thank you to what they have done for us. Next, I would like to thank our sponsors. So, like I said, we are an ad hoc committee. So we don't have officers, we don't have bylaws. We all just trust each other that we can do this job. So we don't have funds. So we depend on our sponsors because we only can charge $99 on the registration. That is the requirement from the FDA, being our sponsoring organization. So we need to raise funds somewhere to fund the event. So thank you to our sponsors. If you're here, can you please stand up to be recognized? Okay. Thank you very much. So if you see any of them, please take them. Without them, this event will not be successful. Okay, thank you, and to you, Stephen.
Okay, so I already started Glenn's introduction, and he's been properly honored here with as our co-chair. I'm just gonna have him come on up and offer our keynote address. And would you please welcome Glenn Bass with the FDA?
Thank you once again. My pleasure to be here. And it has been an outstanding experience working with Nora and the members. They are simply an outstanding. This is a rare relationship when you can have industry come together, volunteering their time, and also being with the regulators, really trying to help. So once again, I will be giving you my talk. Let's see if I can do this without crashing it. I am not very pretty good, and I got my notes to keep me on track. So let's go. Okay. All right. First thing I want to open up and say, of course, you all have heard the saying, "Make America Healthy Again," and that is our charge. And as a civil servant, that's what we're going to do on our job in FDA. As you can see, FDA regulates products about 20% of U.S. consumers spending. So we have a job, we have a duty, and so um, thus by us having this industry and regulatory meeting together today, and to have a thoughtful and meaningful discussion to enhance industry compliance and self-regulation while promoting food safety culture, continuous improvement, and that aligns with what you will see in some of my slides called prevention strategies. And I'm going to have a slide I want you guys to pay attention to. All my slides you see here, they're on the internet, so there's nothing new. You just got to know how to find them. And you'll remember these words called pillars because they will now become the driver for most of the work that FDA is going to do under the new program that we have. And so our number one goal, like I said, is to make America healthy again. I put this slide in here because when people hear about FDA, they think we're monolithic. We're not. It's a big organization. And I want to make sure I bring your attention. There are two pieces that will affect the dietary supplement industry. That's primarily the Office of Human Food Programs. In prior years, of course, we used to call the Center for Food Safety and Applied Nutrition. But when we have the new organizational change, it's really Human Food Program. And there are three big offices in the Human Food Program that will play critical in the work we do that may affect many of you out in the audience, which would be the Office of Surveillance and Risk Prioritization. That's the office that has the risk pillars. They will be driving probably a huge body of work. And you'll see when I share you the slide. Also, the Office of Chemical Safety, Dietary Supplement and Innovation, what a mouthful. Once again, they're one of the major offices that will be driving the pillars on what we do. And then, of course, you have the Office of Compliance and Enforcement. They make sure we do all the enforcement action. And then, of course, you have my organization that I represent, the Office of Inspection and Investigation, that was formerly called the Office of Regulatory Affairs. So it's a combination of all of us trying to make America healthy again. And I put this slide together because I want people to see our organization, and I want you to see how we're designed. The Human Food Program is designed. They have what we call the Deputy Commissioner, that is Kyle Diamandis. He is no longer acting. I should have updated this. He is now permanent. But I have on the slide, you can see the offices, and I have circled the Office of Surveillance Strategy and Risk Prioritization. Once again, I'm going to keep repeating this. They will be driving much of the work we do. And then, of course, you see the Office of Enforcement, Compliance and Enforcement, and then the Office of Food, Chemical, and Dietary Supplement. And this is the one slide you ought to pay attention to. Get nothing because so much of the work we do. You can see the three big offices. They got the microbiological food safety, nutrition, they're at the bottom, and then you get the food, chemical, dietary supplement. They're going to be feeding in a lot of our commissioner is really driving innovation, a lot of AI, a lot of risk analysis. All of this information is going to be driven into our process models We're going to be looking at how do we prevent foodborne illnesses, how do we reduce some related chronic disease, and then ensuring chemical safety. All this is going to be driving in between, talking to our partners, getting response data from core with outbreaks, getting information from our research, our safety review. And then, of course, all this then will be driven to my office. So if for some reason you see some change in our inspectional strategy and you just don't understand what's happening, a lot of it's going to be driven by the pillars. They have the authority to come and say, OII, we want your investigator to go to this plant, this firm, do this, conduct this, when, and we will do it because they have some type of signal. They need some data point that they want to drive us. So most people are generally used to us being managed by compliance programs, which we still will be done. But a lot of this work will be real time being driven by our risk pillars. And so, of course, whenever I do a presentation, I want people to see where I lie in the world. And so I am in the Office of Investigation and Inspections. And my office is a combination of the Office of Animal Inspectorate and the Office of Human Foods. This is the east that I want you to see the office that I represent. And you see we are broken up into various different categories. And right now, my current position, I am what you call the acting office director for the East. So my territory runs from Vermont down to Florida for right now. And then we have other people are acting in the other position. And if I'm correct, I have that slide there for you. And I think the thing I want people to see on this slide is you can see how I circle the word acting. And then because I don't think people sort of understand in the midst of transition, we have a tremendous body of leaders. We are all in acting positions. We lost a lot of people, either through the various programs that were offered. From a management standpoint, we are doing what they call dual encumbered. So within 1 year, my normal position, I would be the deputy director in the West. I moved out of that for a year. I was the acting office director in the West. Moved out of that, became the acting global director. Moved out of that, and then I went into acting East. All of this within 1 year. And each program requires you a little nuance to do your job different. So if things sometimes fall off the radar, have a little patience with us. We are trying to just do the best we can because right now, I think everybody is aware there's a hiring freeze in the federal government, without certain exceptions. But for the most part, we are trying to move forward. All right, let's get into meat of why you're here. FDA priorities. Of course, you know, a part of the Human Food Program and their 2025 priorities, they're going to be focusing heavily on our new dietary ingredient notification. And so they're going to have to try to go to complete their to finalize the guidance document, but they are going to focus on making sure they add a little bit more substance to that when it comes, especially when it comes to the pre-marketing safety review. So this is going to be a new area where we're going to spend our time on. We're also, like I said, we're going to be leveraging a lot of our work, what we call AI. If you haven't heard about Chat GPT, we have a system within our organization called ELSA, and a lot of that is going to help us drive our work. So the goal is really in collaboration with OII. The goal is they want to improve planning, tracking, domestic and foreign facility, farms, port of entries, investigation. So it is going to be comprehensive. A lot of our work will be driven by a model, analytical models telling us where to go. So we will be doing things we've never done before because the model is finding something and they need an answer. So I just want people to be prepared that our inspection strategy may change. Also, of course, you know about the FDA commissioner, Dietary. He had 100 days, and he was what he called embracing the gold standards, transparency and common sense. One of the big issues they're really going to focus on is the grass reform. Not only is McCary, you'll see in my slide, our secretary is really focused on also improving the grass notice. And then on the bottom, he is really pushing us on what we call unannounced foreign inspection. Traditionally in the domestic arena, that's normal. A little bit difficult in the foreign arena, but that's a charge that we are going to do. So if you got a firm that they're not used to seeing us knock on their doors and dietary supplement unannounced or any other program we have, that will start to happen more frequently. They do it a little more often now in the drug arena, but with his comprehensive strategy, we made sure we clarified it with his language, because really he wants us to do it in all programs. So get ready. Unannounced is really going to be what we're going to be pushing coming up in 26. Like I said, Secretary Kennedy, if you want, you can read the article in the New York Times. He clearly was talking and railing about his challenge with grass, and clearly the impact it may have on many of you in the dietary supplement. So if you want to, I definitely read it, because it sort of gives you an insight of the direction he is going to go. If he goes that direction, that means on the inspection side, that's how we're going to be inspecting, or the priority on where we will be inspecting. OAI priority. So how do we make sure we get the work done? We get our work done, and we help make America healthy through the dynamic duo, Siobhan and Gary. You guys don't realize the work they have done. Those two, they have transformed our dietary program. They start in a formalized program that's like a train the trainer. They go out with our coaches and they baseline the coaches, making sure they are adhering to all of the regulations when they're doing these inspections. Then once those trainers are baseline, they go then to the CSOs that are doing that work, making sure they also are baseline. So we're trying to get consistency throughout the whole program. And I can tell you, they have been yeomen. They have traveled around the country the last 2 years getting this work done. So kudos to Gary and Siobhan. Not only did they do the OJE program, they also gave additional refresher courses to our field, making sure they understand the nuances and the differences that was going on, because of course they have revised what we call our regulatory dietary regulatory course. So it's brand new. So people that took it 10 years ago, their understanding is totally different from the way they have revised it, really honing on what we need to inspect. And so they've revised also the compliance program, once again giving new guidance. And then even better, they initiated what we call the dietary supplement RTAD, which really is there to help our investigators. So if you're in the midst of an inspection, and if there's a difference of opinion, and that can happen between, let's say, the firm and investigator, that investigator should, pick up a phone or email and let them know, hey, I'm going to miss an inspection. Here's what I'm observing. Here's what the feedback you get from the firm. What is your assessment? They're on board. They're available. They will help them guide that. And so that's a brand new tool to really help make our inspections a lot more efficient. And so I put this slide here because you can see when the new compliance program was issued. It issued the first part of fiscal year 2025, and you can see the major changes they have done. So a yeoman effort, really making sure we can dig into the data, because now we're reporting specific items inside the compliance program based on the inspections we're doing. And so I want to put that slide there because I got to give them credit. We have better data so we can see what's going on. Whereas before we used to just, report on the very small packs. You had either a full scope, limited scope, and then, of course, if we had, let's say, the R is related to some food fraud. But now you can really they can look at the data. We can see the trend, what's going on in distributor. We can see what's going on in full scope. We can see what's going on in a packing warehouse. Once again, health fraud. And then there's a pack. They have not used it very often, but it is there. Not saying we can't use it, which is that one I highlighted, the 21008X. That is if they want to use the device in the imports. Because at one point, they used to have devices where they could screen products coming in. I don't know if they're going to go back to it, but should they ever to it, that's a requirement. They may go back to it because we're having issues right now. That's a way, if they're looking at a dietary supplement and they're screening at an import, they can track it there. You should be able to see exactly what they're doing when they're doing a field exam. So there are tools so we can look at the data to see exactly what we're doing. And the number one goal, like I said, want to make America healthy again. And of course, I put this slide here because it's interesting. Prior to Siobhan and Gary and our colleagues at HFP revising the compliance program, most of the data you would see was done on limited scope. That's the blue line, huge. But at 25, they no more limited skill. It's all full skill. And the rationale behind that, which I think is good, is because I would say probably about 90% of our limited skill was always being converted to a full skill because you look at one product and if you found an issue, you moved on to two or more. And so I think from a planning perspective for our field, we're trying to make sure we can plan their work together. If you're planning a limited scope, let's say 40 hours, but a full scope takes 90. Well, there's 50 hours was unplanned work that they were doing. So that's where we're trying to capture the actual work they're doing. And you can see how the full scope numbers are going up. And then I think in the blue, as you can see, some of our states are trying to do some of the work in the dietary supplement. We don't have a lot of states doing it, but some states are taking it under contract. And then I just want to let you see the inspection training we have here. You can see the difference between the NAI, which are saying no action indicated, no issues. The AI, you've got some issue. We wrote some type of observation. And then OAI is, it's got a significant issue. We're going to make a recommendation to the center for some sort of administrative act, warning and injunction, seizure, what it may be. So you can see we're still, that OAI rate is still consistently there around, around that, 20, 30-ish, so the trend is still, we're still finding issues, but that's why we have meetings like this, so that we can answer your questions, we can convey the information we have, and the goal is, to make it better, make your job better, make your product better, because we want to make sure America is healthy. And as I said, all my slides, all my data are all on public websites. If you ever need to find out about our field offices, there's a link in the end of my presentation. There's a link about about our office, and then of course that dashboard has all of the inspectional data. If you ever want to know what's going on, FDA we have a transparency initiative. You can go on our dashboard and you can see the inspections we've conducted, and it'll tell you the classifications. So all that data is right there, publicly available. And with that, I thank you. Hopefully this is a great day, and listen to the experts. Thank you.
Okay, thank you, Glenn. So before we move on to our next speaker, I have another set of housekeeping issues. First of all, I want to let everybody know that at the conclusion of the event, the slides and the recording will be made available to you. So you'll get that in your email once we get that all buttoned up. So you can be on the lookout for that. It'll probably be a link sent to you so you can download everything. Okay. Second of all, anyone who's self-parked at the registration table, there's a jar for your ticket. Trust us, put the ticket in the jar and it's going to get validated, and then the staff is going to do that, and then at some point you can go back and pick it up so that your parking is taken care of. So go back. So if you have self-parked, go to the registration table and drop your parking ticket in the glass jar there. There's people out there you can ask too, sitting at that table. And then lastly, for those of you online, we have Q&A session scheduled for later in the event. Please use the Q&A tab on Zoom to submit those questions. The chat is disabled, but down at the bottom, if you hover your mouse down at the bottom, there should be a Q&A button. You can click on that, and then it opens up the box to submit questions for the Q&A for those of you that are attending online. Okay, so next we're going to move on to our next speaker, and in preparation for that, how many people in the room have the responsibility of doing supplier qualifications? Okay, a lot of you. Okay, so you all know that can be a difficult task, and from company to company, things are done a little differently, and some of it is internal. You have internal requirements, and then there's also requirements that are regulatory that FDA may be looking for based on different regulations. So our next our next speaker is going to address that for us, and so I'm going to introduce him to you. He's already been introduced as one of our committee members, but our next speaker is Lance Hardy, and he is the Global Supplier Quality Leader for Unilever Wellbeing Collective. He has a vast array of experience with other companies and other organizations. He previously was the VP of Product Development and Compliance for Smarty Pants Vitamins. He's also the treasurer and immediate past chair for the Food and Drug and Cosmetic Division of the ASQ, American Society of Quality. He previously worked for Herbalife, Guthrie Ranker, Allergan, and Pfizer. So would you please welcome Lance Harding to give you a discussion on supplier qualification.
Morning. All right. So, did everybody write down unannounced foreign inspections? Right? Did you make a note? Thanks, Glenn. So I'm going to talk to you today about supplier qualification. We'll go into a little bit about why it's important, what the requirements are, ways that you can approach this. As he said, Stephen, that there's many different ways that you can do this. So I'm just going to give you some things to think about. If you've done this for a while, you're not going to get too much new from this, but it's a good refresher kind of list of things that you can do. If you're new to the industry, it'll give you sort of a working guidebook of how we can get through some of this and why it's so important. So just for an overview, we're going to talk about what is a supplier, what are we talking about. If you're a distributor, if you're putting a product on the market and you use a contract manufacturer, or if you're making it yourself and you're buying raw materials, you're buying labels, you're buying bottles, cartons, pouches, whatever. Those are suppliers, and you need to choose those carefully. What does the CFR say about supplier qualification? How do you evaluate and select? And then how do you actually do the qualification, right? For what's required and what is nice to have, what's good to have. We'll touch on foreign supplier verification. You're bringing in from outside the U.S. And then we'll talk about, after they're qualified, that ongoing management that we have, right? So, all right. Let's dive right in. So, a supplier is not specifically defined in 111, 21 CFR Part 111 that covers GMPs for supplements. So it is given a definition of foods, and as you can tell from that, it's probably pretty broad, right? The way I'm going to use supplier is if they are performing a GMP activity for you, which means either you're manufacturing, packaging, labeling, or holding, warehousing a supplement, or if you're providing a component that's used to make that product. So, as I mentioned, it could be the dietary ingredient, right? The active ingredient. It could be those excipients, other ingredients. It can be the packaging, and can be the label. I'm going to talk most about a contract manufacturer just because they're the most difficult, right? But they have the most responsibility. All right, so why is it important? If you are making a product and you're looking for a good contract manufacturer, DSHEA says, hey, FDA, you have to come out with these rules for good manufacturing practices. And in those good GMPs, those requirements apply to both the distributor and the manufacturer. So you're not going to hire someone to make the product for you and say, hey, it's all on them. They've got a quality group. They've got a regulatory group. They have a product development group. I just take what they give me and I put it on the market. And if they mess up, it's on them. No, that's not the way it's looked at. And I put in a quote from the Federal Register. Let's just read here. So the distributor contracts with a manufacturer to manufacture a dietary supplement. That distributor then distributes under its own label. The distributor has an obligation to know what and how manufacturing activities are performed so that they can make decisions of whether it conforms to specs and whether they can release it and put it on the market. So that is their responsibility. Let's look at the actual requirements in the CFR. The first two, you have 111.75 and 111.95. Those relate to those components, right? The bottom one, 105, relates to those manufacturing activities. So I highlighted the places where it says qualify. So, and it usually says, the quality unit must do this, do that. So if you're going to accept, I always hate that when there's crickets in the room while I'm talking. We need a good pest control program, I think. All right. You need to qualify your supplier, and you have to document that. Now, it doesn't say too much about how you actually do that. It gives a little indication that you have to look at their test methods, the limits, and the actual results on their C of A, and you must periodically reconfirm them. So it's not just the initial activity, it's an ongoing activity too, right? And then the other point I want to make is on the bottom one, it says quality control personnel must perform operations that include approving and rejecting all processes, specifications, written procedures, test controls, examinations, deviations that may affect the identity, purity, strength, and composition of dietary supplement. Now that's pretty broad, right? So take note of that. And then you have to document how you qualified that supplier. So this is in the CFR. The FDA can come in and say, give me your approved supplier list for this raw material. And then tell me how you qualified this supplier. And you better be able to do it because that's what's required. Okay. So you're starting off at the beginning. Before you qualify a supplier, you have to select the supplier. What are some things that you should think about? Because really, you're only as good as your partners that you're working with, right? So you want to choose the best one. How do you evaluate to choose the best one? Because tell me how many times has this happened? R&D in your firm that has worked with a supplier before, so when they need to work to develop a new product, they take it to this supplier that they've already worked with, and really they don't look around too many other places. Or you have contract manufacturers who went to your supply chain group and they say, hey, I've got a really good deal with this manufacturer. We want to go there and qualify them to make this new product that we've been working on. And it's one way, right? So what we want is a team approach, right, to evaluate these things. That's usually the best way because you can get input from quality, regulatory, supply chain, procurement, finance if you need to, right, and R&D so that you can make these decisions. So what are some things that go into it? We need to define, am I looking for a supplier for a specific product or for many types of products? What ingredients am I using? Have they handled those before? For example, probiotics are very different than most of the other ingredients you're going to use. So you may want someone who's specialized and has experience in that. Who's going to set the product specifications? What kind of volume are we talking about? What kind of lead time do we have for this project? So if you have a very tight time frame, you may need more resources at the beginning to meet those timelines to launch your product. And budget, of course, is always important. You need to look at the reputation of that contract manufacturer. You can talk to folks in the industry. Do they have a proven record? Have they been in business a long time? Are they financially stable? Right? And that's part of the evaluation too. You don't want to get into a contract for them to supply you product, and then they run into financial difficulties and they start laying people off, especially in their quality control department. Not good, not good. You want to make sure they have good facility and equipment. We've done some audits before with potential suppliers and find out that they have aging equipment. They have, rust here and old facilities that can't easily be cleaned. They weren't hygienically designed. Those kinds of things. It's good to do a preliminary assessment to go there. As a team approach is always best to go visit them, to walk through the facility, to talk about how you're going to do business together and really get a feel for the place. Understand who's going to do the raw material sourcing and do they have reliable suppliers that they use. Maybe they've been doing this a long time. They have good big volumes and they can get good pricing from suppliers. Sometimes you can designate certain ingredients that you'll buy and certain ones that they'll buy. You need to talk through all of that. Make sure they have a good quality assurance and quality control department. Are they certified? Do they have any third-party certifications that show that they've been regularly audited? They meet certain standards. They know whatever it is, ISO requirements. They have HACCP certification, NSF, and Eurofins has a new certification program they were telling me about. So those give you some added assurance. Look at their documents. Do they have a quality policy, a quality manual? Can you get a list of their SOPs? Can you look at a few of those key SOPs, like how they do change control or maybe allergen management, right? You can do a search for the FDA Supplier Evaluation Dashboard. I highly recommend that. Pull that baby up and you can see if they've gotten import alerts or if they have warning letters. You can look to see the last time they were inspected. You can do a FOIA and actually get their establishment inspection report. These are all details that would be good to know. What are their technical capabilities? Do they have, specialty products? If you're doing a gummy manufacturer, and we're going to have a talk about that a little bit later. That's a specialty, right? It's a little bit science and a little bit art to make good gummies, but that limits the number of people who can do those, right? There's a barrier to entry with all of that unique equipment that you have to buy. And do they have product development? Are you bringing your own product development, a finished product, and you want them, hey, I want you to make this for me? Or are you going to say, I've got an idea, I want to have this much of this ingredient in there, but you guys figure it out, what excipients or processing you're going to do, and then present it to me. So that changes who you select quite a bit as well. You want good communication. So it's a little bit of a warning flag if you go in for that preliminary visit and they're not willing to share too much information. They're a little bit guarded or they don't have immediate answers to a lot of your questions. Transparency is always good. And then, of course, price is always a big consideration. So once you make your selection, let me just point out on this, the last one at the bottom, the goal is a collaborative selection by key departments to make that selection. Now, we're going to actually qualify them. We've chosen who we want. All right. We got the legal stuff, right? You need to make a contract for your business. You provide me this and I will pay you this. And you put in stuff like your product that you supply me will be sure to meet the current regulations. And it will meet the specifications that we agree to. You're going to protect any confidential material that we give you, and we'll protect confidential information you give us, like how you process this, what temperature you run this machine for how long. If you share that with us, we won't share it with someone else. And the guarantee of continuous supply. If you have disputes, what kind of dispute resolution you're going to have. That's all usually on the business side, the business contract. To go along with that, I highly recommend a quality agreement, right, which covers in detail all of the quality specifics about specific activities of who's going to do what. I mentioned about specifications. Are you setting the specifications? Are they the specifications? And then you both agree to them, right? Who's developing the labeling? Who's doing the raw materials? You put in the quality agreement your expectations, right? We're going to have temperature controls in their manufacturing areas and in their warehouse. They're going to share with you any major deviations that they have, or nonconformances or rework, right? You can put in there to that you require to approve the rework procedure, right? You can put in there that you want the ability to get and review a master batch record. These kinds of things are very important to have in your quality agreement, because when you get into the thick of things and you're using them, and if you haven't specified that they have to share all this information with you in advance in the quality agreement that they've signed, you may hit a brick wall and you may be out of luck. So, you want to ensure the availability of the essential documents. I mentioned some of those. It's good to always start off, have a written supplier questionnaire. Describes how they're organized. How big is the facility? How many buildings do they have? How many manufacturing lines or packaging lines are they going to use for your product? You want to consider how big is their quality unit, right? Do they have any certifications that they're going to maintain? Perhaps you're required on your product, you want it NSF certified for sport, or you want it halal, or you want it kosher, gluten-free. So you may have specific requirements for them on the certification side. And then the other big piece, I always look at sort of two big pillars. One is the quality agreement, and the other is the full GMP audit to qualify those manufacturers. So you don't want to certainly depend on their own audit of themselves, right? You want to go in and you want to make sure that you check them out and do a full GMP audit so that you have that assurance so that you can sleep at night. And you know where they're at on the compliance aspect, right? So for us, if we are doing the audit and we come up with a critical finding, then that stops the process until they fix the critical finding. Same thing if they have a slew of major findings, that would also stop the process. But that GMP evaluation, you can either do it yourself or you can hire someone, a third party who's an expert at auditing, to do that for you. And then you need to, in that quality agreement, discuss how often you're also going to be able to audit them in the future, right? You want to put some of that detail in there. Who's going to handle raw materials? The documentation that you need, right? What's the specifications on the raw material? What's the allergen statement? What's the C of A? The manufacturing process? Does it have does it have ingredients of animal origin? All of those things. What country is it from? Country of origin. All of those documentation that you need to make sure that your label is correct, your product claims are correct, and that is used to do your regulatory qualification of the raw material. Who's responsible for that? And then there's a quality qualification, right? how do you know that those raw materials are meeting spec, right? Before you use them to make your product. Obviously, if you're using a contract manufacturer and they're buying the raw materials, then they're doing that activity, but you want to understand their program. If you're buying the raw material and supplying it to them, it's usually on you, but you want to make all of this very clear who's responsible for what. And then do they have a testing monitoring program to continue to make sure that those materials meet spec? Again, I mentioned reviewing some of their critical SOPs. And then once you've done all of this, then you move them to the approved supplier list, right? So, and you may not stop there. Sometime if you have critical raw materials, you may want to make sure that you have alternate or backup suppliers, right? So you got to do the process all over again, even though you may not regularly buy from your backup. But believe me, I've seen in many cases where if you have a problem with your primary, it's good to have your secondary all ready to go. Here's our goal. Happy, smiling faces all around. All right. Let's talk about foreign supplier verification. So that's part of the FSMA program. It's one of the requirements. And here's just a brief description of what it is if you haven't heard of it. It's just a way that you're supposed to make sure that imported food meets U.S. safety standards. So if you're bringing in any kind of food, right? So that could be an ingredient. You could import an in-process dietary supplement. You can import finished dietary supplements. Those are all fall under the FSVP requirements. So, what are hazards, right? Hazards are things like allergens and other things that you do from a hazard or analysis, a hazard plan, right? The key is to understand who is the importer. And this is one of the key things that the FDA focused on and require is that you know who the FSVP importer, and it may be different from who actually is listed as an importer and authorizes and signs the contract to bring it in. They may designate someone else as the FSVP importer, or in some cases, they may put your name down as the buyer and you don't know it. And if that happens, you're in trouble all around. They're especially in trouble because they're actually responsible and they didn't tell you. But that's why, as the receiver, if I'm going to get this ingredient and use it, I need to understand who is the responsible FSVP importer because they are responsible for making sure it's safe. And here's the activities that are required. Food safety plan that includes a hazard analysis and preventive controls. Now there are some exceptions to this. So if you're bringing in a dietary ingredient or one of those other ingredients, those are imported as foods and they fall under the full FSVP requirements. If you're bringing in dietary supplements, there are some modified requirements because you are required to meet the GMPs for dietary supplements, so you don't have to have a separate food safety plan that is modified or waived. But you have to do the rest of the requirements to make sure your supplier has a good performance, including compliance and safe history. You have to have verification activities. So what are the type of verification activities? It can be an audit. It can be testing the product. It can be reviewing their C of A. It could be something like, let's say it was needed to be heat processed to kill a micro. You could ask for them every time that they made a batch to also send you the documentation that process was done, right? It could be a variety of things of verification activities. You just need to define those and how often. Then if something goes wrong, you have to show that you did a corrective action. What did you do about it? You have to document it, and then you have to look at your program every once in a while. There are some modification requirements I mentioned for dietary supplements. Finished dietary supplements are in process, and also for small importers too. Okay, so we've done our job, right? We've evaluated, selected our supplier, and qualified them, so we're done. No problems will ever happen in the future. So what we really want is to establish a partnership, right? We're working together to make this product. So you want good communication. Again, I mentioned your audit is not only at the beginning, but you need to define. So I put 1 to 3 years here. If you have a product that has a SoCal hazard, which is, and I always have to look at this, serious adverse health consequences or death to humans or animals, SoCal, then you're supposed to audit every year. If you don't have a SoCal hazard, then it could be every 2 years or 3 years as you define based on a risk analysis. And you can also do a for-cause audit. You always want the ability that if something happens, you have a major issue, a non-conformance, a recall, that you could go in for cause and do an audit either directly related to that or a broad audit to make sure that it doesn't happen again. You want good change control. This is very, very, very important. And that is if you're changing those components, if you're changing the supplier for raw material or changing the specifications that you require, if you're changing a label, right? You want to make sure that if you're changing a formula and a label, you want to make sure that they travel together, right? And when the formula changes, the new label is used and not the old label because maybe it doesn't comply anymore. All of those things have to be done correctly. You want to make sure their C of A's and other documents are consistently good, complete, and accurate. You need to, especially at the beginning, right? When they start making product for you, it's good for you to look at that product, do an AQL, take a sample that's representative, and see that it meets your requirements, right? You don't want crooked labels. You don't want caps that aren't tightened on. You don't want incomplete seals. You don't want a smudged lot number or expiration date, ink jetted on the bottom of the bottle, all of these kinds of things. You won't know about if you just depend on their quality department to release it, right? It's good for you to check those kinds of things, especially for a brand new product coming out. And it's even better if you can do that occasionally on a consistent basis, just to check in to make sure things are still going okay. What's their testing program? Do they have a strong quality unit? You'll quickly find out if they have a good group that's able to do a good investigation when problems occur. Do they have good and effective CAPAs, those corrective and preventive actions? So when something happens, they're able to figure out, okay, if what do I need to do to make sure this doesn't happen again, that it doesn't keep reoccurring. For example, I have a powder in a stick pack, and every so often I keep getting complaints that the seal isn't complete. So I ask them to investigate, and they go, yeah, that was just a cleaning thing. We cleaned the vertical sealer and it worked, but then you keep getting complaints. Well, maybe you need to dig in to do a more effective CAPA to figure out, okay, what's the frequency that you have to clean this? How is it being checked that it was fully cleaned? Were the people trained to make sure that it was cleaned right according to the procedure, that the procedure was validated, and that quality is checking that it was clean before they release it to continue on. All those kinds of things should be documented, and that makes for an effective CAPA, right? How are you going to measure them? So there could be obviously an audit is a good measure of performance. How many critical majors and minors did they have when you audited them? Did they address those, right? Criticals you want addressed right away. You want a response to those in, let's say, 15 days. Majors, you usually want a response to those within 30 days. Minors can take a little longer. Did they hit their dates for addressing those and closing those? How many non-conformances have they had? How much product was affected? What's the value of that product? Did they investigate it and resolve it? Did they work with you on resolving the non-conformance? Again, CAPAs, did they close them on time? Did they do a good job? How many deviation complaints that you've gotten in? If you're monitoring complaints, it's not just the number of complaints that you get in, but you also want to look at investigations, right? So if they either are a major complaint or if they are trending and showing, oh, I used to get this many complaints for dirty bottles, and now I'm getting this many complaints. It's really went up. I need them to investigate and resolve this. What's causing the dirty bottles? Maybe they stopped putting a lid on the hopper that kept the dust in, and now it's getting on the bottles, and they need to figure it out. Did they do the investigation in a timely fashion? And you put it all together, and you get supplier ratings, right? And then you share it with them. You have that good communication. You'd say, "Oh, you're doing good on this, but you're kind of taking too long here to resolve these non-conformances. Let's talk about that." And then just briefly, what are some of the challenges and problems that can happen? Consistency across all the areas, good communication. All right, have you had supply chain disruptions, and did they help you to resolve those? Do you have a backup, a plan, contingency plan? Are they protecting your confidential information? If you go in and you're able to see confidential information from other people that they manufacture for, that they may not be taking care of your information too. Do they have continuing regulatory compliance? Cost management? And I mentioned here, balancing cost effectiveness with quality can be tricky. Maybe you're using metal detectors and you want to go to X-ray machines because they detect more different kinds of contaminants, foreign matter besides metal, right? They're better. Let's do that. But now I got to buy the X-ray machines, right? So who's going to pay for that? So, are they investing in you and your product, or should you share the cost? Are they willing to negotiate with you on those kinds of things? Capacity planning. You've just introduced this beautiful new product, and now it's selling like hotcakes, but all of their lines are full. So it's good if they have additional capacity that they can lend to you, and you can plan for that. And then risk mitigation, as much as you can, think of some of those things in advance. At some point, you may decide you're done with a contract manufacturer. It could be because you're discontinuing a product. Could be because they're doing a bad job. Could be because you want to change to a different place that has more capacity or a better price. This is all business type activities that happen all the time. So you're going to stop working with them. You just need to document why. What's the reason? Especially if they have poor, supplier ratings, right? If that's one of the reasons, you want to make sure that that's well documented and communicated internally within your own company and to them. It shouldn't come as a surprise to them that you're not satisfied. you need to let them know as you go along. Hopefully you can reach an agreement on things like all of those products that have been made, right? Are they going to keep the retained samples of the raw materials and finished goods that they have for you? Other components that they may have bought, what's the resolution for those? Who owns those? How are they going to be disposed of? Are they still going to respond? Like if you stop business, you may still have product on the market for 2 more years if you have, right, a 2-year expiration date. So are they still going to be able to assist you with complaints, complaint investigations, non-conformances or investigations that you have as you come along? And those are just some of the things to tie up on the loose ends when you complete your cycle of work with them. All right. Thank you very much for your attention. I think we're going to have Q&A later, so I think that'll wrap it up for me. And I'm under time. Thank you.
Thank you, Lance. Okay. Anybody here ever put on an event like this before? Know how hard it is? Okay, just want you to know there's feverish work going on in the background. So if we hit a couple technical snags or somebody comes up like me to delay like I'm doing right now, there are some things going on. So I want to thank Lance for that presentation on supplier qualification. And if we could, yeah, right. You saved me 5 minutes and now I have to eat 5 minutes. But yeah, so if we could take a page from FDA's notebook for supplier qualification, like who would go unannounced if you could, right? That's something that if we could put that in our toolbox and just knock on the supplier's door and say, hey, we're here. I think that would be extremely helpful. So as a consultant, you want to send me to do it, just let me know. I'll go knock. So we are trying to get our next presentation set up. It's a online presenter as opposed to in person here. So we're trying to make sure that we have connectivity so we can do that. Anybody got any good jokes? We're good? Okay. All right. Okay. Dory, can you hear us? Can you unmute your mic?
Hi, good morning. Can you hear me?
Morning. Yes, we can. Thank you.
Wonderful.
Okay, so we're going to move on with our next presentation. It's an online presentation from the FDA, and it is closely related to what Lance part of what Lance was just talking about. I want to introduce our next speaker, Doralise De Leon from the FDA. She is a senior policy advisor at FDA's Human Foods Program, serves as the program coordinator for accredited third-party certification programs known as TPP, and she provides strategic planning and oversight over the program, and she's going to give us an overview and update on that TPP program. So would you please, before I walk away, Dory, when you need the next slide, just let us know and we'll toggle it from here. Okay?
Okay,
And,
sounds great.
so would you please give a welcome to Doralise De Leon from FDA.
Hi, well, thank you so much for that welcome. And it's an honor to be with you this morning, everyone. I'm really grateful for technology that allows for this exchange of ideas and information remotely. I really do wish I was there with you in person, though, on the East Coast. My background is in import compliance, and with that, I currently do serve as a program coordinator for FDA's accredited certification program. Is to share the structure of the program with you, to identify the parties that can participate in TPP, so the ones that would be helping you add assurances to your supply chain, and why TPP is important to FDA's human food program. Next slide. A little wonky visual, but that's okay. So the accredited third-party certification program, we often refer to it as the third-party program or TPP, is one of the tools provided by FSMA to meet FDA's goal of ensuring that food that's offered for import meets U.S. food safety requirements. So yeah, this program is intended for the certification of food that's imported into the U.S. So FDA does recognize that audits can provide valuable public health assurances when those audits are reliable and aligned with the relevant FDA food safety requirements. So FDA has established this voluntary user fee-based program for the recognition of accreditation bodies who then accredit third-party certification bodies, and they then conduct food safety audits and issue certifications of compliance regarding foreign facilities and the foods that they produce. So it is a multi-layered program. So the requirements of TPP will help ensure the independence of the accreditation body and the competence of the certification bodies participating in our program. The implementing regulation, because it is a regulatory program, the implementing regulation for this program is in 21 CFR Part 1, Subpart M. And in that, we cover the requirements to be followed by accreditation bodies and certification bodies who are interested in applying for participation in the program, or that they are actually participating in the program. So FSMA specifies two main uses for the certifications that are issued under TPP. The certifications can be used to meet eligibility requirements of another FSMA program, which is called the Voluntary Qualified Importer Program. So you have heard of it. This program allows expedited entry of foods into the U.S. The second way that we could use certifications that are issued under TPP is that they can be used as import certifications to meet these specific requirements under 801Q of the FD&C Act. And that allows the FDA to require certification as a condition of entry for imported food under certain circumstances. I will say to date that this regulatory tool has not been used by the agency, but we do have the authority and ability to use it if we needed it. In addition to these two specified uses for TPP certification, I just want to mention that while they are not required, the audits that are conducted by accredited third-party certification bodies in TPP can also be used to meet the supply chain requirements of the Foreign Supplier Verification Program that Lance just mentioned, and the preventive control regulations, PC for human foods and PC for animal foods. And that would be on a voluntary basis. Next slide. The reason FDA can have confidence in the certifications that are issued under TPP is because of the way the program is structured. So this image here shows the role that each of the parties play, and it also shows FDA's oversight at the various levels. So under the program, FDA has the ability to withdraw the accreditation from a third-party auditor for conducting work under TPP, regardless of whether the accreditation was done by an FDA-recognized accreditation body. And additionally, the regulation does require that we, the FDA, conduct monitoring activities of ABs and CBs. So this further provides confidence that the participants' accreditation and certification programs are working as they should. So I would say this is a small program still, but FDA has seen a steady increase in the number of eligible entities that are receiving certifications by accredited certification bodies, which is a promising sign. So the idea of leveraging reliable third-party audits to advance food safety has been a part of the agency's thinking for a while now. It's also mentioned in like FDA's New Era for Smarter Food Safety Blueprint, like it was back in 2020, I believe. And it does directly speak to what is being done under TPP. So we're leveraging the information from these audits to do the work and that FDA does every day. So next slide. A little bit more about the requirements for the program. Any organization that wishes to become an accreditation body or a certification body must meet the eligibility requirements for the program. And they are probably going to look very similar if you have experienced the certification program. So we did not reinvent the wheel. These eligibility requirements include things like demonstrating authority. So for ABs, that would be the authority to assess a third-party CB for accreditation. And then as it relates to the certification body, they need to have the authority to conduct site audits and review records to be able to issue certifications. Additionally, participants need to possess and demonstrate the capacity and competency. So that's really key and important, especially in this program, and I'll mention why in a second. So they need to have adequate finances for operation. They need to have staff that's knowledgeable and skillful and experienced to perform the audits effectively or assessments in the case of ABs. They also need to have resources and equipment that are necessary for auditing and testing. But the thing I do want to spend a little bit of time on is to say that the aspect that's most important and in terms of this program, and it distinguished TPP from other certification programs, is that the criteria for the audits under TPP are the applicable food safety requirements of FDA regulations and the Food, Drug, and Cosmetic Act. That is unique to our program. And it's something that we have to explain sometimes in terms of, if there is a certification that's submitted under VQIP, maybe an importer thinks that they do have a certification that they can use. And unfortunately, for participation in that CARET program, which I call that VQIP, for expedited entry of food, they need to have a certification issued by an accredited CB under TPP. Two other additional eligibility requirements are they have to have a program and to monitor quality assurance, and then they have to have written measures to protect against conflict of interest. And the other thing, again, is to have written procedures to establish control and retain records. To dive a little bit more into that competency and capacity I mentioned, I wanted to say that TPP covers all food under FDA's jurisdiction. But right now, to manage the program, we've implemented 11 scopes of recognition and accreditation. So each of the scopes that we have identified represents a set of overarching food safety requirements of the Food, Drug, and Cosmetic Act and the FDA regulations for respective food and process categories. And I will say that one of the scopes is specific to dietary supplements. This ties into competency in that the accreditation body would apply to FDA for recognition under TPP, and they would specify to us which of the scopes they want to be recognized for. So once they're recognized, that accreditation body could then accredit CBs for those corresponding scopes. And one of the other things I guess I'll mention that's on our website is that to help ABs and CBs establish their own programs that would meet the requirements of TPP and to determine what should be covered during a TPP audit, we have created a series of what we'll call comparison tables or templates that can be used. And those can be found through links on our program page. Requirements that would apply to audits that are under TPP. So regulatory audits, which is what we call them, regulatory audits are conducted to determine if facilities or farms are complying with the applicable food safety requirements under the Food, Drug, and Cosmetic Act and FDA regulations, like I mentioned. And only the results of these regulatory audits can determine if the facility or may receive certification. So additionally, some uniqueness to the audit is that they must be conducted on site and must be unannounced. It seems to be the word today, but these audits need to be unannounced. The accredited certification bodies conducting an audit under TPP also must notify FDA if they discover a condition that may cause or contribute to a risk to public health. And these notifications provide essential information that the FDA can use to optimize allocation of border and facility inspection resources. So again, one of the ways that we are able to leverage the information through TPP audits is that we do get this type of information about serious risks to public health. So certification bodies must submit regulatory audit reports and any issued certifications to FDA. This is done through an established IT system. And additionally, the accredited certification body may issue a certification for a term of up to 12 months. So again, that is something that is not done for every certification program out there, but is certainly one of the requirements for the program. So recertification would need to occur annually under TPP. And I think one of the things that I'll mention with this is that even though we're leveraging the information from these audits conducted under TPP, the audits do not replace FDA inspection. So that is something that we get a question every now and again. But again, we do use the information in a variety of ways in the agency too that I mentioned, and also to determine our use for our resources, but they do not replace FDA. Okay, TPP is a voluntary program, like I mentioned. It is the user fee based. So I did want to talk a little bit about the benefits for the various entities that may be interested in the program. The benefits for facilities and farms with certifications under TPP are that they would be eligible to work with an importer that is interested in participating in VQuip, right? So that's that benefits of quick or fast entry of products. So this program allows for that quick entry. And while it's not required, like I mentioned, audits conducted by an accredited third-party certification body in TPP can also be used to meet the supply chain requirements in FSBP and the PC regulations. The benefits to the importers then would be similar in that they can apply to participate in VQuip, and that their food or the food that they're importing, can receive much faster importation into the United States. And for the FDA, like I mentioned before, TPP helps us leverage these reliable audits to advance food safety. Because accredited certification bodies participating in TPP must also share specific information about the regulatory audits in that IT system that I said that's already existing. Participation in TPP allows the FDA to have information about foreign facilities or farms that can help inform our use of our resources. Okay, next slide. So here is one of the things that we have in our program, which is the listing of our participants. We have information on this website for both the accreditation bodies and the certification bodies that are participating in our program. And that's actually part of that FDA data dashboard that Glenn mentioned earlier on. It does have, in addition to compliance information, it also has the list of participating ABs and CBs in our program. So there's a public facing webpage. And then we do include the names of like company names, the contacts, and links, as well as the scopes that each is recognized or accredited for, and also the duration of this recognition or affiliation. I guess I'll say that this page here was a great resource for information on TPP. Again, I've just given you the highlights of the program. This is our program website. The TPP webpage includes an overall summary for the program. It has links to guidance documents and user fee information. It also has links to helpful information, including key facts documents that we have, the links to that voluntary audit comparison templates that I mentioned before, where you're able to compare to FDA's food safety regulations. And then we also have a link for the user instructions for both the AB and CB TPP portals. That gets you information on how to access the system and use our IT system to manage your participation in the program. The website, like I said, has information on the user fee. So for the user fee, on or before August 1st of every year, we publish in the Federal Register notice that announces the user fee rates for the next fiscal year. Right before today, I saw that the rates for FY26 were actually linked to our website, which is awesome. The user fees are for accreditation bodies applying for recognition a renewal of their recognition. We also have the user fees for the ABs and CBs participating in the program. But I did want to mention to firms is that there are no user fees that are paid to FDA by the facilities or the firms. Would be fees that would be paid with the specific certification of the new agents to conduct the. We will say that it is, I mentioned before, it's a small program. We have 4 accreditation bodies that are participating in TPP. We have 8 certification bodies that are participating, and a couple of those have dietary supplement scope as part of their accreditation and recognition. And so it is encouraging to see that there's interest for participation in TPP. I want to thank you for allowing me to share a little bit about our program. And I know there is a Q&A question time later on, so I'd be happy to take and answer questions.
Thank you, Dory. We appreciate your time.
So thank you for having me.
Yeah, we appreciate it. Yeah, if we have any questions, hopefully we're getting some good questions in the Q&A, and we'll have you back. Okay. Okay, moving on to our next topic and our next speaker. Continuing on with the FDA theme, our next speaker is also from the FDA. Anyone here manufacture gummies? 1, 2, 3. Okay, there's okay. How many any companies here have gummies manufactured for you on your behalf? Okay, so there's a few more hands. Okay, all right. So our next speaker is going to talk to us about gummies. Our next speaker is Siobhan Gallagher Taylor. She's a national expert for dietary supplements in the Office of Inspections and Investigations at the Food and Drug Administration. And she joined the FDA as investigator in 2015 and spent her career primarily inspecting dietary supplement facilities. So she has a vast knowledge of what it looks like to come inside and see our facilities from the FDA's perspective. And she's going to give us a presentation on what she's seeing from the gummy perspective. So would you please welcome Siobhan?
Yeah. Eventually, at the top of my presentation, you're going to see how my name is spelled, and it's Siobhan. It is not Siobhan, it's not Stephen, it's not Chevron, it is Siobhan. I have very Irish parents. So if you see me later today, it's Siobhan. I'm also going to give a small disclaimer. I walk when I talk. I can't stop. I'm sorry. I'm a very involved person. I also have been sick for the past almost 2 weeks. So I wrote this presentation on a lot of Dayquil and a lot of Sudafed. I'm also still on a lot of Dayquil and a lot of Sudafed. So we're going to have fun this morning. So please bear with me. We're going to go through some things, and if you see me have a conversation with myself on stage, know that I had a conversation with myself at the dining room table while writing these slides. I come from a regulatory perspective because, hey, I work for the FDA. I don't work for industry. Sorry. So I'm going to bring you a lot of questions and not a ton of answers. I did, find some articles and things to put in there. And at the very end of the presentation, I'm going to have a couple people from industry get up and hopefully help you if you've got some questions and provide some answers. But really what I wanted to bring you is if an investigator is going to walk in your door, and especially if I'm going to walk in your door and you're making gummies and you've got the alloy molds or you've got starch molds, what are the questions that you should expect? Hopefully that is intriguing to people. Hey, what are questions that I should expect from the FDA? Yeah? Okay. Gummies are a beast. They're sticky. They're fun. I learned a lot about the very beginnings of gummy manufacturing from the confectionery standpoint, and it was a little bit horrifying. Apparently, they used to use wood trays for starch molds, and good God almighty, who thought a wood tray was a good idea? from the world of microbiology to the world of I don't want like a sliver in my gummy. This is a bad idea. Oh, how am I? Go back. Oh, I don't my picture. Hey, that's my name. See it tiny? It does not look like that. It looks like someone took a whole bunch of letters, threw it at a wall, and whatever stuck was my name. But it's Siobhan. That's my face. My niece took that picture. She is 17 years old and she loves photography. Okay, disclaimer. Because I'm from the government and everything comes with the disclaimer on it. I'm going to set my timer so I don't go over time. This is the agency's interpretation of 21 CFR Part 111 plus a whole bunch of questions from my Dayquil-addled brain. They are always subject to change. We are flexible. You all know this. Everything goes up and down. How we read the preamble is different today than it was 10 years ago. Yeah? So please don't show up 5 years from now and say, Siobhan, you did not bring up questions today that you're bringing up questions 5 years in the future. Well, I didn't think about those questions then. I thought about these questions now. And the views expressed in this presentation are from the Office of Inspections and Investigations. I do not work for ODSP. I do not work in policy and enforcement. I work in inspections and investigations. So those investigators that are walking into your firm and doing the inspections, we train those guys. That's our focus, is the inspections and investigations. And again, this is not going to be an all-encompassing list of questions because I might think of new questions 5 years from now. But these are the ones I thought of now. Okay, I want to talk a little bit about the state of the marketplace. We're going to talk about nutrient stability, shelf stability, sanitation, our favorite foreign material, and then anything else that really didn't fit in those big bucket categories. I'm going to shove in other concerns. Sound good? Okay. So, the nature of the manufacturing process is a beast. It comes with its own unique sets of challenges that are different from tablets and capsules. You have to think about flavor, texture, mouthfeel, chew, your quality aspects, as well as your shelf stability, your foreign inclusions, your microcontaminants. How am I going to meet the regulatory requirements on top of that for something that is basically what I tell my husband, a candy? You're taking your vitamins as a candy. I love when I walk into a tablet facility and I can see like an anatomically correct dinosaur as a tablet. But you can do the same thing in the gummy world. I love my little stars here. You can see like the little carved out points on them. Man, gummies and tablets, you can make them into so many fun like patterns and flowers and all kinds of stuff. Most of your end consumers, and if you want to check my research, please go read all this stuff. Oh, it took a long time. Oh, that was a lot of reading. End consumers, mostly adults. They differ on their numbers, but it's on average 66% adults. In 23-24, the marketplace globally was about $25 billion for gummies, and the people who do all the numbers estimate it to grow about 10 to 14% over a 10-year average. So in 2023, the estimated marketplace is going to be about 52 to 66 billion, depending on whose numbers you're going to follow. So that's a big growth, y'all. And I put the UCLA quote up here because I thought it summarized it nicely. This is why, my husband, my nieces, my nephews, they don't want tablets. They don't want capsules. They want the gummy vitamins. They're not easy to swallow. They don't like the smell. They don't like the taste. They want to chew the candy. They want the, strawberry flavored berry chews with the sugar coating on them to get their multivitamin in. And I get it, you know, the 13-year-old nephew that is hanging out with my husband at home right now, he doesn't want to take his vitamins any other way. Okay. As long as you're getting your nutrients, I'm cool with that. Okay, nutrient stability. Wow, that small writing. Quite a lot of information to shove into this PowerPoint, and in 40 minutes. So, heating process. We immediately think about vitamin degradation. So, temperature, oxygen, light, length of exposure. So, the questions that immediately come to my mind are, is your overall heating process limiting your ingredient degradation? So not only thinking about your vitamins, but I also immediately think of your botanicals. So one thing that immediately comes to mind was I was at an inspection and they were making an ashwagandha gummy. And in that first step with the multi-kettle process, they shoved the ashwagandha in. But they were looking for a ethanolide content to claim in their finished product label. Well, you shoved the ashwagandha in immediately. How are you not jeopardizing the phytochemical property of that botanical when you shoved it in a high heat process immediately into your kettle? Well, you're probably not testing it at the end. That's the answer to that one. So how is your overall heating process limiting ingredient degradation? I'm immediately going to think about that. When are your actives being added? I'm watching for that as I'm doing your walkthrough. Are you staggering the addition of ingredients in such a way as to limit length of exposure? So the first thing that comes to mind for me is vitamin A is highly susceptible to degrading in the presence of oxygen when exposed to high temperature. So not only at what point are you adding in your actives, but at the point when you add in your actives, have you thought through the process of, do I need to have a certain process of my actives get added in this order and in this manner so as to really ensure that when I get to the finished product, I'm going to meet my finished product specification and my shelf stability. And could your overage percentages, because I know you've got a heating process. I know you're putting overage percentages in there for your vitamins and probably for some of your botanicals that you're pulling out those phytochemicals. Could your overage percentages cause a potential health risk if they're super high in there and they're not degrading? I'm going to be looking for those three things. I've spent a lot of time on that side of the stage. Come back over here. I've not lost my voice yet. Going good. Mixing process. Homogeneity. You've got a super viscous, thick material. Okay. Mixing plays a pivotal role. How do you ensure that your mixing time was sufficient to ensure that homogeneity? Because you're gonna limit that length of exposure for your ingredients that are susceptible to degradation. How did you make sure that you hit that minimum mixing time to ensure that everything is going to be homogeneous? That everything that came out of your depositor is homogeneous? And have you ever challenged it? How do you know it's homogeneous? And is your finished product sampling procedure designed to ensure that you obtained a representative cross sample of the entire batch? When you go to take a sample of your finished batch, did you just pull a couple bottles off the line and say, this is representative? Ta-da! No. No. If I pulled 2 bottles from the first, and 2 bottles from the middle, and 2 bottles from the end, how does that ensure that I had homogeneity throughout my batch? Where's the challenge in that? If I verify if I verified that process, you know, there is some validity in that, but I'm looking at the whole procedure, the whole process of that. How did you ensure that you actually had a valid homogeneous batch and at that time was valid for your formula? Okay, heating, mixing. Go! Oh, okay. Oh. Sorry, there were blue slides on here that had headers. There are no more blue slides. It's okay. Maintaining shelf stability. A water activity, pH. I also realized as I was sitting here this morning in my Sudafed riddled brain that I forgot moisture. Because a lot of times in your drying and curing process, you're looking at water activity, you're looking at pH, and you're measuring moisture. So it's important to ensure that water activity, you're probably measuring pH and moisture because, hey, you don't want mold in your gummies, right? It's kind of important. And also, it helps control your microbial concerns, right? So what is your finished product water activity, pH, moisture threshold? How do you know it's going to prevent mold growth? If you're shooting for a gelatin gummy, what is it, 5.5 to 7? Someone. Yes? No one's going to help me out here? 5.5 to 6. Thanks, Jocelyn. Yeah. So if you're shooting for that 5.5 to 6.5 or 6.5 to 7, your threshold is, how do you know that finished product threshold is going to ensure that's going to prevent mold growth in your gummies? How often are you monitoring? Are you just letting it sit and cure for 24 hours and then testing it after that? Are you doing it routinely? Where's your procedure? Let me see your procedure. How do you ensure that all your gummies receive uniform drying and curing? I love walking into those drying and curing rooms and they're like, we stack up the gummies on the trays and we just let them sit. And then I pull off a sample from the top. And then that's what I test after 24 hours. And the bottom of the tray that should never, flipped, moved, rolled, mixed to make sure that there was airflow. What's that water activity looking like? Great. Let me see your procedure. Microbial. How are you maintaining your finished product testing rigor to ensure there's no pathogens of concern in finished products? I know it's low water activity. I know it's high sugar. You still have microbial concerns. I want you to look at the paper that I pulled. So, low water activity foods and foods ingredients have been implicated with increasing frequency and outbreaks of foodborne diseases in frequent years. And they talk about a marshmallow confectionery and chocolate. And we're going to talk about a couple others, specifically in gummies in a second, that have been associated especially with outbreaks of salmonella. So just because it's a high sugar and low water activity doesn't mean we just get to throw our arms up in the air and say, nah, it's low risk. It's like a cracker. It's fine. We good. Don't worry about it, Siobhan. You can go take a break. No, we still have to worry. How are you maintaining your production environment to ensure that it's not contributing to microbial risk factors? I'm still looking at, how are you maintaining a clean production environment? How are you continuing to screen incoming raw materials for pathogens of concern? You are making a ready-to-eat product. Ready to eat. You're going to feed this to somebody. So what comes in your facility needs to be free from pathogens the same way what walks out of the facility needs to be free from pathogens. We had 2 recent recall events, one for potential salmonella and staph, and the other one for potential Chronobacter sakazaki in dietary supplement gummies. I pulled again the paper from the previous slide. Among the foods linked to outbreaks are those containing high concentrations of sugar, low water activity foods. We don't just get to turn a blind eye to micro. Stop turning the blind eye to micro. I sound like Gary. Man, I've been spending way too much time with him. I always tell people I sit more on the chemistry side. He sits on the micro side. He talks about micro. I get to shut my brain off. He's bleeding into my life. Sanitation. I had to break this into starch and metal because y'all, the starch mogul is just different. And this stickiness of gummies just it makes sanitation so important. Those dang sticky gummies, I swear, if they want to pick up something, they're going to pick it up. If you have a production employee that's having a bad day and he's got a rain cloud over his head because his girlfriend left him and he's got those bad juju vibes, that gummy's going to pick up the bad juju vibes and you're going to give it to a consumer and they're going to be like, oh, well, I had a bad day today, man. What is this? Why am I feeling like this? It's because that gummy picked up the bad juju from the production employee who broke up with his girlfriend. Those gummies are absorbing everything. Anything. They're just everything's coming into them. Yes. How do you have a spec for emotional gummies? Emotional capacity. Starch moguls. Basic. How are you cleaning your mogul and how is it verified? I talk about verified, not validated. I always tell investigators in the foods people are gonna hate me. In pharma, you validate. In supplements, we verify. And in foods, someone's grandma walks in the door, vouches for you, and the investigator goes, yep, and walks out. How did you verify it? Because I know you run in CIP through that system. So where is your verification? Where are your verification documents? Show them to me. What is the allowable moisture content in your starch? And how do you test for mold growth? Because you're reusing that starch. And we're going to talk about starch conditioning in a second. How often do you test for mold growth? I'm real interested in that. How do you control the moisture in your production environment? Because I know I'm going in there and it is hot. And I'm always wearing, the full getup, the all the PPE, and underneath I've got my business jacket on and it's hot and it's humid and we all wearing the safety helmets because it's a starch mogul and we be sweating. It is hot. It is humid. How are you controlling the moisture in your production environment? Because again, those gummies with bad jujus, they be sucking in everything. Do you condition your starch? And that answer is yes. No way you just throwing out all that starch. No way. Unless you made a gold, you're not throwing out all that starch. And if so, how? Often. Let me see those procedures. How do you handle allergens? And what does allergen changeover look like? Hey, you just ran something with wheat, soy, fish. Oh, peanut. All right, talk about peanut in a second. Do you reuse that starch? No. No, you wouldn't do that. Someone did. You wouldn't do that. How do you handle that? Show me that procedure, man. How do you prevent the allergen cross contact? What's your cleaning procedure like? How do you remove tailings in your starch? I want to see. I bet you, there is a screen somewhere in your mogul that looks janky. Unless you're a brand new facility. And those hot tailings somewhere, maybe eating away at parts of that screen. I want to check that. I really want to see that. There's a screen somewhere in there that is sorting out those tailings. Common sanitation questions. No, I want to go to metal. Man, these metal molds. I don't like the metal molds. I'll be honest with you. I think the starch is better. I think the starch is easier. I think the starch is cleaner. I don't like the metal. Personal opinion. Not speaking for the agency. This is just Siobhan. How are you cleaning your kettles and your depositors? Basic. How often do you remove the molds from the line to clean and sanitize? Those molds unscrew from the line. Those molds have to be cleaned. You should, Siobhan, FDA, Siobhan, you should be taking them to the dishwasher. You should be cleaning and sanitizing them. You should be watching out for damaging them. And we're also going to talk about that in a second. Where do you clean and sanitize? FDA, Siobhan, dishwasher. Where do you clean and sanitize your molds? And what do you use to clean and sanitize your molds? I spray them with alcohol and then I spray oil on them again. Absolutely not. That is not cleaning. How did you remove particulate? You did not actually physically remove anything. And does your sanitation process prevent damaging the coating on your alloy molds? That coating is not going to get caught by your metal detector. Remember the nature of the gummies? What is it going to attract into it and then be ingested by your customers? Okay, I'm going to start with starch. Remember I said I had fault? Correct, common. Sorry, I got ahead of myself. I really like gummies. What's your sanitation process when your depositors clog during production? The dang vegan gelatin alternative. Can you still hear me? The dang vegan gelatin alternative base that likes to clog in your depositors. How do you clean that out when it happens? How do you maintain a sanitary production environment when you're doing it? Mid-production cycle. How do you prevent batch-to-batch cross-contact during changeovers? How and how often do you clean for your metal gummy molds? And some starch has this, but I've seen it more metal. How and how often do you clean your drying tunnel and fans that blow air on your exposed product? On the exposed product. Remember? How do you keep the airflow in your drying, curing rooms clean and sanitary? I want to see all those records. I want to see all those procedures. Because again, unlike your tablets, unlike your capsules, unlike your soft gels, if there's anything you remember from this presentation, gummies, they're going to suck in everything, all the bad jujus, all the things from the environment, all the things from your employees, all the things falling from the air. You have to think of all of that. Protect them. Okay, starch conditioning. I pulled this out from an article that is from Candy, but I think it's funny that he says the only time starch conditioning he never encountered problems was in Utah. Its relative humidity was 20%. So, I know in your starch conditioning, you're gonna have issues. So if I show up to your facility and I say, have you ever had an issue with your starch conditioning? And you say, no, never. I'm gonna look you dead in the face and say, lies. Lies. What I'm gonna look for and what I'm gonna ask you about your starch conditioning is temperature. So there's a very specific temperature starch needs to be at to get that nice gummy structure. Hey, do you test the temperature of your starch? Where do you collect your sample from? Moisture, do you perform moisture tests such as loss on dry? Hey, oil. I love one of the articles was like, how I know if I have too much oil in my starch is I get my tray, I take a big wad, and I chuck it at a wall. And if it sticks, it's too much oil. So I know I got too much oil, man. No, you probably have a procedure for slowly adding back in new starch. Hey, how do you track that in your batch record, and how are new lot numbers being tracked? Foreign material. How are you screening for broken pieces like from your trays, like your plastic trays? Bristles from brushes inside of the mogul? Like when it levels out the starch on the tray, there may be a bristle that follows behind that blade. Bristles from brushing it off after the demolded gummies come out. Micro. Do you conduct any micro testing on the starch during the conditioning process? You're reusing this starch during your campaigns that you're running. How long are you reusing this starch? How often are you taking these tests? I'm interested in all of this. No, go back. Oh, hey. So at the bottom, it's supposed to say metal gummy molds. We have to care about metal inclusion. This is not one firm. This is not two firms. This is 3 separate firms. This is 3 separate companies you're looking at. And can anyone? I want to raise hands. Can anyone see damage to the Teflon coating? Raise your hand if you can see damage to the Teflon coating. Raise them high. Raise them high. Higher. High. Bold. Nice and bold. Yeah. Yeah. Yep. It's easy to get damage on these things. From not cleaning them appropriately, not storing them appropriately. You know, the pins in the bottom that help poke the gummies out of there? If you don't store them appropriately, they're going to scratch off that Teflon. If you try to stack them together in the dishwasher, they're going to scratch that off too. You know what your metal detector doesn't detect? Teflon. You know what that gummy's going to do? Yeah. Oh, this is the allergens one. Sorry about allergens. Yeah. This is the allergens one. We'll talk about metal in a second. These are 4 recall events for allergens in gummies. Notice 1 is for wheat and 3 are for peanuts. Hey, be aware of cross-contamination in your facility, with your ingredients, with your starch. Just a heads up. 4 materials. Okay, back to the metal. 21 CFR 111 365I says, requires that the necessary precautions you take during the manufacture of a dietary supplement to prevent contamination of components or dietary supplements as a finished product include using effective measures to protect against the inclusion of metal or other foreign material in components or dietary supplements. Now, this is the section that everyone likes to say, oh, this is the magnets and the metal detectors. Yeah, you know what else is in here? Filters, traps, and strainers. That's I. Because miscellaneous materials, foreign materials, as well as metals should not be in your product. And you know what the gummies like to do? Everything. Including if you have those nice fiberglass tiles for your ceiling that quietly rain down fiberglass particles. Guess what those gummies are going to do? They're going to have fiberglass particles because they're going to go, watch out. Starch molds. What controls are in place? Put in the metal side. It should really be in both. And I was like, well, I'll put it on this side because I'm going to suppose that there may be metal pieces as well as plastic pieces. Preface. What controls are in place to prevent metal from the screens and brushes used in the mogul during starch conditioning from contaminating the gummies? So, when you're heating up that starch and then bringing it back down and cooling, you're going to have different screens and potentially brushes in there depending on your machinery. How are you making sure that none of those little bits and pieces, or when you're sorting out and demolding the gummies, how are you making sure that none of that is getting into finished product? Or how are you visually checking and inspecting that? How often do you visually examine screens and brushes on the line for physical damage? Alloy molds. How often do you inspect your molds for damage? Those 3 pictures I showed you, how in the world, at 3 different facilities, did it get that bad on every single mold, on every single line? And no one noticed. And no one said anything until Siobhan walked in the door and said, "Good God Almighty, what the hell are you doing? Someone needs to be checking for damage." That was a lot of energy I just expelled. Miscellaneous materials. I put this up here because we're going to talk about things like insect parts, wood, dirt, fiberglass. I love the preamble. You'll see later when we do the round table. I have a new birthday present, and it's the printed version. In the 2003 CGMP proposal, we stated that we were not identifying defect action levels for the types of contaminants for dietary ingredients because there are not enough data available to identify an appropriate DAL for most dietary ingredients. And the defect action level handbook says if there is no defect action level for a product, or when findings show levels of, or types of defects that do not appear to fit the action level criteria, FDA evaluates the samples and decides on a case-by-case basis. So, what do you need to do? What is your limit for foreign material in the finished product? Think of safety first. Consumer safety first. Is it based off of a scientifically valid source or rationale? And I want to pull out a pointer thing. Oh, I do. Page 34838 in the preamble. Even back then, they recognized in the first version, we stated that the types of contamination, because this is the section where they're talking about limits on contamination, could include filth, insects, or other extraneous materials. They recognize that those are limits on contamination that could be in there. They took it out of the final rule of the regulation because it's informative. They left it in the preamble because it's informative and took it out of here. But recognizing, hey, you need to think about this. You need to consider this. And gummies, what are they going to do? Suck it all in. So how often do you test your finished product for foreign materials? How are you limiting the inclusion of foreign materials coming from your raw materials? How are you limiting the inclusion of foreign materials being introduced by the production facility? Think of what's coming from your air, from the employees and their garbs. You want to know what's lovely to see when you melt down a gummy and you look at it under a microscope? Those PPE lab coats we wear, all those little fibers that look like worms that the gummy went and sucked right up. And now under a microscope, it looks like there's worms in the gummy. Consider that. Foreign object recalls. We had 3, 2018, 2021, 2025. I thought it was mean to put pictures of the foreign objects, so I just put gummies. Also, I like color. 320B, you must identify and use appropriately scientifically valid methods for each established specification. So you're going to establish specification for limits on contamination for foreign materials. Just remember, use a scientifically valid methodology. There are ones out there, like AOIC has one for candy. Supplements as a food. This is basically a candy. This is Siobhan saying this. Other areas, additional areas of interest. Testing. Does your specification address identity, purity, strength, composition, limits on contamination? Remember that 70E? Hey, we have to set a specification, even for a finished product gummy. How are you conducting finished product testing, especially for identity, strength, and composition? Have you selected a scientifically valid testing methodology for your finished product, which can ensure the consumer is receiving what is listed in the supplement facts panel? There are procedures out there, there are labs out there for getting the gummy down into a reduced state and testing it for the constituents. I want to remind you of this 75D1, this exemption here, that starts with saying you have to establish there is no scientifically valid method for testing or examining. It doesn't start with, this is hard. It does not start with, this is expensive. It starts with, it doesn't exist. And it exists. So if I walk in your facility and you try to pull the, I can't do this, it doesn't exist, I'm immediately going to say, well, I respect that you believe that, but you're incorrect. Children. Always something we have to think about. For vulnerable populations such as children, did you set upper limits within your specifications for ingredients that could prove toxic if over-ingested? I put things like fat-soluble vitamins, selenium in here. Do you have melatonin products for children? That's always a hot button item for us. Do you manufacture products for children under 4? That's something we are really going to hone in on. And because remember I said it's basically a candy wrapped in sugar. It tastes good. Have you thought about, could a child become seriously ill if they unintentionally ingested the whole bottle? And I put this Journal of Medical Toxicology up here just to highlight the majority of dietary supplement exposures, 70%, occurred among children younger than 6 years old between 2000 and 2012. So think about it. What happens if the child eats the whole bottle? Botanicals. During blending, are you treating botanicals the same way you are as vitamins? Especially if you are considering the importance of the phytochemicals in it. The botanical is important. Don't just throw it in there as you would like the citric acid. Can treat it the same way you would a vitamin. Could the botanical ingredients being used be bringing in excess amounts of filth, including insect parts, wood bits, human hair, dog hair, rodent hair? Remember, these are agricultural commodities. Is there a way that you could monitor, control, do the supplier qualification to control for these things? Build it into your foreign material criteria. It is an agricultural commodity. Consider that. And then I pointed out, again, 34837, we say that the manufacturer must be aware of potential contamination regardless of whether due to filth, insects, microorganisms, or toxins, and to test or examine as appropriate the components and dietary supplements for those types of contamination that may adulterate or that may lead to adulteration. Okay, so I know I have 2 minutes left. I'm going to use the 2 minutes. You're giving me the 2 minutes. I am in a regulatory position, but I have friends who don't work in regulatory, they work in industry, and I'm going to call on their help. So Lance works for Unilever, and Nora works for IBC, and Jocelyn, you did not run away on me. She did? Steven, you got to go get Jocelyn. I'm going to send you on. They're going to come up here, and I'm going to ask you guys if you have questions, and if you have manufacturing questions. They make gummies. And so if I don't have the answer, yeah, hopefully if I don't have the answer, they have the answer. So, does anyone have questions? Or did I just, you all knew this information? Yeah, you ran away from me. Oh, we got no question. This never happens. Oh, Mom, I know Mohammed. What? Does 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 anybody have any questions?
So, Siobhan, there was a question online about how gummy manufacturing related to the jelly bean rule. And
The jelly bean rule?
yes, the one where you have to fortify nutrients back to more greater than 50% of the original value. So,
I have no idea. I will fully admit I have no idea what you're talking about. That's great.
all right.
Anybody else at the table know what the jelly bean rule is? Anybody have a question? Like literally, now is your time.
Back to your statement about verification versus validation, can you shed light on what the expectations would be for process validation to make sure that it meets all everything that you talked about from testing to uh yeah, testing.
So your question is about like what would verifying that you're testing.
Are there expectations for a process validation for the gummies? You know, like how like you would have that for like you mentioned the drugs versus the supplements. Like in the drug world, you're doing verification, a validation of the process where you're running the process 3 different times and proving
Oh,
same exact results each and every time. Is that expected also for
the regulation does not have a requirement to validate the process itself. I mean, that's part of why we have it's set up with the quality control section and the specification section and the testing and the MMR and the BPR. The regulation is kind of beautiful with the checks and the balances. We call it a quality control system, and systematic thinking through that instead of a validation system.
I can help
Did
with
you
that.
want? Yeah.
Yeah.
Well, it doesn't matter if it's gummies or any other type of dietary supplement. There are guidance on what method validation is. There's a USB guidance on that. It means that your method must be specific. It must establish accuracy and precision of the method. You must establish limit of quantitation as well. Now, if it's a new dietary ingredient in the gummies that you've never ever done any testing for, you must do all of that. Now, if you already have a method, say you have a method of vitamin B12 in a tablet form, and that method has already been validated, but now you're using it in a gummy, you must verify that that method is suitable for its intended use. So what you do, whether you do 3 or 6 replicates, it doesn't really matter, but as long as you have the data to show that that validated method is suitable, is fit for purpose for that particular matrix. So that's what verification is. So that's the clear distinction between what a validation is and what a verification is.
and then for some botanicals, like the methods don't necessarily like they'll have to be developed. They like the full validation is not available, then what you're basically saying is that you can do that for maybe a marker of that botanical ingredient, not the full ingredient, right?
For botanical extras, yes, there are specific analytes, like I think Siobhan mentioned about ashwagandha. And if the methanolites are your compounds of interest, you must validate the method to show that your methanolite glycosides or aglycans are present and the method is accurate, precise, and fit for purpose. And if you have that in a two-piece capsule, but now you have ashwagandha in a gummy product, you will have to demonstrate, that's the verification, you'll have to demonstrate that that method is also suitable in a gummy matrix, which could be problematic because the gummy matrix is not a simple two-piece capsules, right? It has other excipients that may or may not interfere with your product and your method. Does it help?
Yeah, let me add to that. So when we talk about validation and verification, and not only in a gummy, like Shuman was saying, in Dietary Supplement 111, we're not required to do validation. However, best practice, and I think a lot of us here, we do some validation. Method is one. We also do equipment, like IQ, OQ, PQ. If we have new equipment, process is something that probably some will do and some will not do, depending on the complexity of your product. So if you have high actives or low markers and high markers, you want to make sure you do at least content uniformity, or you can do a full-blown process validation. Does that make sense?
Yeah, absolutely. And
Okay.
then one last question about cleaning and sanitization validation. Those are also not formally required, but it's up to the manufacturer whether or not they can validate them, but then verification is what's required.
Like we said, it is not required by 111. But if you are a contract manufacturer, so I'm talking to contract manufacturers, right? Your customer will require you to do that. So then that's another level, right?
Yeah, and also if you have allergens on the line, you'll want to validate that your cleaning process will take care to remove those before you run your product that doesn't have it in there, for sure. And that's just sanity protection for you.
I just wanted to add also one more to the validation. And when you mentioned that it's really not clear in 111, 111, 70, and 75, like you pointed out, says you must establish specifications for your materials as well as your finished products. The 111.320 actually mentioned specifically that you must have a scientifically valid method, meaning fit for purpose, whatever you want to describe it. The bottom line is that you must validate your method that you're using to determine potency strength.
There's another question from the gentleman after in front.
Yes. Thank you, Nora. Siobhan, thank you for that riff.
Mike, what's up?
That was quite the riff. Thank you for the information and presentation. Quick question with the environmental contaminants that you called out, which seem to be fairly significant within gummy manufacturing. Is there a new, including outfits, lab coats, masking, sealings, molds? Is there a new standard recommendation on material usage go forward in the gummy manufacturing space to try and overcome or minimize some of those environmental issues that you discussed?
Do you want the FDA response or do you want the Siobhan response?
I like you keeping it real, kind of like you have all morning.
The FDA response is going to be you cannot have foreign materials in your product, the 365 from subpart K. The Siobhan response is they make awesome lab coats now that are out of like the poly material that do not have the fibers in them that will give you little worms in your gummies. Hey, panel, what are you doing in your facilities?
Okay, so I think a number of facilities in Gummy has already been established, so it's a little difficult to redesign the facility. But for some who are just starting to build their gummy facility, I think we need to take this as a learning. It has to be quality by design. So when we say quality by design, like materials. So what are our funnel? Is it made of material with asbestos? Is it made of material with fibers? What are the lab coats? Like what Shubham is saying.
Have you covered your line? Is that
Exactly.
possible?
So we have canopies in our line. Are there like foreign material floating around everywhere? And I bet you if you have like a microscope there, you could see all of those. And we heard from Shubham, gummies are kind of like absorb everything. So
There's one thing you bring back.
So every part of our process where there is exposure of the product, if it's not covered, it has to be contained. So if it's a line, filling line, there has to be canopies in it. And you may want to, and another thing is we need to start testing for foreign contamination. And I think this is not something that we have required yet, but this is something that we have to do. And like Shuman was saying, there is an AOAC method to do field testing, very simple test method. So we should start doing that.
Go find those pages in the preamble that talk about the fill. Oh, read those. It's great. Fabulous. Also, if you don't read the preamble is awesome. Please read the preamble.
Yeah, and a lot of gummy facilities started off as confectionery facilities making candies, and they're older facilities often that are have equipment that wasn't under the sanitary design for
In wood
dietary.
trays, Lance. In wood trays.
So that's why when you're selecting those partners and qualifying them, look at their equipment and see. Also, you want to look for minimizing handling, right? As much as you can automate a process, that also helps to reduce your potential for contamination from your hands for Staph aureus or for Sakazaki, right? Or for the material from your lab coat.
Any other questions?
I have a question. I have a quick one.
Steven is cutting us off.
Yep.
We will have
Ever before? You guys have seen me with the schedule before? Okay, these guys are killing me. Okay, we are way over schedule. We have time slotted for Q&A. So those questions you have, please hold them. Okay. And you guys have been sitting for a long time. We have people online. It is break time. Okay. So I got a schedule to keep. So get out of here. Wait. 15 minutes. Okay. On. What's that?
Great.
Yeah. Save your questions. Save your questions. We'll get back to you. 15 minutes. Please be on time because we are behind schedule now, and we've got a lot of information to cover. Thanks. Okay. Thank you, everyone. We are ready to resume the program. Thank you, everyone. I hope you enjoyed the break. What you will notice at this event is we will feed you. Okay. All right. So please eat the food because we always have too much. So they're going to leave that food out there for a little while. So if you want to, get up in the next hour or so before lunch and grab more snacks, feel free to do so. Okay, but we're going to go ahead and get started with the rest of the program. But before we jump into our main speakers, we want to talk about our platinum sponsors. Okay, we always give our platinum sponsors an opportunity to come up and give a short presentation during the event. Okay, so if you would like to have that opportunity for your company, talk to Nora or Lance about being a platinum sponsor, and your company will have a representative come up and address the seminar. So right now we are going to call up a couple of our platinum speakers. The first one is IBC. I'm not sure who, Mike. Okay. So please welcome one of our platinum sponsors with a message from IBC.
Thank you, Stephen. And membership. I'm actually going to follow Siobhan's lead and take it for a little stroll. But when Nora asked us to speak for a few minutes, I'm thinking, what are the subjects I want to cover? Let me think. The Fed, interest rates, Israel, Palestine, my love of my hometown, Philadelphia Phillies and Eagles. Gary recommended we talk about the Philadelphia Eagles. No, kidding. I'm going to be short and sweet. Again, my name is Michael Nash. I am the Executive Vice President for Commercial Revenue. I've been at IBC for a year. I had the privilege of working with Nora Dow, and I report directly to our CEO, John Torfey, who also is here today. But let's be honest, we all report to Nora. She keeps us on the rails, and she does it, her leadership command, she does it with expertise and grace. Nora, thank you for providing this venue. From an IBC perspective, it's a very exciting time. We consider ourselves as an ideal growth partner, and we do have a global reach. I did what you told me. Oh, the green button. Should I go back? There we go. Sorry, Stephen. So we are the largest in size CDMO in the VMS market. We have a global presence supply chain, which I'll speak to in a second. All in one end-to-end service portfolio. We're very fortunate to have some wonderful partnerships with some of the best and largest customers in the world. Our scale and our global presentation helps us with a very strong proposition in cost efficiencies. And we also have in-house research and design innovation teams. And we have a elevated and maniacal focus on quality and R&D, now led by our fearless leader in that sector, Nora Dell. So I talked a little bit about our global presence. We have one sales and business executive office locally here in Newport and in Irvine. We have 10 manufacturing sites across the globe. 4 research and design centers. We currently have over 5,000 employees globally. And if you look at this map here, we have our manufacturing is located in Greenville, South Carolina. We are also in China, we're in the UK, and we are in Canada. So we have a global reach. And what that does for us, obviously, the scale affords us some benefits in cost efficiency and expertise. But it also gives us optionality with our customers, which really helps decipher. Here is a picture of our supplement dosage forms that we are experts in. We obviously have a tablet capability. We have a growing gummy capability and a new gummy operative in the US. We have the capability within probiotics, powder, hard capsules, soft gels, chewables, and liquids. We are very immersed in brick and mortar e-commerce and pharmacy partnerships. We currently have our product portfolio that we've manufactured in over 26,000 retail locations. So again, we have a spread and scale, which enables us to really be cost effective and provide many diversified options to our customer base. All right, running out of juice. Sorry, Stephen. This is the Nora pitch. So again, we are involved and regularly looking to evolve our certification platform in facility certifications and our product certifications. And we are very capable and ready to acquire new. And the thing about having Nora at the forefront as our leader here is we're on the cusp of what's coming and easy to identify where we need to invest and how quickly can we get new certifications under our belt. This is something we at IBC take very, very seriously, and it's only been elevated to an entire new level since Nora came back on as our SVP. Yep. Thank you for your time. I guess we're going to hand it off to Robert.
Okay, so before we move on to our next presenter, we have one more platinum sponsor for a quick message. We have Michelle Zong from WeSong.
Good morning, everyone. My name is Michelle Zhao. I am the Regulatory Affairs Manager at Huisong. It's my honor, and I'm very glad to be here representing Huisong to attend this wonderful event alongside with many respected regulatory experts and industry leaders. So a little bit about our company. The company was founded in 1998. We specialize in R&D and manufacture of premium quality natural ingredients with the integration of quality standards and modern manufacturing technologies. We've been serving and partnering with world-leading companies in the food and beverage industry, as well as the dietary supplement industry and pharmaceutical industries. For our products include botanical extracts, herbal powders, fruit and vegetable powders, ginseng products, bee products, as well as TCM, which is traditional Chinese medicine ingredients, and many of which are non-GMO and certified organic. With more than 25 years of experience in natural ingredient innovation, Huisong has transformed into a global company today. With a deeply integrated supply chain supporting an extensive portfolio of products. In addition to our global presence, our U.S. facility is located here in Orange County in Santa Ana to serve the North America region. Our plantation sites are in mainland China, and we have a distributor facility in Japan and also in Indonesia. So thank you again for this wonderful opportunity to represent Huisong. I'm looking forward to connecting with you all. Thank you.
Switch over. Okay. Okay, so back to our main program. Speaker, a very distinguished individual that we have coming to you. It is Robert Durkin. He has a rich background as the former acting director and deputy director of the Office of Dietary Supplement Programs at FDA. He is now, he's also a lawyer, and he works for AWG, Amin Wasserman Gurnai, and he is going to give you a presentation on food additive and contaminant regulation. So would you please welcome Bob Durkin.
I miss when there wasn't that much gray on my beard. That kind of shames me to start a little bit, but really happy to be here, and it's wonderful to see how an organization like this has taken root. And I have to admit, when I walked in the room this morning, I was pleasantly surprised with the folks that are in the room and the number of people that are in the room. This is a type of a community experience for the dietary supplement community where we get to exchange on a very personal level. And the information that's been shared today with the FDA folks and the folks that are going to present, this is real world experience that translates into pragmatic guidance for what you do in your daily lives at work. So this is really, it's a wonderful experience. I really appreciate being here to talk. When I was asked to speak, I was told that I was going to be what was standing between you all and lunch, and to take about 30 minutes and have some slides. And I was asked to speak about color additives, food additives, and contaminants. And I made a decision to sort of cut out the contaminants part, because y'all in here either comply with 117, where you have a food safety plan and conduct hazard analysis, or you comply with 111 through 111, 70, 75, and 80, where you set specifications for contaminants. I don't think there's any magic sauce that anyone could tell you about contaminants specifically, other than if you're aware that they might be in your product and your components or in your finished product, that you need to set a specification and test for them. So I thought contaminants was sort of the low-hanging fruit for this discussion. The current administration has sort of set a rhythm and set a precedent where food additives, chemicals, things that make it into our food supply, they don't like them. And I'll try to point out in my presentation sort of a cadence and a rhythm that's been set. And I'd like to ask, before the current administration, how often did food colors come onto your radar? How often did you care about them? Were they something that you just took for granted? They were in your formulation and you didn't consider them, you didn't reflect on them, and now all of a sudden it's something that we're talking about. I mean, right now we're dealing with an administration where the general public knows the name of the Secretary of Health and Human Services. I don't know how often that's happened in the past. The general public understands that HHS's priority is the food supply. I don't know that the F in FDA has ever been so prominent before as it is lately. I mean, foods is really, really what they're focusing on. So I think it's an exciting time for us all to be in the food space, specifically dietary supplements. Um, Color additives. All right, I'm a lawyer. I was at the agency, so of course I have to throw the act up there to start. 201T is the definition of a color additive. It simply says anything that its primary purpose is to impart a color is a color additive. By law, color additives must be shown to be safe and be listed in the CFR before it may be used. Color additive petitions, a cap. There is no grass route for food coloring. Everything has to go through a petition. All right, you cannot grass a color or grass an ingredient into your food, your dietary supplement to impart a color if that's its intent through the grass paradigm. Okay, we'll talk a little bit more about that later. FDA has established regulations, CFR 21 CFR 70 through 80, part 70 through 80. As you're working with color additives, you really want to become familiar with these. I'll talk about that in a little bit. Just because something is listed as an approved additive doesn't mean that you can use it in your food or in your supplement. You have to be very specific about the intended use. Some color additives have an intended use for general food. That would include dietary supplements. Some color additives have an intended use that doesn't include supplements, and you cannot use them in your supplements. I have a couple stories about that a little bit later that I'll share. Again, each regulation identifies the color additive, the food it could be used in, and the intended use. Color additives are a little different, where most batches of color additives have to be certified before they can be used. You actually have to make a lot and then certify it through FDA before you can put it into commerce. Where does FDA kind of gig you when it comes to color additives? It's not a huge priority as if it's an approved color additive. I don't think FDA is looking too deeply. You might come to answer questions about what food color additives you're using during an inspection or 483. If they look at your label and if they go over your GMP process and they see that you're using something for color that isn't an approved food additive for use in a dietary supplement, it will be an observation of the 483. And also import detentions. A lot of times a product will be imported as a dietary supplement, and when the folks that monitor, they look at the lines of food coming in, they'll see that you're using a food additive that you shouldn't in a dietary supplement. And I got to tell you, there's no way getting out of that. It's very hard. It's likely they won't release it. So I think a lot of the peril is either during a GMP inspection or during an import. Right before I left ODSP, there was a magnesium product, a dietary supplement, and I'm also a pharmacist. And this magnesium product is a fast mover. It was one of the top 200 drugs, or one of the top 200 articles. Article is a great word when you work with the Food, Drug, and Cosmetic Act. Everything's an article. But it was one of the top 200 articles that was dispensed by pharmacists on a daily basis. It would be almost within arm's reach. So I had dispensed this thousands of times as a pharmacist, and the GMP inspection figured out they were using a yellow dye that wasn't approved for dietary supplements. The product had been on the market for 20 years before this, and they were going to stop this company from distributing about 12,000 units they had, which would have bankrupted this small company. And cooler heads prevailed, and we granted enforcement discretion as long as they gave us a plan to phase this unapproved color additive out of their products. And when we did it, the individual, it was a family-owned company, he was very grateful. And then I went into private practice, and about a year later, I saw him at an event, and he cursed me to the ends of the earth for putting him through that, because he just didn't understand why an unapproved food color couldn't be in his product, and he just thought it was, the agency being technical. But there was no basis for safety for its use in a dietary supplement. Import detentions. It happens a couple times a month where we'll get a phone call, somebody's dietary supplement or food is hung up because it contains an unapproved food color. And there's no working around that. That's going to be exported or destroyed. They'll stand their ground and they'll not allow you to import it. So the moral of the story there is, as we go through this now, we understand how color additives are on the top of the menu for FDA. A lot of folks are in the process of reformulating. As you reformulate, you want to specifically go to the regulations and make sure whatever your alternative coloring method is covered in the regulation, and its intended use includes dietary supplements. Color additive petition is just like a food additive petition. It contains the same information. When FDA rescinded, I think it was red number 3, and that happened before the Trump administration. That happened in the last administration. They had to go through the same process internally to review that they would go through to approve a food color. So they decided based on the information they had that I believe it was red number 3 was no longer going to be authorized. Does anybody know the regulation or the statute that FDA relied on to revoke that authorization? The Delaney Clause. And that should scare the crap out of everybody. The Delaney Clause is pretty loosely written, and it says that if an article is shown to be carcinogenic, it cannot be a food additive. It cannot be a grass ingredient. And when they revoked red number 3, it was in animal models that it was shown to be carcinogenic. It wasn't even in a human model. And this was a product that had been on the market for years. So the Delaney Clause, I know from firsthand experience, FDA loves it and hates it. They love it when they want to use it, and they hate it because it could just have such a broad scope. It could apply to so many food ingredients. So that's something to watch. And I got lucky. It was red number 3. It's up there on the screen. And then February 13th, President Trump signed his executive order establishing the MAGA Commission. On March 10th, Secretary Kennedy said in a closed-door meeting that he wanted industry leaders to remove artificial colors and dyes from food. The 20th, they're giving you some tools now to help you do this. This is one example, the chemical contaminants transparency tool. So they're providing some tools to understand what might or might not be allowed in food. And then on April 22nd, they dropped the bomb and they announced that they wanted to phase out petroleum-based colors out of food by 2026. Some of these, red number 2, it's not widely used. That's the first one on the menu. Just this week, they ramped up the speed on Orange Bee. I don't think Orange Bee's really been used in 20 years by anybody. So that's not a big deal. But as folks are looking at their colors and they want to replace them, they need to be sure they go to the CFR, they formulate. You want to have a really good administrative record as to why you're doing it, have a basis, and just be ready to answer a question in case you're asked. It's not just the feds. The states are into color additives also. It's too much to go through in the time that I have, but you need to be aware of what the different states are doing, in particular California. California always leans forward with the statutes and its regulations relative to the Sherman Act. So you want to be sure you understand state requirements as well as federal requirements. All right, color additives was not my bag when I was at FDA. All right, that's just wasn't something I did very much. But food additives, being an ODSP, working with dietary ingredients, food additives, grass ingredients were your kissing cousin. And I worked a lot with OFAS to understand that we weren't approving dietary ingredients contrary to the way they would evaluate science for food additive petitions or grass notifications. So I'm much more comfortable when it comes to food additives. And, again, I'm a lawyer. I was at the agency, so 201S is the definition of a food additive. And it's basically anything that could or will be incorporated into a food as a food additive. Section 409 requires prior market authorization before you use a food additive. It's a food additive petition. A food additive petition is it contains a lot of material. It's the safety of the manufacturing process, the safety of the ingredient, based on its intended use. It's clinical studies, it's animal studies, it's common use, it's experience. It's a very in-depth process. It requires the agency to look at your information in 4 corners of the paper as well as whatever else they could find in the public domain. The food additive process, you submit your petition to FDA, they review it. That's going to take months, probably 6 months, maybe a year. They'll work with you to amend the food additive petition if necessary. Then after FDA agrees or disagrees with your food additive petition, you'll get a good day or a bad day letter. And they actually will agree. That's the difference. One of the differences between this and a GRAS notification. They'll agree that it's safe, but you still can't use it. So you'll get a letter from FDA saying, hey, we agree. We approve this food additive. We're going to promulgate a regulation. And once the regulation publishes, then anybody can use it in the food supply. And it's going to take at least 6 months. In the old days, 6 months to promulgate a regulation. So they're going to put out in the Federal Register for comment. People are going to comment. They'll review the comments. They'll go to a final regulation. They'll either make a new regulation or add that food additive to the existing regulation. Food additive petition is going to cost you probably about $500K, and it's going to take you at least a year and a half. So that's the process for a food additive petition. It's pretty similar to a color additive petition. So I just said everything that you incorporate or could be incorporated into food is a food additive unless it's not. All right, unless it's not. That's basically the way it's written. Here's 201S. So anything that's incorporated in food is a food additive unless it's a color additive, highlighting that, or it's the one that's near and dear to our hearts. Something that's under 201FF, dietary ingredients. So dietary ingredients are excluded from the definition of a food additive. They're therefore excluded from 409. And this is an interesting issue for the states because a lot of states right now are regulating against dietary supplements based on them being food additives. It's almost like Back to the Future. I'm working with 2 clients right now who have products being harangued by state auditors, state inspectors, because they're saying they're unapproved food additives when they're not. They're dietary ingredients. The problem is a lot of these states incorporated the Act pre-Deshay, and they didn't update their incorporation of the Act post-Deshay. So they have 402, but they don't have 201, 201FF. They don't have 402F. And by their statutes and their regulations, a lot of these states, it's more than a handful, the only way they could regulate dietary supplements is as food, and dietary ingredients as food additives. And every now and then you'll get a state auditor, an inspector, or even someone at the department level who goes sideways and tries to pull a dietary supplement off the shelves as an unapproved food additive. And it's always an interesting conversation to work through how they regulate food with their, California is the Sherman Act, and then there are regulations, codes promulgated under the Sherman Act. Pretty easy. Other states, it's very nebulous. It's hard to figure out how they regulate dietary supplements. The fact that on that dietary ingredients is really important. The other thing that people want as exclusion of the definition of the is something that's right. It's right here. It's right in the statutes, the will of Congress. We'll talk about that in a little bit. If such substance is recognized, say, by qualified experts, it's not yet. Therefore, it doesn't require pre-notification. That's our GRAS paradigm. So how does GRAS work? GRAS is either you can do a self-GRAS determination, you go to market, or you can decide to take that determination and submit it to the agency. You go to the agency. This is where I got a little lazy with my slides. I didn't tease each of these out as to what the differences are. But I'll ask the room, what's the difference between your GRAS dossier, GRAS determination, and a GRAS notification against the agency? How would you articulate the difference? What's the difference between those two documents, those two bodies of knowledge? Anybody? No. No. It's a trick question. There's no difference. There's no difference. Same way that you would determine that an article is GRAS is the exact same way you would submit a notification to the agency. There's no difference. Science. It's when you put it to the notification dossier. Your dossier has maybe 70 pages that articulate how your SME, your toxicology is determined and safe. And then maybe there's a panel, a panel went in and reviewed it. And they agreed toxicologist determination is generally recognized in the state. The G generally recognized in states means it's a kumbaya. It's a kumbaya. It means everything that an expert would need to come to that determination is publicly available. Good data, the bad data. Qualified experts will find all that data, review that data, and come to a conclusion that for the intended use, it's very specific, for the intended use, how much, how often, what, what's the background exposure, what's the exposure going to increase based on the introduced product. An S&E in that space can find all the generally available data, review it, and come to the same conclusion that your toxicologist did that wrote your dossier, or your panel that agreed with the dossier. That's the G. It's a kumbaya moment where we're saying, yeah, pretty much everybody in the space that's qualified would agree that it's safe. Okay, so that's what a GRAS determination is. A GRAS notification is when you take that kumbaya moment and you send it to FDA to see if they're going to disagree with it. That's a GRAS notification. GRAS notification, it's hard to say how long it's going to take at FDA. Some have been there for years. Some of them are just dying on the vine, and some of them get turned around in months. It kind of depends on how well it's written, the subject matter, how unique the ingredient is. The cost for a GRAS determination and GRAS notification, depending on what you know about the ingredient, could be $30K. If there's gaps to be filled, it could be $1 million. It depends what you know about the ingredient, it depends what's out there in the space. Now, when you fill a gap, what you fill the gap with has to be publicly available. If you have to conduct a study, if you have to conduct some research, you have to make that research generally available. Otherwise, you cannot use it in a GRAS determination. You can use commercial confidential information to support your decision for a GRAS determination, but you cannot base it on commercial confidential information, if that makes sense. That's one of the differences between a food additive petition and a GRAS determination or GRAS notification. I get asked a lot, and we'll tease this out maybe later if we have a discussion. Why would I do a GRAS notification? It's a business decision. As of now, it's a business decision. It may become a necessity in the future. We'll see. But it's really a business decision. If you do a good GRAS determination, if you hire a good toxicologist to do this, if you decide to have a panel or not, you've satisfied your requirement and you can go to market. The only reason right now I see to flip that to FDA as a notification is it's going to help you sell more of that ingredient, or it's going to help you market it, or it's going to make your partners more comfortable. The downside with a notification, the downside with a petition is once a petition, because once a food additive is in the regulations, and once a GRAS notification is posted on FDA's website with a good day letter, anybody in the world can rely on that as their basis for safety. You've just given away your time and your treasure to the world. So I think it's a business decision right now whether you want to flip a determination into a notification. What is it? What do you get for it? Is the juice worth the squeeze? You might save some cost, believe it or not, if you're going to do that. Because if you're going to do a GRAS determination and you hire a good toxicologist, you don't need a panel because FDA is going to be your panel. So you might be able to shave 10, 15, 20K off of your GRAS determination by not using a panel, but make sure you're investing in a good toxicologist to write that determination, to write that and put together that dossier before you flip to FDA. So to come full circle, the differences between what you base your determination on and what you would give to FDA as a notification is nil. It's the same. We'll talk about why that's important later, because also on March 10th, they came out with this little doodaddy where Secretary Kennedy instructed FDA to get rid of the GRAS loophole, well, not the GRAS loophole, but to get rid of GRAS. Okay, he wanted to phase out GRAS. This has been floating around Congress for a while. Delario introduces it every few years. Some other folks introduce it every few years. But now we have a Secretary of Health and Human Services who's made it a priority for FDA. He told them to get rid of GRAS. So what's the future of GRAS? How can this be done? Can it be done legislatively or through a regulation? So this is some recent legislation that was put out by Markey and Booker. And, in a nutshell, it would require companies to submit GRNs for every GRAS article. Nothing's grandfathered in. You would have to submit them within 2 years. This is pretty serious stuff. And you say, well, that'll never get through. And the thing is, I know from talking to people that this bill was floated through FDA before it was introduced in Congress. So FDA saw this bill and had a chance to opine on it before it was introduced. So that's just interesting optics. What about rulemaking? What about regulation? Does FDA currently have the authority to close grass? Do they have the authority to close that off? I think the answer is no. I think if you go and you look at the plain language of 201S, I don't think it's in the statute. I don't think the will of Congress indicates that there is not a grass option. This right here does not say that it has to be notified to FDA. It just says, unless scientists recognize it as grass. And you compare that with 409, which talks about food additive petitions and says that they have to be submitted to FDA. So I think when you look at 201S, when you look at 409, when you look at some of the other, even 402, 402 for the charge for a food additive, 402 for a charge for adulteration doesn't contemplate grass. It contemplates an unapproved food additive. So when you look at the totality of the statutes and the way they're written, I think any regulation by FDA to close off grass will be challenged under the Administrative Procedures Act. I think it'll probably get hung up in court. But that's only if folks have the will to fight, if folks aren't going to roll over. This would really, and here's the thing, I think you all should tell yourselves next month writing comments, because this is supposed to be in the Federal Register next month. They said they're going to do this in October. So we'll see what regulation they propose. We'll get a notice and comment period of at least 60 days. I imagine it'll be extended. And you really want, this is going to impact things. I mean, how is this going to impact dietary ingredients? How's it going to impact, food additives, grass ingredients? And that's part of the discussion we could try to have now. I mean, predict what's going to happen. No way. I can't predict what's going to happen. I don't know if anyone in the room can predict what's going to happen. Is there going to be a legislative answer? I think that's probably what's going to have to happen. Is there going to be a regulatory answer? Maybe, but I don't think it's the regulation they're going to propose. They might have the authority to make, maybe like a master file for grass determinations, where everybody has to send FDA their determination, and there's data gathered about what the ingredient is, what the population is, its intended use, and then maybe FDA can use that with their current tools, the new tools for post-market evaluation that they're developing, to go in and review X number of those determinations every year. Maybe FDA could take for a spin requiring somebody to give them their determination. I had a phone call with somebody at FDA over in OFAS, pretty high, and she point blank said, "We hate botanicals. We hate botanicals." I get it. I empathize, because they're hard to review. The science is complicated. It's a complex mixture from a natural source. It's not a small molecule. It's not a thing. It's a bunch of things. So I understand it. So I don't know a prediction. I think you'll probably, back in 2016, so what, the grass rule was proposed back in like 96. And we didn't get a final rule until 16. There was a bunch of litigation between then, and the folks in OCC, Office of Chief Counsel, were able to support grass. They had a basis. There's an administrative record where FDA determined that they supported the grass paradigm. Now we have a new administration, and apparently there's an administrative record where they don't support the grass paradigm, where they want to get rid of it. They think they can regulate it away now. So that's going to be interesting to see how that plays out. But I do think there are probably things they could do under the current statute to change the grass paradigm. We'll see what that is. Grandfathering. What are they going to do with current determinations that aren't notifications? Are they going to let you stay on the market? Are they going to make you spit it to a notification? What are they going to do? Who knows? I'm going to throw preparation ahead a little bit. You need to prepare for that. You need to, if you're on the market based on a grass determination, based on presence in the food supply, I'm assuming, when I say you're on the market, I'm assuming you're all dietary supplements, dietary ingredients, right? Or dietary supplement consortium. So if you have a dietary ingredient that you've either crammed into 201 FF1 by president of, dietary substance for use by man to supplement the diet by increasing the total dietary intake. I thank Carol Welsh for that, because she taught me that statute so well. If that's how you crammed your it into the definition of a dietary ingredient, you better be sure you did it right. You better be sure that determination was nailed. If you're availing yourself of that, or if you're availing yourself of 413A1, President of the Food Supply and Informal Chemically Altered, you better be sure. You want to go back and you want to look at that GRAS determination and make sure the I's were dotted and the T's were crossed. Grandfathering, I think it's a matter of equity, whether or not FDA can take that from you now. But I think with some of the way they've worked through 201 FF3, the drug exclusionary clause, that they're not afraid of taking people's property through the statute or the regulations. So I wouldn't say it's unlikely. I think it's possible that there will be no grandfathering. I think it's just as possible there might be. How will this affect NDINs? If they close grass off, is that there should be an increase in NDINs. That should be another pathway to market for a novel ingredient. If they close off grass and OFAS starts to get all these notifications, do they have the bandwidth to deal with it? And if ODSP goes from 50 NDINs a year to 200, do they have the bandwidth to deal with it? How will it happen? How will it happen? And with the grass, what will this do to innovation if the grass paradigm is shut off? Are people going to invest in understanding an ingredient, a novel ingredient? Are they going to invest in preclinical and clinical studies? How's it going to be done? Like, what will the overall impact on the space be if this happens? It could trickle down into dietary supplements very easily. So again, I was given Bob talk for 20, 30 minutes before lunch. Let's talk about color additives. Let's talk about grass. Let's talk about the future of grass. And that's kind of what we did. And I'd like to entertain any questions if anyone has any.
Before we proceed, I would like to acknowledge the presence of our local district officials. Darlene Almogila, she's now our acting deputy director, Central for Inspection and Investigation. Darlene? Matt Wahlberger is our former district director, who is now a senior advisor West at the Irvine office. Thanks, Matt. Thank you for coming and supporting our event. Thank you. Okay, so we have more. One of our co-chair for this event or main sponsor is ASQ. So we're honored to have Samita, who is our national chair for ASQ for Food Drug Cosmetic Division, chair-elect.
Morning, everybody. How's everybody doing? Yeah, great. Morning. Okay, great. That's the objective. Okay. It's the big green button. Yeah. So it's as we know, this is the ninth year that we are holding this dietary supplement consortium, right? And why not take a quick peek at the history and see what brings us here? What has been the journey? Well, a little bit about ASQ, American Society for Quality. As we know, in 1938, where the Federal Food, Drug, and Cosmetic Act was formed. On the other hand, in 1939, at the request of the U.S. War Department, the American Standards Association established a program for developing guidelines for quality control in defense. At this time, Stanford University conducted courses on quality control, and the faculty included Dr. Edward Deming, who became our future quality guru. So that's a little bit about how ASQ was formed. And later in 1946, ASQ was formed with about 253 members and 17 local quality sections, with the mission of global community collaborating to advance excellence through quality and with the vision of enhancing lives, the values of integrity, professionalism, lifelong learning, community of belonging, and dedicated to the excellence. We form the champions of continuous improvement. Today, ASQ stands with about 27 technical communities And this FDNC group, which is the Food, Drug, and Cosmetic Division, is one of these 27 technical communities. So you can imagine how huge we are. What ASQ offers is we are represented in 130 countries, about 200 plus member-led local sections around the globe, 18,000 plus online community users, and we offer year-round mentorship. So this is based on membership, learning, and community. So these are the 27 different technical communities that exist within ASQ. So, it's really so huge. If you take the ASQ membership, you by default, become member of all of these technical communities. And as we see here, there is a lot of collaborative work we do within the different technical communities. Just last week, we had the collaborative effort of FDNC and the audit division, where we had collaborative events, 2 full-day events there. We also hold a lot of webinars. So a lot of technical articles, quality-related articles, and discussion forums and online activities. So it's a great platform for learning. And our major annual event is the World Conference on Quality and Improvement, and along with a lot of other events. And next year, in 2026, in Orlando, Florida, ASQ will be turning 80 years. So that's a big landmark, right? So would encourage you to take membership of the ASQ. If you have any questions, so we do have a booth outside. Feel free to get a hold of us. And also, if you visit the website, we have our AI bot called Quincy, who will be happy to answer your questions. So welcome, and please enjoy the learning and collaborations today. Welcome. Thank you.
Okay, thank you, Smita. Okay, so remember I told you we're going to feed you, but not yet. Okay, so we have approximately 15 minutes before lunch, so we're going to open that Q&A back up. So first question, we're going to throw it over to our online guest. They're at somewhat of a disadvantage. We can't see them raise their hand, but Jocelyn has questions. So if this is addressed to a specific speaker, I'll bring you a microphone. Okay, so Jocelyn, take it away.
Do we still have like a live speaker about the third party program?
Do we still have Dory? I'm thinking probably not. Dory, if you're there, would you chime in? Okay, but ask the question, and if we can get an answer here, we'll answer it. Otherwise, we'll follow up.
So, in regards to the third party program, is the information from third party audits provided to the FDA? Is it also available to the public?
Does anyone at the back table know the answer to that?
I mean, if they would give us a copy of an audit they received, it's just a piece of paper we're going to collect. It is not going to have any impact on our inspection. So it becomes part of that first record. I don't think it would be open. You could get it publicly though.
Okay. Okay, so it won't be really solid.
They can FOI it, of course, but it's not upstairs.
Oh,
Sorry.
I was looking.
You hear my answer?
Back as you can look.
Yeah, so if a firm provides their third party audit in response to inspection, the public doesn't get it. Right? It's their own information. It's proprietary. So it's not open. There's no open database for your company's or a company's information. They can FOI it. They won't get it. Or they can ask.
So in relation to
Karen and I spend most of our lives arguing with each other.
so we
You are never right.
yeah, something.
Josh, and you gotta start over. I'll argue with them at the beginning.
So we talked about quite a few grants through gummy manufacturing.
Oh, we did. Yeah.
But one of the areas that they had questions about online was the choking hazards with regards to children. And they wanted to know if there's any specific things in gummy manufacturing as far as choking, and then also if there's an age that is at a higher risk than others.
In the regulation, we don't have anything like that. But good practices, like with the hey, what happens if a child consumes your whole bottle? You should consider that. That's why the question was up there of do you make a product for children under 4 years of age? Don't be surprised if an investigator is pulling that product to follow because things like the choking hazard, things like the overdosing, make it a higher risk product, a vulnerable population. That's going to be one of those products that's like, ooh, there's an issue. You're affecting a very, very vulnerable population. And the younger you get, the less developed that epiglottal gland is, the less control that child has. Aren't you impressed that I knew it was an epiglottal?
Okay. Since you have the microphone, one more question on there. How do we establish both uniformity and content uniformity? Do we do this at the product validation stage, or do we check every batch?
For like specification, like identity, purity, strength, composition, limits on contamination.
No, you talked a lot about uniformity within the batch.
Oh, like homogeneity. Yeah. So what I would suggest is during like research and development, when you're setting it up, look at like the size of your production, and during R&D, how often do you need to be running those checks based on the batch size, to ensure the homogeneity, and that's going to fall on your R&D. They're way more educated in that than I am. I'm telling you, those people are way smarter at figuring that out than I am. But figure it out at R&D.
Anyone from industry want to take that one? Practices for establishing homogeneity.
Anyone from R&D here?
What was the question again?
Ed? Okay, everyone, please give us your name and go ahead.
I'm just the one that pokes holes in your sandcastles. I don't have to build them.
Edge was serial pharma. So from R&D standpoint, for gummy manufacturing specifically, there is a number of things that is being done to ensure the uniformity. First of all, on a product development stage, you're looking at distribution of your active ingredient in a gummy format to make sure that it doesn't separate, to make sure that it stays consistent. You can pump it consistently, you can deliver it consistently. That's in the medicine itself. Once deposited, also typically checks after a certain amount of time to measure the amount of actives in them, right? That's typically what's done for gummy manufacturing. The ingredients that you want to use, you want to look at those ingredients to make sure they're compatible with the gummy matrix, because gummy matrix is water soluble. Making sure your ingredients are not separating anywhere in a piping or anywhere during depositing stages. So all of those things.
Thank you. Thanks, Ed. Anyone else? Okay, Jocelyn, next one.
This next question is for Bob. Bob, can you comment on the proposed regulation that will find a specific ingredient would not be excluded from the dietary supplement definition if it's otherwise lawfully marketed?
Would you repeat the question?
Can you comment on the proposed regulation that will find a specific ingredient would not be excluded from the dietary supplement definition if it's otherwise lawfully marketed?
Oh, this is the other on the unified agenda, the other regulation that FDA is supposed to promulgate sometime soon. It's a mystery ingredient. I wonder which one it is that they're going to promulgate a regulation that it's not excluded from the definition of a dietary supplement or 201 FF3. It's probably NAC, I'm guessing. But that's just a guess, who knows? And that's right in the statute that the secretary can say that an ingredient is lawful under the act. So this is basically, Dan just walked out. This is basically their citizens petition, CRN citizens petition, asking them to do alternatively just that. to say exactly that, you know, either modify the drug exclusion clause or to say like the secretary has promulgated a regulation that you can use it. So they're basically availing themselves of an avenue that a lot of the trades have asked them to. That makes sense?
Yes, but while I have you, I have one more question. We understand that the FDA maintains that probiotics are not part of the definition for dietary ingredients. What regulatory?
What?
I don't know. That's what it is. What regulatory
Glad I kept the microphone.
to GRAS, NDIN to gain approval for use in supplements?
Could you one more time repeat the question?
Yes, we understand that the FDA maintains that probiotics are not part of the definition of dietary ingredients. What regulatory instrument, GRAS, NDIN, to gain approval for use in supplements?
So the way probiotics qualify as a dietary ingredient is being present in the food supply. I mean, I'm sorry, I'm dietary substance for use by man to supplement the diet by increasing the total dietary intake. So you show that your bug is somewhere in the food supply. Once you qualify that, now it's a dietary ingredient, and then you go to 413 and say whether it's a new dietary or an old dietary. It's going to be new, and then you decide whether or not a notification is required. If you find your bug in food, that's great. If you don't, a pathway that a lot of probiotic companies take right now is to do a self-GRAS determination, put it in the food supply like a yogurt or something, document that it was marketed, you know, that's a dietary substance used by man to supplement the diet, satisfy 201 FF1, and if they're smart, they do that in a way where it satisfies 413A1, and you can say you're present in the food supply in a form of chemically altered and not require a notification. So
You'd have to stick it in the other ingredients. You wouldn't be able to stick it in the supplement facts panel.
Why not?
Because you have two ways of making a dietary supplement, a dietary ingredient. It's either your grandfathered in pre shea or a new dietary ingredient. When you look at the guidance for ingredients added to food for dietary supplements, and it refers to the 201S, it says, in other words, non-dietary ingredients added to a dietary supplement must be used in accordance with a food additive regulation or be grasped for their intended use.
You're right, except we qualified it as a dietary ingredient by making a dietary substance for use by man to supplement the diet by increasing the total dietary intake. That's how we made it a dietary supplement. You do a self-GRAS determination that it's safe in food. You introduce it into food. You document that marketing. You document that it was eaten. That qualifies it as a dietary ingredient.
You would have to document it pre-10/15/1994, though.
No.
Yeah, to meet DSHEA.
Nope, not at all. Not at all.
Be a bigger debate. Let's table it for the later this afternoon. We're gonna have the panel.
Okay. I was trying to figure out how I was going to grab both of them like at the same time. But no, we will table that. We'll come back to it because that needs.
Yeah, but this is really very interesting. This is an area where the industry really needs a lot of information. The NDIN has been forever and looks like it's not moving anywhere. So this is the right forum for us to ask questions. But like I said, probably going to be a bigger debate. We have more sessions in the afternoon for Ask the Experts and where we can have interaction.
The International Probiotics Association is here, so we can talk specifically to industry experts on probiotics. So what we want to do now, for the folks online, we're going to table those to the next session. Sorry, we're going to open it up to people in the room. Any questions in the room? You guys had 10 questions before? Okay, there you go.
Hi, I'm Pallavi from SFI Health. I have a question for Mr. Lance. What red flags do you see most often for that disqualify the suppliers early in the process?
Yeah, I think you can catch a lot in your initial qualification visit to see if they're the right fit or not. In the actual process of qualification, most often I see problems with the audit, where you find either a critical observation that is difficult for them to fix, or many majors that are also difficult for them to overcome and close them all. So depends on which stage you're at. If you're at the initial qualification, you might just determine that it's not a good fit, either for your volume needs, your technical requirements, or the state of their facility, their quality management system, their staff and knowledge of their staff. But once you get into qualifications, usually the audit. Yeah.
Thank you.
Okay, any other questions in the room or experts? No?
I think everybody's hungry.
Yeah, we can take
Huh?
5 minutes still, so we can either
So can
go back online or go
can we get one more of our sponsors on stage, Elon?
online. Okay, so we're gonna take this last 5 minutes before lunch for one of our platinum sponsors. I'd like to introduce Elon from Alchemist. Everyone. I'll stay right here. So, hey everyone, Elon from Alchemist. Thank you all for your attention. I am not going to talk about Alchemist. I'm actually going to tell you 3 very, very short stories with a compelling call to action at the end. So, first short story. I've been dating my wife for almost 30 years. And when we first got together in high school, we thought it was a good idea to get the moms together. And so Sandy met Eugenia. They went to lunch. They hit it off really well. They still behave like competitive sisters today. In the subsequent years, every time it was like a gift giving holiday, birthday, Hanukkah, Christmas, I kept receiving these like bird trinkets and like stupid pictures of birds and like a macaw. Like I like birds. Birds are cool, but couldn't figure out what that was coming from. And eventually I talked to my wife, Michelle. We heard that my mom had told her mom that I liked birds. And so basically the moral of the story is if you don't talk about your own story, you might just receive a bunch of stupid birds. So, story number 2. I don't get those birds anymore. We did correct that. Story number 2. Let's see. Forget story number 2. Story number 2. Well, I'm going to go to story number 3. Wait. Story number 2. Can't believe I'm forgetting it. So, yeah. Okay, well, story number 3. Hang on a second. Okay, the quality story. So, listen, the fact is, in the short period of time between the break, I went online to Grok, one of the many AI tools. Here's story number 2. Came back to me. Okay, story 2. This is your story. It came back. Your story, number 2, is being told by the legacy media and the puppeteers. And the fact is, they're saying these things that you are not regulated, which is totally false. I mean, they're sitting right there. You can see them. There's a whole table of them. The other part of that story is that we are unsafe, which is totally false. If you look at Rick Kingston's data from Safety Recall, there's a pie chart he's delivered to us, and it shows all of the recalls in the FDA categories: food, supplements, cosmetics, medical devices, veterinary, vaccines, and we own the very smallest portion of those recalls. So our industry is extremely safe from that standpoint. And then the other part of that story is that you're untested, and I can assure you, there are 55 alchemists humming along just down the street testing your products right now. So we are obviously tested. And that is your story being told by the legacy media. Again, if you don't tell your story, someone else will. And the last part, in the very short period of time we had in the end of the break, I went into Grok, one of the many AI tools we have access to. I very quickly uploaded a screenshot, not even an Excel sheet, a screenshot of all of the attendees of this conference here. Amazing companies. I work with most of you. Some of you don't. And I went online, I asked the question to Grok. I said, score 1 point if they have the word quality on the website. Score a 2nd point if they have more than a paragraph about quality on their website. And the 3rd point, if you have a page, kind of big things, right? Page about quality. Last point, and to close, I should share that data. And I got to say, you are not telling your quality story about it. There was only one company in Seoul that told the quality story had lab data. And very, very few actually scored 1 points. So the moral of the story is if you don't tell your own story, someone else will. And I actually looked through this group of people, and we do a lot of testing for a lot of companies. And I know you're all doing testing because I take your money. So I think my call to action is please tell your quality story before someone else does. Thank you.
Thank you.
Okay, who's hungry? Anybody hungry? If you're not hungry, we can stay here and keep talking. Okay, but I got a schedule to keep, so go to lunch. Lunch is scheduled from 12, 11,
So for those who have joined us for the first time, lunch is gonna be outside by the lake.
Oh yeah, that's what
Small
I'm
lake.
by showing lunch. It's not in this room.
For those who have joined us in the past, you know where it is. Okay. And please make sure to be back on time. We have still a lot of speakers in the afternoon.
Okay, so go down the stairs, get down at the bottom of the stairs, take a right.
We need to be back at exactly 1 o'clock, please.
And be back at 1 o'clock.
Use your time to network. This is the time to know who are the other industry members.
So do you remember this one? Okay, pop quiz. We're having a pop culture pop quiz. By a show of hands, who knows where this is from? Close. Close. See, my sister's in the audience and she knows the response. Little Rascals. Little Rascals, it's the high sign. Somebody gave me the high sign from the back of the room. So, okay. Nora, are we ready? Hey, Nora, are we ready? Is there a slide? Okay. Not that one. Do we have one for tribute? No? Hmm? Okay. All right. So, welcome back. Hope you enjoyed your lunch. We're going to continue on with the rest of the program. We have an exciting, action-packed afternoon for you. And we're going to couple that with, we got a couple of Q&A sessions. We have another break for you and more food. I told you we're going to feed you. But first, we want to do something special. It's one of the unfortunate parts of life that sometimes we have to, especially in our industry, we have to say goodbye to some of the titans of our industry. Earlier in the year, we did it with Mike McGuffin, who's with the head of the American Herbal Products Association for a very long time. Today, later in the program, you get to meet the new head of APA, who's honored to be here with us today. But right now, what we want to do is pay a little tribute to another one of the titans of our industry, who kind of got this event rolling. She had her own event, and this one kind of dovetailed into it when it started 10 years ago. So I want to bring up one more titan of industry, my mother, Joy Joseph, to come up and pay tribute to another one of the titans of our industry, Ophelia Barreto. So please welcome Joy Joseph.
Good afternoon, everybody. Stephen is my biological son, but I got a bunch of sons in here, you guys. I actually been in this industry since 1960. So now I'm telling my age. I just told Adela that I'm hanging in there at 86 and I just got over the shingles. But I'm hanging in there. But anyway, Nora invited me to pay tribute to Ophelia Umali Barreto. Who in this room knows who Ophelia is? Yeah, I expected a lot more, but as I look across the room, you guys are so young. Jeez. All of these years, I keep saying, the people I know in this group are becoming less and less. You know, they're retiring or whatever. So they've been around for such a long time. But anyway, if you check the LinkedIn, you will see that we pay tribute to Ophelia in LinkedIn. And I wrote something, and Ora Stewart I hope you're listening, Ora, because you did a beautiful job embellishing what I wrote, and it's just magnificently done. And I do have it here, so I'm going to read part of it. But what was left out of this trivia that I created in honor of Ophelia is the fact that I met Ophelia in 1963. She had just come from the Philippines, and she came to work in my lab. I'm not going to tell you who the company is, because you might know something about that company that I don't want you to know. But anyway, she came to work in that lab. I had just graduated from college with a BS in chemistry, and there was someone else in charge of that lab who got a job someplace else, so I became in charge of it. And when Ophelia came, she became in charge of me. So I was the boss, but Ophelia taught me a lot of stuff. And those people in this room who know Ophelia, they all say the same thing, that she taught us a lot of stuff. So when she came to my lab from the Philippines, she had worked for Merck and Dawn for 6 years, running the laboratory. So on the first day, she comes in, and I showed her around, and then I told her to wash the glassware, because that's what they told me to do on my first day, wash the glassware. So Ophelia said, "What are you doing?" I said, "I'm developing a test method for glutamic acid." She said, "Why are you doing that?" I said, "Well, it's a new product we just created, and I don't have a test method." She said to me, "The method is in the USP." I told her, "What is the USP?" So you know how I started out being in charge of the lab, not even knowing the USP. But anyway, she went over to the shelf, she pulled out the USP, she showed me glutamic acid, and I was so excited to see the USP. Because the chief chemist who ran the lab before I came, he actually had his own book of SOPs. And every day after I did the glassware, he would get that book out and teach me how to run a new assay. But anyway, she taught everybody a lot of things. The most important thing that most of you who know her remember about her is she was a strict task master. With Ophelia, it's either black or it was white. No other acceptable criteria for her. She was a strict quality manager, and she worked with me at that lab, and then she left and went to San Francisco to a pharmaceutical lab where she was in charge of the lab. She came back, and she worked with me at that first lab again. And then I got a call from a headhunter looking for a director of quality for Nutrilite. It was around the corner from Ophelia's house. So I told her, "You go for the interview." And she got the job. And that was her last job before she retired and started her own quality compliance solutions, her own quality auditing and consulting firm. So I was in Pharmavite until 2004 for 26 years, and I came out of Pharmavite and I started my own consulting company that I still have. Okay, we have 4 members: myself, Stephen Allison, and my oldest son, Yavid. So we're still running a company. But in those times, I still worked so closely with Ophelia. She called me whenever she needed help with GMP training. We used to have a 2.5-day course. We did that together. I called her into the USP. I was recruited to the USP by Dr. Shane Ross. Some of you may know who that is. Very famous scientist from the University of Maryland. He recruited me because he came and audited Pharmavite, and he thought I knew a lot of stuff about R&D because I was telling him those methods are not going to work. Those methods are not going to work. I'm sure if any of you heard that I wrote all those methods in the USP, you're probably saying those methods don't work. But anyway, they are written for specific formulations. So I just partnered with USP recently. I'm not on the new committee, but I was there from 1994 until now, and Ophelia was there with me. We both taught for the Professional Advancement Society. We taught GMPs for 111 and also for 10 to 11. She and I taught for the Center for Professional Advancement. So all of our careers, we did everything together. And this beautiful rendition that I wrote that Aura put the finishing touches on, I was reading that to my daughter this morning on the way in, and she said, Mom, your relationship with Ophelia was more than that. You got to tell people about you and her. You know, her husband passed away last year, and just a few months ago, Allison and I were sitting with her in the kitchen at her house. She was dancing and reminiscing about her whole life, how she met her husband and the whole 9 yards. So you guys knew her, that's who she was. And Allison made a video of that. So you can imagine how surprised I was when her daughter called me to let me know that she had passed away. But anyway, I mean, I've heard all kinds of things about her. Everybody says she's smart. She knew her job. She did a great job. You couldn't fool Ophelia. She was the best in the laboratory. She was the best in teaching GMPs, labeling, all those things she covered. She was just an outstanding GMP consultant for dietary supplements, and she also worked in the pharmaceutical industry as well, because at Merck, she actually worked in pharmaceuticals. So I'm not going to take up too much of your time, because those of you who know me, you know I can talk forever, so I'm going to get down. But I'll just read you a little excerpt from what I wrote about Ophelia. So this was for the SoCal Consortium, and this was actually placed on our website. And it says, it is with heavy hearts that the Southern California Dietary Supplement Consortium announces the passing of Ophelia Umali Barreto, who peacefully left us on August 11th, 2025, at the age of 91. We weren't too far apart in age either. For those who may not know Ophelia, she was a pioneering figure in the dietary supplement quality systems and one of the founding members of this organization. Originally selected by Alonzo Cruz, who was the district director of the Los Angeles division of FDA, he called on Ophelia and had her help him organize this organization. At that time, it was called the Quality Leadership Network. Nora also was one of the first members of the Quality Leadership Network. She helped to establish the foundation for today's group, the SoCal DSC organization. As part of the founding team, which included Dan Solis, Ms. Dr. Marlene Garcia Schweitzer, she worked to recruit industry members, and that's how I got involved. It was so funny because she said to me, Alonzo Cruz said he doesn't want a whole bunch of consultants. She said, but I told him this is one consultant you have to have because she knows it all. That was me, guys. So anyway, he accepted me on the group, and Ophelia and I were the only consultants, and all of the rest of the members at that time were either FDA, ASQ, or quality leaders from the different dietary supplements across California. So Ophelia was renowned throughout the industry for her unwavering commitment to excellence and her relentless pursuit of quality. Her dedication earned her the prestigious FDA Hammer Award, and she received multiple honors from ASQ. At our 2023 DSC meeting, we proudly recognized her for her outstanding service to the industry and to this organization. Ophelia passed away to her Fullerton home, surrounded by her children, grandchildren, and great-grandchildren, just 3 days after celebrating her 91st birthday. Rest in peace, Ophelia. Your impact on our industry and the countless professionals you mentored will never be forgotten. Thank you, God.
Thank you. Okay, so we're going to continue on with our main program. This next topic is shared by two speakers. As you know, we have industry and FDA representation. This next topic is going to be covered by two of them in tag team. Okay, so our next speakers first is Gary Pesek. Gary is in the Office of Regulatory Affairs and National Expert on Dietary Supplements at the FDA, background in biology and interdisciplinary sciences. Since joining the FDA in 2012, he's also a committee member, so we get to talk and interact with Gary on a regular basis every Friday. So we have a lot of fun, and also his tag team partner for this presentation comes from the industry side, and it is Petra Erlandson. She's the vice president at Alchemist Labs. Petra is the VP of sales at Alchemist and has worked in the supplement industry since 2006 and with Alchemist since 2015. She has extensive experience in technical sales, CGMP compliant analytical testing, scientifically valid methodology, and reference materials. Okay, so I'm not sure which one is speaking first. I think it's Gary since he's the one standing. So would you please welcome Gary? And their topic is qualifying your contract laboratory. You're ready to be entertained. To go forward with Greenland. Thank you. Well, thank you guys very much for the welcome. I appreciate it. I don't know how I was nominated here last minute to go after Joy. That was not fair. So a somber moment. Thank you, Joy. Highly respect Joy a lot. She's a very wonderful person to work with. So if you guys ever get the ability to work with her, you should do it, especially now while we still have her after what we just listened to, Joy. Thank you for everything you've done. So we're going to move into, this is kind of a two-part discussion, and I've been told I only have 20 minutes. We'll see if I can stick to that. Petra will be going after me to share a third-party lab site. So really what this talk is supposed to be is to show you why you should care about third-party lab results. Typically what investigators hear when they walk into firms and start reviewing third-party results, and I have examples in here to show you, is that, oh, I don't know, my third party did that. That is not the right answer at all to tell an FDA investigator, okay? They're just going to go after it. You are setting it on a tee for them to start requesting what are methods, how did you qualify the lab. I'll also end this with talking about what's expected in 303 with laboratory procedures, all right? If you're going to qualify a lab, guess what that is? A laboratory procedure. So you're going to need to document in that procedure how you qualify that lab. Same thing as you do for raw ingredient materials. Are you performing on-site visits? Can they give you your methodology? Will they have authentic results? So wait a minute, there's two green buttons. You said the big one. How did that get in there? Okay, yeah, that's me. And there's my background that Stephen had already said earlier. Good stuff. Yep. Went to Georgia, super proud alumni, very proud alumni. Worked for another agency for a few years before I came over to FDA. Hopped in the lab. The whole reason why I came to FDA was to work on drugs and be able to do sterile analysis. Many of you know New England compound hit, and it kind of changed the scope of my career. The agency realigned, and boom, I'm in the field doing work full time, dedicated really to dietary supplements. I was given an opportunity to move to other labs, and I didn't take it. So I was able to flourish in the dietary supplement world because I was also doing the analytical analysis in the lab along with sterile and non-sterile drug work. Disclaimer, and there it is, always subject to change. It's FDA. This is how the thinking is in this exact minute. 30 seconds from now, it could be completely different. So please be mindful that with technology, with growth, education, things are going to change. Expectations are going to change. So what are we looking at here with a contract lab? I can tell you right now, if you do an on-site visit and that lab looks like that on the top, you need to walk out immediately. Just stop and leave, all right? I wouldn't even tell them why. I just move on. I go back and I have a couple of principles for micro and chemistry because it's really hard to put up equipment that you're not singling out somebody. So if I put a piece of waters up there, someone's going to tell me, oh, well, you like them and you're giving them special treatment. That's not the case at all right? Yes, there are chrome augers in there, but you guys don't know who's making the ones that are in that picture. All right, who should care? The responsibility of tests and examinations performed by a contract lab are going to be the responsibility of your quality system, your quality unit. Quality is responsible at your firm for the specifications you establish that your quality created and put in place. This is why you guys should care. Investigators are being trained with third-party testing that quality is to review test results and accept them or not. Quality also needs to establish, again, I had mentioned the last slide is going to talk about quality procedures and quality qualifying labs because 303 says for laboratory you have to have written procedures. Again, this is all falling back on quality. And this is where we're going to cite. I have some direct language from the regulation coming up, and I'm going to be really boring and not as exciting as Siobhan, and I'm going to read you right from that because it's impactful. And with third-party labs, I think there's a misunderstanding with the industry on where does their responsibility lie? Where does the agency cite them? Where do investigators cite them? So I'm hoping there's clear language in here that will help you guys with that. And I'm trying to put it in the order of emphasis for how we see it. How is an investigator going to review it when they get there? What are they going to be looking for? So specifically, ensuring that all tests and examinations are required under 75 are conducted. Where is that responsibility of quality to assure that happen? It's in 111, 110B. All right? Then it says reviewing and approving the results. So one, you're making sure it happens. Second, you're actually looking at it. You guys would be floored at how many firms, they never look at, they don't even know what it says. They don't even know what the methods are. They don't know what the results say. They just accept it. All right. It came in, somebody else did it. That's what they were, that's their trade. That's their education. That's what they're supposed to do. No, you guys got to educate. Your quality has to educate themselves. And what do I tell every trainer that goes through Siobhan and my course? Get on the Google. You can search a lot of things on the Google. I was on a phone call just 2 days ago with a firm. The investigator was out there and they were having a hard time understanding strength. And they tried to tell me there's no analytical standard. And what did I do? I was like, well, I can't consult for you, but I can get on the Google. I hop on the Google and I say, what is the raw material you're asking about in question? They give it to me. 5 analytical standard reference material pop up. Bing, 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 bing. They're not going to waste their time making reference standards for analytical analysis if there's not a method. Nobody's going to do that. That is maybe a possibility of where you guys can start. Okay? Go in there. Have quality research that. What is the ingredient? Look for standard reference material. Are they analytical standards? What percentage are they? Have they been approved by NIST? Is this a standard that's acceptable, that's been shown to be acceptable and repeatable as a standard? So whose responsibility? Again, I can't emphasize more. These are the products your firm makes. Assuming most of you guys are manufacturers that are listening to this, okay? These are the products you make. You own them. They're your responsibility while you're producing them to make sure they're safe and they don't harm the consumer. Regardless whether you're doing in-house or third-party testing, the responsibility on that is still on the manufacturer. It's still on you, the producer of the product. Is the laboratory you choose conducting the appropriate analysis to meet your specification? Are they? That's on you guys. You have to look at it. That's not on the investigator to come in and review it and say, well, I got on the Google and I found out that that's not the appropriate method. Quality should have long have established those principles before you started reaching out to third-party labs. All right, 11170, right? Specifications. You must establish specifications for components and finished products and ensure that they meet what is on the label based on the MMR. This is direct language from 11170B1, 2, 3, and E for components and finished product. It still relies on you guys to create these. 75 is for testing. I will tell you that this is a common citation now over the last year and a half. for third-party testing that's being conducted it's not the appropriate test. It doesn't make sense. I'm going to give you an example. I'm a microbiologist by trade, so I'm going to give you some of the more examples of this for micro because that's what I like. And chemists get to play with every piece of equipment and just do it over and over and over until it works. It doesn't work like that in micro, okay? Oh, chemists are laughing. That's kind of funny. I'm glad I have you guys laughing. Usually you get mad at me. All right. So what do you ask to qualify your contract lab? Does the lab provide raw data? All right. It's very easy to create some type of sheet with a moniker and an ISO or A2LA stamp on the bottom of it and fill in those areas with whatever you want. Results, interpretation of results, methodologies. The investigators are being trained to ask you guys to go back to your third parties and request this information. Where's the result? We need to see that it was actually compared to standard reference material and that you just didn't run this and compare it to some, as I've seen in methodologies, the highest percentage in the library. So it could be anything that you're comparing it to just to get that number out. So it's critical that you first review these and make sure that the third-party lab is performing these tests with reference material, with methods, that they're being performed correctly, that they actually have the equipment that to be able to do this. And you'll see that again in my slide. Does the contract laboratory have written laboratory procedures? I mean, that's self-explanatory. I don't know really what else to say about that. You're expected to have written procedures for every step of your process that quality has approved. I would think you would want to ask your third-party lab, do you have written procedures? That would kind of align with how the regulation is and what you're held accountable. And does the contract laboratory use appropriate standard reference material, scientifically valid methods? They should be willing to give you this. Most labs that have assurance in the quality of work they do, they're very willing to tell you what these are. If they are a proprietary method, it can still be based on historical methods. They can still say, give you different quotes for chromatography that's in USP. It doesn't have to be maybe that specific monograph or something they developed that's proprietary to them, but there needs to be a standard. There needs to be somewhere that they started, they originated to create it. Most of them, when you go do a good lab, the one that, as Siobhan would say, I would choose, not speaking on the FDA, I would want to see this. I would want to say why I'm there. Look, I'm not copying it, I'm not taking it, but I just want proof that you guys actually have a method and that this method is being interpreted correctly for the results you're going to disseminate to me. That is a huge deal. Other questions, additional questions you may want to consider asking is the contract laboratory accredited to perform the analysis? Not only are they accredited, but are they accredited by whom? And are they accredited to do the test that you asked for? So I could easily get an accreditation for micro and get the seal to go onto my paper or my C of A. But that doesn't mean the chemistry analysis I'm doing, I performed the proficiency test, or the analysts that I've hired have conducted those proficiency tests to be able to show they're qualified to do it and the lab is capable of performing that. Does the contract lab have the appropriate equipment? Again, on-site will tell you that. You don't want to see overcrowding. I will tell you that right now. If you walk into those rooms and they're hot and they're warm, not ventilated properly, the equipment is not going to function as it's intended to. You're going to see funky results, okay? Are they running the standards at the same time? Are they running blanks? Are they running 4 different dilutions? Again, I have some examples to show you that aren't too convoluted. And is the contract laboratory's equipment maintained and calibrated? Oh my gosh, that is critical. Why are we in there asking you about calibration on your scales at dispensing, and we don't care about your testing equipment to be the same way? Like, you guys should expect the same thing from them that you're giving to your customer, okay? Now, yes, you are the third-party lab's customer, but you are darn well able to select which third-party lab you want. And it doesn't always need to be the one that's most cost-effective. These are ways to be able to find out if they're going to be able to produce human testing that you're relying on to make a safe product for human consumption. Why me? Every last year, same thing. There we go. Method review. All right, this is critical. So I have seen this. This is an example from me being in the field. I was at a firm and they had a method by a third party and it was for salmonella. It was this exact method, AOAC 2011.17, which is actually for doing the identification of an early isolated salmonella. How did we get there? One of the favorite quotes Shavana's given me because it's basic, simple, and I have the capability of remembering it is keep the horse in front of the cart. All right. You can't get to ID and confirmation without screening first. So yes, you could do this step, but it's after 2022. So what is the investigator taught? If they're at this step, how did they get it isolated? How did they get the organ? Start asking. They have a positive. They have salmonella. It's confirmed. It's went to plates. It's on XLD or BS or Hectone or whatever you want it to be, and it's confirmed as salmonella. Now we're going to identification for species. All right. What would be acceptable is that they have two results. The first one being a USP with a presumptive positive from 2022. Why? Why is that acceptable? Because now, guys, I was in a firm very recently too where they were using the kit control with the screening as their spike. That's not validated for a spike. Why is that? Because most of these products, specifically botanicals, show inhibition. What does that validation do? That validation is looking at maybe under 10 series. I am aware that in 2021, the spike control, or for the preparatory test, I'm old, I call it a suitability test, is 25 to 250 CF. It is an validated method. I accept it. You guys should have critical thinking in the fact that what if it's under 10 CFU and I have zinc in the product? I can tell you right now, if you have zinc in that product, you're going to be negative for any pathogens you're checking for if you do not use a neutralizing agent in your pre-enrichment broth. It is absolutely critical. All of these 20, 40 blend botanicals that I see out there, a lot of them have components that historically show inhibition in any type of micro testing. This is what quality should be thinking. Quality should be calling the contract labs and saying, this is the product I have. It shows inhibition in this. What can you do? What tests are you going to perform? Oh, I'm going to do BAM. That's when you go, no, you misunderstood. It's not a cucumber. It's a 20 freaking proprietary blend botanical product. BAM is designed for single ingredient foods. And if you go into chapter 5 of Salmonella, there's a guidance for spike. You know what isn't in any of the other chapters of BAM? Guidance for spikes. But somehow people want to interpret it as I can do one for E. coli or STEC or EHEC or whatever you want to do. Where does it say you can do that? When you read the products in BAM that are specific to those chapters, you're going to see stuff that are single ingredient foods. And that's what that spike validation was created on that's in there, is single ingredient foods. The closest thing you can find in there is there's one section in Salmonella for cloves, oregano, and spices. That's not, okay, you may have the active from a clove in one of your products, but typically that's not what you're distributing, right? But that's what they're going to rely on. And what does it say with cloves? You go to a 1 to 1,000 dilution to be able to do it. We're not making sense. And you're going to fail your validation. Again, if you're only doing that spike and it's not for that single ingredient, you guys never did a validation. You've only done a verification. That's it. And that is critical. Why? Because you haven't looked at the elements of growth. Less than 10 CFU, less than 25 CFU, less than 50, less than 100. Those are typically the areas that I would go in when I was in the lab. If you want to exceed that, you want to ask your third-party lab to exceed it, by all means have it. I'd rather have assurance. The higher you get, the little more assurance I have. It's that lower dilution. And especially that lower amount of CFUs that's put in there, and if you can recover it in that same fold too. All right. Really, really, really important. Again, I can't reiterate again, no screening. This firm went right to ID and confirmation. Where's the screening step? Should be 2 if we're going to use 11, 17 on your C of A from that firm. immediately the investigator is going to go after this and they're going to attack it. Why? Because they're being trained to put every method they come across into the Google. All right, so now we start getting into fun stuff. How much time? 10 minutes maybe? 15, 20, 30? Okay. So if we look on the microphone, if we look on the left, all right, this is actually because I wanted to do generic chapters. I just beat the hell out of BAM and then I put up a section for BAM. Wise. But I know some of you out here know it, so I'm not going to try to fool you. Really, what I want to focus on here is if you look right above day 4 on the biochemical screening. So that previous, what I had showed you guys earlier, this would be something more, these two trees here would be something more, flowcharts would be what you would see from 2022, okay? It gets down into atypical and typical colonies on the left. If you look at the method on the right, it's only typical. We have seen, for example, Salmonella Kentucky be able to produce colonies that don't produce H2S. So that's going to be an atypical Salmonella now. There are many variations out there. Infidus is one of them too, that we know historically have large amounts of outbreaks. And now we're finding out that, oh my goodness, well, look at here. They're also adapting like any other organism, and sometimes they won't produce H2S. So the method on the right would never collect those. You would never get them. It would actually kick them out at that step as atypical or no colonies, non-characteristic. It would go that way, and then they just clear it off, those salmonella. But no, there are species of salmonella that do not produce H2S, and that's why it's so typical to have the A. That's why it's so important to have atypical and typical colony results, specifically with salmonella. So really, quality needs to be able to review these methods. And if the lab doesn't want to give them to you, they don't exist. I'm telling you that right now. They just don't exist. And you're going to see an example in a minute of some of the classic ones we've run across. Are there any questions on how to look and what
recording
the
in progress
quality should be doing this review? I'm getting to move along quicker. All right, so I'll get out of micro and I'll get a little bit here into chemistry analysis, chemical analysis. So say you create a specification. This specification is to have HPLC done. You send it, this happens all the time, you send it to your lab, HPLC is performed, they send it back, and it's 95% matched to the standard. What is quality comparing that to in your specification? How? Because your specification says that it is the banding is characteristic at RF value 0.4. It's an orange band under white light, non-deviating. How in the hell do you interpret 90% as that? You can't, but somehow quality accepts it and uses it and moves on when it does not match the standard. So the main question is, do you accept this component or this finished product if you receive a result? Absolutely. That's the whole point of the regulation and why quality conducts these reviews. All right, so I threw up a couple of examples here. These are real cases, real things that we've pulled, investigators have pulled from inspections. And basically what I want to show you is if this is the result from your HPLC that you got from a third-party lab that you're going to present to an FDA investigator, the first thing they're going to ask you is, where is the standard reference material? Which spike is the standard and which one is the sample?
I finished the...
You don't know. And you can't answer that. So you're going to be asked to go back to your third-party lab, you're going to give them this file name, and we're going to pull up lane assignments, or we're going to pull up what was in which spike, which vial, which injection was that in. And then assuming it's the far bottom one on the right where we have the standard peak at the top and the grayed out one is the sample. But again, investigators can't assume. One thing I tell every firm that I go to, and I've seen a few of you in here that I've visited, is I cannot go back and tell my supervisor because they told me so. That's immediately going to get me right back at your facility the next week. All right? The bottom, why it's beautiful and it looks good, I have no clue what's in which lane. Absolutely no clue. And neither does quality. They have no clue what's in it. No matter what you tell the investigator, it's not. I could be illiterate, but I sure as heck can see the letters that are in the lane assignment and can figure it out with the product you put in there by just matching letters. So expect that, okay? These I am going to read. I do find these pretty impactful. Again, this is where we hold, FDA is going to cite where you'll see if these issues are lacking. As quality control must conduct the material and make a disposition decision if the specification is established in accordance with 11170 is not met. So that's finished product component. That's B 1, 2, and 3 and E. All right. Where's that citation? It's 113A1. When a specification established in accordance with 70 is not met, quality control must reject the component. Dietary supplement, so forth, so on. In process adjustments, reprocessing as permitted in 11170. 77. What does 11177 say? They build on each other. For specifications established in 70B1, ID for components, you did not meet, quality control must reject the component, and the component must not be used. Again, that's 77B. For specifications established under 70, the rest of your ingredients and your finished product E that you do not meet, quality control personnel in accordance with the requirement of F must reject the component unless it complies with 111, 123B. This is underneath 77. You guys can yell at me. Don't be bashful. You can be like, hey man, come on. This is your opportunity to give it back. Take it. All right. So I read your B already. I just read your A. A reflects on 123B. So 123B1 states that quality control personnel must not approve and release for distribution any batch of dietary supplement for which any component in the batch does not meet its identity specification. All right. So there's the meat of what you're going to see in citations for third parties if quality doesn't have control of the third party. Siobhan has said it many times. These inspections revolve around quality. Does quality have control? This is a key component if quality has control of their third-party labs and testing. And if they're communicating with the lab what their desire is that they've created and not asking the lab, you figure it out for me. Because they're going to gladly take your money. You heard Alon say it earlier. All right. Am I kicked out? No more? I'm banned. All right. So what I want to show you guys on the left is black walnut. This was accepted by quality. I have no idea what is going on. And you can actually read in the description where it says there's no differences in the standard and the sample. I'm assuming that's the standard that has one marker on it every here and there, and then that's the samples run in duplicate about 4 or 5 times. I don't know. And neither did quality. I can tell you right now, this is from one of the inspections Siobhan and I did. Quality had no clue. But the lab director said it was good to go. Okay, but did you guys see in the red where everything goes back to quality? Quality needs to step in over lab directors. Quality needs to step in over third party and say, no, stop. I see it all the time. I see it constantly. On the right, much better. Talks about characteristics. You can see the banding. I gave them equal opportunity here, and I put them both in black and white. So it doesn't look like I played favoritism to anybody. You can clearly see the difference. That you can identify with lane assignments on the right, what's in what lane, and compare it with standard reference material. On the left, I don't know. This is my favorite one. This company did this for quite a few years. This was for ID. Does anybody have any clue what that method is under ID for UV Vis? What the heck is that? Vendors. I don't understand. I guess USB is changing the names of their methods. OAC, this is their new monikers. I don't know. I have no idea what that means. This particular firm that I was at, I said, okay, call your third party and ask them what vendor method is. All I want to do is compare it against compendial methods. That's it. That's it. Just tell me even the principles. I don't even have to look. Third party's response was, and I have the email, we will create a method for you for $500. So what method did you use? You still got to create it and write it? What the heck kind of method did you use? Again, this is copy and paste. This is a generated C of A that was dry lab and never was tested. And I guarantee if that firm would have done a inspection on that lab to qualify them, they would have been aware that they don't even have a UV vis. They don't have anything. They got a blender. That's for margaritas after 2 o'clock on Wednesday. Results is 95% compared to what? What is it being compared to? I don't know. I have no idea. What's acceptable compared to the reference standard, the reference material? What is it compared to? Yeah, I'm looking. All right. No, we missed a slide. How do you go back? There it is. 20 more minutes. 20 more minutes. 35 minutes. I'll be done. I promise. Anyways, moving along. So really quickly, what is quality control checked for on test results? So I'm looking at this. This is what's provided to me right away. There's a description of appropriate methods. It doesn't just say USP. You can't just throw 5,000 chapters at it and like, oh, well, 2022 stuck, so that's the one we went with. Doesn't work that way. Okay, you got to have the method so that we know what reference standard you're using to make sure you actually did the friggin' test. All right, actual results. This somewhere has gotten along like pass, fail, conforms, confirms. Confirms to what? Conforms to what? What are we talking about? These are not results. I worked in a lab for many years for 2 different agencies, and I would not be able to produce that type of report for anything. One was a regulatory, one was research. And regardless, there's no way I would have stayed employed if I put, oh, it confirmed. I'm like, are you serious? Who is this guy? You need actual results, okay, guys? You gotta have actual results here, okay? And then you want that as a third party, so you know that you can ask them for the actual raw data for when FDA shows up, and you have the confidence that you can provide it because you built that confidence in that third party lab through your qualification program that you've instilled, which, by the way, you have to have a written procedure for if you want to do it. I'll show you that. All right. Real basic one, lactone calcium. So what are we looking at here? What I want to show you guys here is this picture actually has 4 different dilutions of the standard and the sample in one shot. All right, so they've run the standard at 4 separate dilutions. That's the multiple spikes you see in there. And in addition to that, there's also the sample. This had a little more data on it, but I had to cut it down to get it in here, where it actually will go down and tell you the results for the standards, for the 4 standards and the dilutions that they ran them at to. All right, I really just wanted to focus on the raw data here, what was being presented, so you guys kind of have an example of what the expectation is. Again, they can come in 2 different graphs too, and you'll actually have retention times will match. You can have one graph with their standards and one graph with just the sample, but you want them run on the same day. It's not a standard that's out of a library that they purchased from someone and they never purchased the standard. Why is that? You need to show the equipment performs as it's intended to perform, and that if there are environmental factors in play, it's going to show up. Otherwise, you're not going to be able to generate, if you're trying to do strength off this, it's not going to be very accurate because you used a library. And I don't know what environmental factors were there or how hot the lab was at the time. Here it is. All right, procedures. What it says specifically in 303 is procedures for laboratory operations. If you are actually, thank you, glad you guys are paying attention. It actually says for written procedures in 303 for laboratory operations. If you're going to do qualifying a contract laboratory, guess what that is? It's a laboratory operation. It's a procedure. You need to have what you're going to do written in the procedure. Additionally, tests and examinations would need to be written. You can just incorporate it in the procedure what you're going to rely on that third party to conduct, what type of testing you're going to conduct. And you must establish and follow written procedures. This is the direct language that it has for laboratory operations, including written procedures for test examinations that you conduct to determine whether a spec is met. Again, you can combine them in one procedure if you want. There's no problem at all. And last but not least, the records. What records must be kept? Written procedures. I just went over the requirement and where it is. And then results. A lot of firms either email you a PDF of the results. I don't think anyone does snail mail anymore. If they do, you need to look for a new lab. And then there are some there that's crossover. There's something else they're doing that's archaic. And then with the original records kept electronically, there's a big push now by a lot of firms to be able to go in under your password or login and pull the record from their website or from their file location or whatever their program is. That's FDA accepts that. We'll accept that, okay? Make sure you remind the investigator of that if they tell you you have to have it printed out. No, you don't. What you have to have is how you documented it, that you reviewed it. So how are you going to do that? If it's an electronic record, you might be able to put an electronic signature on it, or maybe you have another file or record that you keep that in with date and signature of when you reviewed it. That will align with when you receive the result. We'll see that on the raw data in CFA. So I've been told I can't ask you guys if I have any questions, so you understood everything well, and thank you for your time.
Big green button. All right, I'm gonna start my timer. I said to my co-presenter when we met before, I said our biggest issue is going to be staying on time. So this is me. You can see me, I'm right here in front of you, and that's me on the big screen. I've been in the industry, it's 19 years actually this fall, so I'm kind of excited about next year. 20 years is a big deal. I've been with Alchemist 10 years, but I've been in sales and marketing for a long time. But in this industry, I've always worked for contract labs and in reference standards. So I'm super excited to speak with you today. So it's this one. Aha. Okay. So a little bit about me. What I want you to know is I'm a believer. That is my they call it supplement stack these days. For me, it's a supplement pile. I organize my supplements a month at a time. I have them in little, very controlled little jars. I take them with me on my trips. So I want you to know from my heart, I have a passion for this because I take these products, my family takes these products, and I'm trusting you all to keep America safe, really, when it comes to our health. And that's some of our team down there. Alchemist, we're just down the road, so if you haven't come to see us, please do next time you come out. Let's see, what do I have next? Okay, so we're going to talk a little bit about how to get to your dream lab today. Here's you, right? You're in the forest, it's scary, you have a dream of your ideal contract lab on the hill, and we're going to see if we can get you there. Gary did a great job of explaining why it's so important to care about this, and I'm hoping that I'm going to give you some insight from the contract lab perspective. The first thing that I want to encourage you to think about is expertise and engagement when it comes to vetting a lab and considering who you want to work with. It's important, it's vitally important. Is your potential lab engaged in the industry? Are they involved in trade associations? Are they involved in working groups? Do they present on their area of specialty? We have a nice picture of my colleague Khan. This was in Mississippi earlier this year. She's presenting. This is, I think, mushrooms, some mushroom and fruit and body mycelia data. Is the lab engaged? Why is this important? Because that's how we help each other. That's how we learn from each other. And if a lab is not out there and engaged in the scientific community, then what's your assurance that they're staying up to date? Especially in our area of expertise with botanicals, things change fast in terms of adulteration, right? We all remember COVID when it happened, and all of a sudden, boom, everybody wanted elderberry. Well, guess what? We're seeing adulterated elderberry because everybody wanted it, right? So it's vitally important. We've got APA here, Graham is here, NP. These are just some of the organizations that we're involved in. But look at the lab's website. Look at what they're doing and where they're involved. Gary brought up certifications, accreditations. So 17025, I hope everybody knows what that is, has heard of that.
I'm here to give you my hot take, so get prepared because I'm going to have a couple. It's not just the certification, it's the scope. It's not just the accreditation, it's the scope. But Gary also discussed that. You can't just say, are you 17025? You have to look at the certificate itself, but you have to look at the scope, right? Logos on reports. Each of the certification bodies has rules about how you can use their logos on the report. If you get a report and it has a stamp on it, verify who's the certification body, what is the certificate and accreditation, but look at the scope. Sometimes those scope documents are super long, and it's up to quality to determine, is this scope appropriate for the work that we're asking this lab to do? Now, one little hot take from me, as a lab, we are paying for each method that's on that scope. So the cost for the lab dramatically goes up when we have multiple methods, right? So for a lab like ourselves, we're running botanicals. For our HPLC department, we're running over 200 methods. Are every single one of those methods on our scope? No, they're not. Because that cost multiplies by 200 that we pay, right? So, but you have to read the scope, you have to understand the scope, and you have to say to yourself, okay, does this meet my need, right, for trusting this lab to do the work? Is their expertise appropriate? Because the real question is, would you trust your plumber to do electrical work on your house? I mean, look, even he looks nervous, right? If you need electrical work, you hire an electrician. If, like myself, our shower was stopped up, I need the plumber to come help me, right? So it's common sense, but you have to equip yourself and do the research to know who's the plumber and who's the electrician and what's your specification really need, right? Test methods and quality operations. This has been touched on a few times today. Does the lab have written test methods? Vitally important, right? The answer should be yes, just in case you were wondering. Do they participate in things like the NIST proficiency testing schemes or other proficiency testing schemes? There are many out there. There are some for botanicals, but there are many proficiency testing schemes for other types of tests. These are good questions. What is their acceptance criteria for their experiments internally? And again, another hot take from me, and we've heard it already today. For the test method, how do they determine if that's fit for purpose? What's their definition of scientifically valid? It's not just what's their definition, it's what's your definition of scientifically valid. What do you need? It's about harmonizing with that third party lab, right? Oh, I'm going fast, I think. Oh, this got a little askew, but I can't be on the podium and not talk about reference standards. I spent 8 years of my life in this industry managing a reference standard catalog, and this is like a hidden place. You need to ask your third-party lab, how are they qualifying their reference standard supplier? What's the vendor for that reference standard? But you got to dig deeper. It's not just the vendor, it's the part number and it's the lot number. Now, this isn't necessarily going to appear on every report, but you need to have access to this information. So I have a screenshot here from the Sigma website. Curcumin, we all know this compound. This happens not infrequently for us when we're going back and forth between other labs and a vendor lab, perhaps. Okay, what's the reference standard that you used? Oh, it's Sigma. Great company. Look at how many
can't sing and I can't really dance. So you just get to look at me for a second here. We're deliberating in the back. I'm just going to give you a play-by-play. We're good? We're good? Oh, there we go. We're back to reference standards and reference materials, folks. We're back. Here we are, live at the Southern California Dietary Supplement Consortium. I'm Petra Erlinson, your presenter. Okay. So also you need to ask not just about chemical reference standards, but you need to ask about qualitative reference materials. For us at Alchemist, this is botanical reference materials. I have a picture here from American Herbal Pharmacopoeia. They're a vendor of these types of materials. Also the Chromadex Standards Group. Also Alchemist sells some CRBs. But the question is, your contract lab, if they're doing this type of work, right? How was their qualitative reference material characterized? How do they know? What's their confidence that it is what it is? Sometimes we do hear, oh, that's the first lot. That was the first lot of the material that was purchased. So what? It could have been the first lot, could have not been the thing, right? I mean, like, what's the proof? How do you know what it is? The other thing that you need to look at, especially again, botanical ID, that is our, bread and butter. That's our expertise at Alchemist. Are they putting confounding references on the plate when they're running the experiment? Are they running that product alongside what it should be? Great. Are they also running it alongside what it shouldn't be? If the what it shouldn't be isn't there, you don't know, right? You don't even know if the method is appropriate to discriminate between the two. So again, my hot take, dig deeper if this is a first lot question, right? I have a passion for reference standards and reference materials, so I can't not tell you about this article that was run a few years ago. It has some really great opinions by very notable figures in our industry. I hope the QR code works. It should. I tested it. Measure by measure. It was done by Nutritional Outlook. We don't see a whole lot of training on the reference standards and reference materials topic. So I really encourage you to look at this. But I do have, right, what is required and, proper qualification of reference standards and reference materials is required. So you have to double check if your contract lab knows, right? So specifications. We've had a few people talk about specifications today. Is your specification lunch? Is your specification a cheeseburger? Or is it a chicken sandwich? And is the test method that's being used appropriate to tell the difference between the cheeseburger and the chicken sandwich? I mean, it seems basic, but sometimes it's just common sense. And so when you're working with a lab, this is part of the discussion, right? The quality unit might be setting the specifications. They should be setting the specifications, but you have to verify with the lab that the method and the techniques that they're using can tell the difference. Because there's that old line from the movie, I think it was Joe Pesci, they screw you at the drive-thru. So you got to make sure that when you're ordering your lunch, you know the difference between the hamburger and the chicken sandwich. Everything starts with the specification. For us, that's plants. A lot of what we do is plant chemistry. A specification includes a test method. But the specification, my hot take, it's the quality unit's job, not the contract lab's job to set the specification, but we have to be in harmony, right? So we have to ask those questions ahead of time. Okay, next step, transparency and technical support. Again, we're trying to get you to that, beautiful gleaming lab on the hill from that scary forest, right? You need to find a partner that you can trust to help you when there are unexpected results, because we want everything to pass. We hope that everything passes, but the reality is some samples fail, right? You need a lab that is going to give you transparency in the report so that your quality unit can review it. You need a lab that gives you method details on that report. They might not all be there, but you should be able to ask for the ones that might be missing. Chromatograms, images, the idea of raw data, right? If you get a report that just says pass with nothing else on it, then how are you evaluating if that meets your specification? Can you talk to scientists if something fails, right? And you're like, wow, I need to understand this, what's going on. Can you even get a hold of the people who touched your sample, who ran your sample? Don't be like the guy in that picture, right? Frustrated. It failed. Now what? Somebody help me. So I was like, what's a good analogy for this? If you went to the emergency room or urgent care and you're like, doctor, my arm feels weird. And he's like, oh, you have a broken arm. But you don't get to see the x-ray. You don't understand it. It's proprietary. The x-ray is proprietary. Like, how would you trust that, right? It's the same thing with a contract lab. You have the result. You should be able to see the x-ray. You should have an expert explain the x-ray to you. You should be able to say, what about that little white spot there? Now, the first version of this picture, he was angry. And I was like, let's just make him more condescending. He doesn't need to be angry. He just needs to be withholding, right? But again, it's common sense. But this is what you're looking for in a lab, somebody that you can trust. My hot take. It's my hot take, folks. Common sense. You need to look at the data when you're getting the result from your third-party lab. You're looking at the report, your quality unit is saying, yes, we accept this, not just sticking it in a drawer. But you need to actually look at the data, not just the conclusion. Our eyes want to go to the bottom or wherever it is, it says pass. But you need to look at the whole package. A couple examples. We've got some TLC here. These are real examples. If you're looking at HPTLC, you want to see some nice distinguishable bands, right? This one in purple and this, the two with the question marks. If you just asked yourself common sense wise, would I be able to tell a difference if there was a difference? I don't know. That's for you to decide, actually. It's not for the lab to decide, but you need to be able to look at the data to make that determination. For HPLC, we've got a couple examples. The one on top is redacted a little bit, but what it is like a big hump, and you can see that lines are being dropped. They're trying to integrate separately pieces on this big hump. Ideally, what you want is, baseline separation between the peaks. I think this is something we're all familiar with, but that's why you need the data on the report so that you can tell the difference about what's going on, so that you can ask questions. You should always be able to ask questions. Again, think of the doctor, right? If you can't see the data, how can you ask questions about the data? Oh, okay. Dorothy, there's one other place that you need to look behind the curtain, because contract labs, okay, I'm hiring a contract lab, but there's hidden contract labs that you don't realize you're hiring. And they're actually in your contract manufacturer. Your contract manufacturer's in-house lab is a third-party lab that you've hired, right? I see some nods. Okay. And I think a lot of people don't always think about this. So you need to vet and qualify and choose your contract manufacturer's lab if they're doing the work internally, just the same way you would choose and qualify a third-party lab. So we've got the wizard behind the curtain. A few people have brought up today, and I'm so excited, the data dashboard. every time I bring this up, I find people, there's some people who don't know about it. If you haven't been on it, poke around. I'm going to show you a brief little view, but you can search that yellow box, search firm information. You have to be a little patient with it. Sometimes it's a little laggy, and you have to be crafty if the firm has changed their name or been acquired or something like that. It'll give you some interesting insight. You can see exactly when their inspections were. You can see earlier, even this morning, Glenn started the day talking about the dashboard. You can see the NAI, OAI, BAI. In this particular case, I've not shown the firm's name. That's a lot of red there on that pie chart. But when you go in, you can even see exactly the NAI, OAI, BAI. It'll even tell you the portions of the regulations that were noted in the inspection. So this is a way that you can look behind the curtain with a contract manufacturer and look and see if their laboratory has been cited for things in their inspections. So if you're not familiar with this, I encourage you to play around with it. It's kind of interesting. But I am finishing I think I'm on time-ish. The last thing I just want to send you home with, does everybody know Stephen Covey? I mean, his book was revolutionary when it came out many years ago. I don't know how many people still know about him, but begin with the end in mind. We're talking about third-party lab qualification. What should the end in mind be? Maybe the science, right? If you begin with the science, you end with the science. If you begin with the calculator, the result of your qualification process looks more like the calculator than like the science. So everything needs to start with the science when it comes to qualifying a lab. Last but not least, we do have a PDF that you can download if you'd like about qualifying choosing an analytical lab, if you want to follow the QR code. And that is my email, and that is my personal cell phone number. Don't put it on the bathroom wall. And, don't put it on Reddit. But if you want to take a picture, I'm here. I'm happy to answer questions. If you have questions afterwards, or if you need to get a hold of me, I'm happy to do that. How am I doing on time, Stephen? I'm all done. Thank you so much.
Okay, so she offered it, so we're going to make time later for Petra's song and dance. Okay. Okay. Give me 1 second here. Getting booted off the internet. Screwed up where I was, and I didn't notice. 1 second. Okay, here we are. Okay, so moving on with our next presentation. It's going to be another tag team. This tag team are both coming from the agency, from the FDA. It's a pleasure for me to present two members of the FDA for an update on FDA's import division. Okay, and talk about things like FSVP imports and things that they're seeing. Okay, so I'd like to welcome Dr. Kathleen Turner, Program Division Director for the Division of West Coast Imports, and John Liu, the Import Specialist for the Division of West Coast Imports, to give us a presentation on an update on the Division of Imports.
Hey, good afternoon, everyone. Thank you for having FDA's Office of Import Operations at this event. We're excited to be here today to talk about program updates and dietary supplements. As you just heard, I'm Dr. Kathleen Turner, the Program Division Director of the Division of West Coast Imports, and I'm pleased to share today's presentation
with our import specialist, Mr. John Liu. Today, we're going to provide updates related to FDA's Office of Import Operations, or OIO. We will talk about changes in our senior leadership team, nationalized entry review, the foreign supplier verification program, the voluntary qualified importer program, and dietary supplement reminders and challenges. We'll start by talking about the structure of OIO's senior leadership team and the coverage that each field division provides. The Office of Import Operations is led by Mr. Dan Solis, the Assistant Commissioner for Import Operations. Directly reporting to Dan are Dr. Fayad Rahman, Deputy Director for Targeting Analysis and Support, and Captain Nazmal Hassan, Deputy Director of Import Operations Enforcement, or what we refer to as the field divisions. Currently, FDA's import program has 5 field divisions. The map on the screen shows how these 5 divisions determine import field coverage for the over 300 ports of entry in the United States. That's me at the bottom of the slide, leading the Division of West Coast Imports, or DWCI. DWCI is responsible for the airports, seaports, central examination stations, and international mail facilities on the West Coast, including Washington, Oregon, Nevada, California, Hawaii, and our Pacific Island partners. In fact, FDA has import investigators stationed in Guam, working with local Guamanian customs to process imports into the Pacific Island U.S. territories. The Division of Northern Border covers the long northern border. The Division of Southwest Imports covers the Mexican border and states up to Wyoming and Iowa. Division of Southeast Imports covers Florida, many states in the Southeast, Alaska, and Puerto Rico, and they're responsible for many of the express courier operations at ports throughout the U.S. And the Division of Northeast Imports covers the northeastern states from Virginia up to Maine. As you may be aware, Dr. Marty McCary is FDA's new commissioner. Dr. McCary recently released a statement about his first 100 days. It's relevant to note that FDA's import program and initiatives driven and supported by the import program were mentioned throughout Dr. McCary's statement. Dr. McCary speaks to the importance of keeping illegal vapes out of the hands of all Americans, especially our youth. Dr. McCary even notes one instance where FDA, in conjunction with CBP, seized illegal vapes that were designed to appeal to the youth. We appreciate this highlight and want to emphasize that FDA's import program is working around the clock to protect consumers from illegal electronic nicotine delivery systems, or ENDS products, including vapes that are specifically manufactured to appeal to youth. FDA's import program supports all the agency's priorities. It's important to point out that FDA's import program works hard to expedite review of compliant trade and to make sure compliant products such as drugs are reviewed efficiently. Another highlight for imports is that FDA import alerts have been updated and are continuously updated to prevent illegal and unauthorized products from entering the market. We encourage you to refer to our FDA website to read Dr. McCary's statement and see where FDA is headed. As mentioned earlier, Mr. Dan Solis is the Assistant Commissioner for Import Operations. That's him on the screen on the left. And he was supposed to be here today, but unfortunately couldn't come. So at the last minute, I am stepping in to give his presentation to you, and I'll do my best. Under his leadership, the Office of Import Operations Priorities recognizes the way people import products today is very different from the way they did in the past. And not only has the way people import products changed with e-commerce, but the way nefarious actors work to import products that are illegal or unauthorized is also changing. FDA's import program is working diligently to address both areas using technology, rapid screening tools, and partnership arrangements. We're committed to protecting U.S. customers in the dynamic field of imports. Many people are surprised to see all the places in the world that send FDA-regulated products to the United States. China, Mexico, and Canada are usually expected, but you can see the green all over the world that import the products. Seeing the volume increase drastically every year and seeing the number of countries that are importing expand, then combining the fact that e-commerce is growing, OIO had to reimagine how to handle imports as our resources will not increase enough to match the volume. First, one of OIO's main initiatives has been to embrace technology. For example, we piloted artificial intelligence, machine learning for imported shrimp over the last few years. Testing this technology and how it can integrate into our import process has been an invaluable advancement in the way we operate. Our import process takes risks into account in every aspect. We factor risk in from the time the entry is made all the way through our compliance decisions. And OIO is leveraging partnerships through information sharing agreements known as partnership arrangements. FDA's import program has gained valuable insight into violative products being imported. OIO champions these arrangements at the local, state, national, and international level. The more information we have, the better our systems can target for violative products and the more efficient we can be in reviewing compliant trade. One of OIO's initiatives, which aligns with Dr. McCary's vision to centralize functions, is Nationalized Entry Review, or NER. Note that the name of this process may change in the future. As I stated, we've updated our technology, such as handheld rapid screening tools and incorporating artificial intelligence, machine learning, and we'll continue to update our technology, but we're also looking at how we use our manpower to maximize efficiency for compliant trade and improve our targeting for high-risk imported commodities. Historical test pilots on the national and local levels have shown us that a dedicated entry review staff will meet these priorities. What we expect from NER includes efficiency, consistency, and quality. The NER team will significantly enhance the efficiency of FDA's import operations while ensuring consistent enforcement actions nationwide. By leveraging lessons from the successful 2022 NER drug pilot and implementing a commodity-based review approach, we will streamline processes and standardize the decision-making across all entry points. The NER program aligns with Commissioner McCary's vision for centralizing operational functions, enabling us to effectively protect public health from potentially hazardous imported goods as our work grows increasingly complex. Another expectation from NER is maximizing resources and expertise. Through the NER team, we are optimizing our use of resources to meet the growing demands of import operations. This specialized team will focus on commodity-based reviews, allowing us to apply targeted expertise more effectively and respond swiftly to emerging issues, all while working within our current staffing levels. And we expect NER to advance public health protection. The NER team represents FDA's commitment to evolving and improving our import operations to meet the challenges of an increasingly complex global marketplace. By implementing innovative commodity-based review processes, we're enhancing our ability to identify and respond to potential health risks more quickly and effectively. This initiative will lead to better protection of public health by ensuring that imported products meet the high safety standards that American consumers expect and deserve. Nationalized Entry Review launched on August 4th. The biggest change for the importers and brokers will be the contact information. If you're calling about the status of an entry, you should always refer to ITAX as the primary way to get a status update. However, if you have a specific question on an entry or a hot shipment, you'll now contact NER inquiry at fda.hhs.gov. That's NER inquiry at fda.hhs.gov, as opposed to the divisional emails that are currently being used. However, documents should still be uploaded into ITAX. One of the key import authorities for foods under the Food Safety Modernization Act, FSMA, is importer accountability. Importers have an explicit responsibility to verify that their foreign suppliers have adequate preventive controls in place to ensure that the food they produce is safe. The FDA FSMA rule on Foreign Supplier Verification Programs, or FSVP, for importers of food for humans and animals went into effect January 26, 2016. The FSVP rule requires importers to perform risk-based foreign supplier verification activities to verify that food is produced in a manner that provides the same level of public health protection as Section 418 of the FD&C Act concerning hazard analysis and risk-based preventative controls, or 419 concerning standards for the safe production and harvesting of certain fruits and vegetables that are raw agricultural commodities. The food is not tab of the FSVP import alert. The import alert is specific to the importer, foreign supplier, and the foods that were the subject of the non-compliant FSVP inspection. The basis of the import alert is non-compliance with FSVP. In the traditional sense, consecutive private laboratory testing with negative results does not equal FSVP compliance and removal from import alert 9941. Rather, the importer must demonstrate compliance with their responsibilities under FSVP through the submission of documentation or evidence that indicates that corrective actions have been taken to combat the reason for placement on the import alert. I hit something, but nothing's happening still. Oh, okay. Okay. I'll go on. Or not. There we go. That's what I just talked about. I'll give it just a moment in case you wanted to see anything from it. Okay, unless you object. Oh, no, it's not going. Well, the next slide is about the FDA data dashboard, which serves as an external resource portal intended for industry and stakeholder use. Updated monthly, the information on the FDA data dashboard, such as the compliance history of a foreign supplier, will assist the importer to determine the approval of a foreign supplier while analyzing emerging trends to identify any known or reasonably foreseeable hazards associated with the food. The FDA enhanced FDA's data dashboard by integrating the firm supplier evaluation resources section. This section provides importers and manufacturers and/or processors with the ability to search multiple databases to evaluate their foreign suppliers' compliance with applicable FDA food safety regulation and relevant information pertaining to the supplier's compliance with those regulations. Compliance includes whether the supplier is the subject of an FDA warning letter, import alert, or other FDA compliance action related to food safety. Oh, was that it? Oh, that was that. Okay. Anybody wanted that longer? Okay. VQuip update. Good. The voluntary, this is the prettiest one, it's in red. The Voluntary Qualified Importer Program, VQuip, is a voluntary fee-based program that provides expedited review and import entry of human and animal foods into the United States for participating importers. VQuip benefits include quicker, easier entry. FDA will expedite import entry into the United States for all foods, including in an approved VQuip application. FDA will use its predictive risk-based evaluation for dynamic import compliance targeting, or we refer to as PREDICT, import screening tool to recognize shipments of food that are part of an approved VQuip application. The screening tool will be programmed to recognize and in most cases immediately release the shipment unless examination and sampling are necessary for public health reasons. Limited examination and sampling. FDA will limit examination and/or sampling of VQuip food entries to the following situations: for cause situations such as an investigation of an outbreak or illness, to obtain statistically necessary risk-based microbiological samples when building a product risk profile based on non-biased surveillance sampling, and to audit a small percentage of import shipments covered by VQuip to verify that the products declared in a VQuip entry are consistent with products covered in the VQuip application. FDA sampling at preferred location. When FDA needs to sample an entry covered by VQuip, FDA will attempt to the extent possible to examine an import entry and collect samples at the VQuip food destination or other location preferred by the VQuip importer. If import entry to the U.S. is denied, FDA will assist in fulfilling an importer's request to U.S. Customs and Border Protection to export the refused products from the port preferred by the importer. Faster lab results. In the event FDA collects a sample of VQuip food import entry, FDA's laboratories will prioritize processing of VQuip samples. And a help desk. FDA will maintain a VQuip importers help desk connecting importers to FDA staff dedicated to responding to questions and helping to resolve concerns. I thank you for your attention, and now I'll turn the presentation to John Liu for the remainder of our program and to address any questions. Thank you.
Hi, good afternoon, everyone. My name is John Liu. As mentioned earlier, I'm an import specialist with the Division of West Coast Imports. This includes dietary supplements, of course, and they can end up on many, many different kinds of import alerts, including Import Alert 6641 as unapproved drugs when they make drug claims. Okay, that's me. There are a number of challenges, of course, when it comes to importing drugs. The largest challenge really is the lack of knowledge on the difference between drugs and dietary supplements, which leads to incorrect product coding of drugs as dietary supplements. And as we've established, dietary supplements are not, are foods. They're not drugs. Okay. Please remember, if the product labeling makes drug claims, then the product is a drug and not a dietary supplement, which means it would be subject to drug regulations and requirements for imports. That's why it really is critical to make sure that whoever the supplier, the manufacturer, your product, your filer, and you, importers, brokers, anyone bringing in product provides accurate information, including all affirmations of compliance. There are a number of challenges on both ends, but as Dr. Turner mentioned, our goal is to work with you to try to make sure that we're bringing in good products and supplying consumers with safe products as well. Again, in terms of challenges, the biggest things that we run into, product labeling and product coding, because we do see certain things. We only see what's submitted to us prior to conducting a physical exam. And if we do see issues, inconsistencies, if we find something's on import alert, that may result in added scrutiny. I am going to, okay, are we back? Oh, there we go. So, can we go back a slide really quickly? Yeah. So you can see there's a product code on the very left of the table. There's a program code. The next thing is a processing code. You can see there's additives, dietary supplements, animal food, natural state processed foods. And you see a number of product industry codes there that are associated with those different processing codes. And of course, the statuses with these codes, these are mandatory. And the more accurate the product code is, the less issues, the fewer issues, I should say, you'll have getting it through. Because if it's been properly identified, that's one less layer of activity that both of us need to go through. Fewer corrections means smoother sailing when it comes to importing, and especially when it comes to reviewing FSEP. As Dr. Turner's previous slide listed the top 10 citations, there's a lot of core components in terms of FSEP, and a lot of it is documentation. And I know we all appreciate the value of proper documentation in this room. Okay. I know that was a little brief, but we also want to open the floor, make sure that we have time to address all your questions, any questions that you may have about FDA's operations, about FSVP, current operations, and any challenges or topics that might be of concern for you all. But yeah, I'd like to open the floor to questions if you have any. Yes, that's the other thing. If you don't have questions now, there will be a QA panel later. But we'll be around once again. If you can, let me just go ahead and go. Oh, there's one more slide that I wanted to present as we go back really quick. Is there one more? Oh, here we go. So this slide in particular, if you guys want to take a picture, if you all want to take note of the various emails, these are points of contact available to you if you need to reach someone at the import program. This is going to be a number of emails at headquarters. And we also have local contacts here in the Los Angeles district. Dr. Turner and I, like I said, will be around for the panel for questions later. And if you see us around, there's also, we're located both in Irvine, the Los Angeles district office, as well as in Long Beach in the World Trade Center. And let me, before I dismiss it, if anyone came up with any questions off the top of their heads. Okay, that's the presentation, and I want to go ahead and thank you for your time and attention. Cheers, everyone.
Okay, so first we want to apologize for the technical difficulties. Not sure what's going on there, especially to those that are online on the Zoom. We keep dropping Wi-Fi in the facility, and so if you keep getting kicked out, just keep coming back because soon as it comes back on, we log back in and restart the webinar. But let's go ahead and keep going with our afternoon presentations. We had some spirited discussion earlier that leaned over into probiotics. Okay, so now we're going to talk about probiotics. So our next speaker is the Director of Growth at the International Probiotics Association, where he drives initiatives to advance global standards, regulatory alignment, and manufacturing best practices in the biotic sector. With a foundation in clinical diagnostics and over a decade of experience in probiotic and postbiotic product development, he has led global programs focused on formulation, optimization, stability, modeling, and quality system design. His work bridges research, manufacturing, and regulatory considerations to ensure probiotic supplements deliver on potency, shelf life, and consumer trust. Okay, so would you please welcome John Maris from the IPA to give us an update and presentation on probiotics. Welcome, John.
Hello, everyone. My name is John Maris, and I'm the Director of Growth with the International Probiotics Association. Not sure what we have going on here. How hard? Really hard? Anyways, so just a little bit about my background. Before joining the IPA in May, I worked for well over a decade in R&D for probiotic product development. And so I do have to apologize if I seem a little bit nervous. I'm not used to having this many quality and regulatory people in the room at one time. Does kind of get my spidey senses going a little bit, as I think Francis and Shelley can attest to. I've had some spirited debates with some of you throughout the years over product specifications and things. But anyways, I was given 20 minutes to talk about optimizing probiotic manufacturing, and it's a lot to cover in 20 minutes. So I hope there's some takeaway messages that you can get from this. But first, I wanted to just cover briefly who the IPA is. So the IPA is a global nonprofit organization. We have international membership, and we bring together the different biotic sector stakeholders. Originally, we did specifically focus on prebiotics, but probiotics, but we've now branched out into pre as well as postbiotics. We currently have NGO status before Codex, as well as ISO observer status. The IPA's mission is a global nonprofit organization that advocates for the safe and efficacious use of pro, and postbiotics. And if we can advance to the next slide, you will see some of the manufacturing guidelines that the IPA has come out with. All right, so a number of years ago, the IPA published some manufacturing guidelines. Member companies got together and basically put together best practices for probiotic manufacturing. This has since been adopted as a normative reference to regulations and as well as part of the public standards. So the guidelines are now part of ANSI 4552 as an addendum, and they're also recognized within the Global Harmonized GFSI DS program. All right, and so as I indicated, probiotics are very complex, right? We're talking about live microorganisms. I'm just going to focus on the tail end, the finished good manufacturing, because there's a whole host of things that goes into the isolation and characterization of new probiotic strains. The take-home message for characterizing new probiotic strains is that there's a variety of different sources they can come from. They can come from human, dairy, vegetable, and soil-based sources. Essentially, when you're characterizing a new probiotic, above all else, you have to ensure that it's safe. And this includes whole genome sequencing, phenotypically characterizing it, making sure that it's free from any antibiotic resistance, and any pathogenic factors to human beings. That's not to say anything about the clinical science that needs to go behind it, right? Just because a bacteria has been characterized as safe for human consumption doesn't mean that it provides benefits to humans. So there has to be a lot of work that's done before it gets to the point where it's sold as bulk probiotic powder that could be incorporated into a finished good. But I think this is the fun part, so this is what I'm going to focus on. This probably looks very familiar to many of you that work in the dietary supplement industry.
It's a flow chart for finished good manufacturing, right? And so what's the difference between this flow chart and any other flow chart for dietary supplements? There is no difference, right? The only difference is that we're talking about a live microorganism, and certain safeguards need to be put into place to ensure that while this microorganism is going through this process, it remains in a state where it can have an effect on the human once it's consumed. So it requires very tightly controlled conditions in order to do the manufacturing.
Yeah.
All right, so here is what ChatGPT thinks happens when you expose probiotics to a little bit of heat and moisture. All right, so the cells are actually sold in bulk powder in a lyophilized state. So they're treated with a cryopreservative, and they're then lyophilized and they're kept in cold storage. They're then shipped to the manufacturer, right? Well, what happens is if you expose a little heat, so you see the nice bug sitting over there waking up, you expose a little sunshine and he has a drink of water. Well, the next thing that happens is that it wakes up, it comes out of this inanimate state, right? And once it comes out of the inanimate state, it does what any other organism does. It starts to divide, it starts to procreate, it starts to grow. It wakes up its other buddies and they all start partying, right? Well, they think they're having a good time, but unfortunately, just like any other organism, it has a limited lifespan. And once it's awake, it then goes on and dies. And so throughout the manufacturing process, if we expose it to warmth and moisture, it's going to wake up and it's going to die, and it's not going to reach the consumers in a state that's beneficial. So, what are some of the steps that we go through to ensure that a probiotic product reaches the consumer in a state where it's going to provide a benefit? Well, for starters, bulk probiotic cultures are typically stored at anywhere from -20 to 8 degrees Celsius. There's also a tempering cycle that's required to prevent the accumulation of moisture. So as things increase in temperature, condensation occurs. And if you have your probiotics open to the air, guess what? You're going to get water in there. They're going to wake up. They're going to die. You also have to have strict environmental controls when you're doing your blending, your compression, your encapsulation. I will leave gummies aside because I am not a gummy expert and I don't express being a gummy expert. Those things are a whole nother animal to me. So while you're manufacturing your probiotics, anytime that the powder is exposed to air, you have to have your relative humidity kept to less than 35%. You also have to have it cooler than room temperature air, and these are typically done in encapsulation and blending suites, right? Where you have HEPA filtration. If you're doing it in a facility where you're also manufacturing other dietary supplements, this could potentially spell disaster, right? If this bug gets out into your regular lines and now you're having to deal with contamination issues, cross-contamination issues. So these typically occur in suites that have HEPA filtration. They also have separate air handlers entirely. You also want to have directional air pressure to protect your probiotic product from having other things ingress into the facility. So you will typically have a directional air pressure cascade with the highest level of pressure happening where you're doing either the compression or the encapsulation, and then it will work its way downward as you exit the suite. In addition, obviously, there's things that can affect the stability once it's packaged. So considering the moisture vapor transmission rate of your packaging is of paramount importance, and typically including something like a molecular sieve that can wick out moisture, or even some more specialized things like CSP vials that have, active desiccant tubing in there that can really wick out a lot of moisture is usually something that's advisable. All right, so what goes into probiotic strain selection? How am I doing on time? Am I okay? All right, great. All right. So typically when strains are qualified as probiotics by a manufacturer and sold, they're sold either as an individual strain or they're sold as multi-strain blends, right? And these are typically evaluated by that manufacturer. Very seldom is the finished good being evaluated, right? What you really have is you're looking at individual strains that have different mechanisms of action,
and they have different pathways that they interact with. And so, for example, something that's happening in the gut can have an impact on gut barrier function or digestion improvement or even immunomodulation and other antimicrobial activities against pathogens. And so what you really need to pay attention to is, for new formulations, is what is your target population? What health effect am I looking for? And what's your delivery vehicle? And based on this, you can evaluate the clinical studies and decide what your dosage is. But as we all know, going from clinical studies to store shelves is usually a difficult thing because what consumers are looking for is an expanded number of benefits and fewer products, right? And so the drive is to start combining strains from different manufacturers into one product to get a whole host of benefits that might all impinge on one health benefit. The disconnect here between having them clinically evaluated on an individual strain basis and then incorporated into a multi-strain blend can actually have a profound impact on both the efficacy and stability of the product. So, for example, if we have a multi-strain blend that incorporates probiotics from manufacturer A as well as manufacturer B, those strains could interact in 2 or 3 very different ways. I don't particularly like the term synergy here because it has a very specific scientific definition, but nonetheless, those strains could inhibit one another, right? And you could end up with no health benefit whatsoever. On the other hand, they could have a synergistic effect and they could bolster the activity of each other to a point where you now start to get side effects that you hadn't originally intended. And so what we advocate for, but we understand is cost prohibitive, is to run clinical studies with probiotic formulations in the dosage form and as they are available on the shelf using that exact formulation. But that's not the only thing that can affect strain stability. We have upstream fermentation that can affect strain stability. We have downstream blending, right? Was it a particularly humid day and your air handler or your dehumidification unit just couldn't handle the humidity, and so you were slightly above spec? Or was your refrigerator, did it have a small deviation? Things like that, right? These all affect downstream stability. So one impacts the finished product. As I said, all of these things do. And since each strain possesses its own stability profile, how are you able to estimate the required overage for each strain in a multi-strain blend? Becomes a very difficult thing to do. So, of course, the first step is going to be looking at each individual strain and its stability profile, and then estimating the overage that you need from there. But you also have other ingredients that could affect that stability. You have packaging that could affect that stability. And so end product stability studies should always be done. Now, unfortunately, you're talking about live microorganisms, so accelerated stability is not possible. You have to do all of this in real time. So if you're talking about something that you want to give a 24-month shelf life to and you want to launch with full stability profiles, you're now talking about a pretty long launch window. And for a lot of contract manufacturers, that's just not feasible, right? And so I'm going to skip this for the sake of time. There's also other impacts on stability. One of those things could be your dosage format, right? So tableting actually has a profound impact on probiotic stability. The force of the compression, the shear force that's generated during compression, as well as the heat that's generated during compression, can lead to upwards of a 40% die-off in just the baseline bugs that you have put in that formulation. So you have to account for that with a 40% overage just from the start. But it's all about striking a balance as you're going through the R&D process, right? Are there small changes that you can make in the compression force that you're using? Are there things that you're willing to concede as far as tablet friability is concerned, right? How do you want to label those? Do you want to label them as colony forming units, or do you want to use something that's maybe a little bit more inclusive, like AFUs that are being done now with flow cytometry that can account for the viable but non-culturable cells that exist within these formulations? There's a lot of nuances to it, and it's way too much to cover in 20 minutes. And so, like I said, right now, there's the gold standard is plate count enumeration, and you're talking about, am I super long?
No, actually, like in the blink of an eye, we are way ahead of schedule. So if you skip something you wanted to cover, feel free.
Oh, okay.
Okay.
I'm probably talking too fast. I told you, you guys make. Okay, so plate count enumeration is considered the gold standard for enumeration of probiotics, right? You want to label NCFUs. You're talking about a method that's well over 100 years old now. The problem is that the clinical studies, historically have all been done in CFUs, and so it's difficult to bridge that gap between the new studies that are coming out and using more advanced techniques for enumeration compared to the old studies that all list things in CFU. Again, it's based on whether or not these things are culturable. It has an extremely low specificity, right? All you're looking at is whether or not it works a colony. It's not telling you anything about the nature of the probiotic that's in there. It's not telling you, is it strain A, strain B, strain C? And that opens the window to bad actors, right? Because if I have a probiotic that's $100 a kilo and I have a probiotic that's $1,000 a kilo, I can fudge the numbers pretty easily. And according to the gold standard, you can tell no difference, right? And so there needs to be more done in this arena to make sure that the good actors are being commended for their good work, right? Because what we don't want is people going into the store shelves, taking these products, not seeing a benefit, and then exiting the category entirely and never coming back, right? Because I'm a true believer in what probiotics can do. And so more needs to be done right now as far as plate count enumeration. It has an extremely high variability. And like I said, you can't determine strain specific counts on this. And so to investigate the high variability that exists for plate count enumeration, the IPA has actually undertaken an interlaboratory study in collaboration with strain manufacturers and many of our contract science organization member companies. And we're excited to get that study going and hopefully publish the results sometime in the not too distant future. And so the take-home message here is that it's all about balance, right? The product has to be at the clinically efficacious dose, and it has to be at the time of expiry. It can't be at the time of manufacture. We see this all too often in the industry that people are listing things at time of manufacture. What does that mean, right? Does it mean that this thing is going to provide a benefit? We just don't know. But it also has to be cost efficient, and so there's a balance to be struck here, and the IPA is facing a lot of new challenges with non-GMO, organic and IP protected strains, sustainability and clean labeling. And there's really a global divergence in probiotic regulation. While it's pretty easily understood here in the United States, although I guess we had some spirited debate about it. I will say I'm no regulatory expert. I refer entirely to Bob Durkin over there. Yeah, but yeah, so there's really a global divergence in regulating probiotics, and if you're a multinational organization or a company that's trying to sell into many different markets, it's a total nightmare. As someone that came from Amway, I can tell you myself, it's very, very difficult. These regulations are very disparate, and the IPA is working to kind of add some clarity in a really convoluted regulatory landscape globally. We have over 60 government contacts. We're recognized at Codex and ISO. We have regional task force for every major part of the globe. We're putting up an office in China actually this week. And we have a regulatory workshop scheduled for next week if no one's busy. It's in DC. Bob will be there. And so my call to action is join us in shaping the future. If you care about probiotics or even interested in probiotics, come talk to me and let me know that you are. Here's my contact information.
Okay, so we're going to go to break soon. We're getting set up right now. So in the meantime, we want to bring up some more of our platinum sponsors to deliver their message. And the next up would be Amanda Flothers from BioMerieux to give you. Yeah, I learned how to pronounce that 2 years ago. BioMerieux. Okay, please welcome Amanda.
Thank you. I'll be quick, but thank you for having us. For me, thank you very much for having us here. I mean, Nora's done a great job Thank you for letting us be a sponsor. It's really great to see the collaboration, everybody coming together. I think more industries that we deal with in my field could learn from this, also in the collaboration with our regulatory body as well. So it's a very good job you do here. BioMary obviously I'm going to give you my 5 minute spiel here, but BioMary is a microbiology company, not to be confused with Mary Nutrisciences. We are the diagnostic part, and we're family owned. So 4 generations being owned by the Mary family. We have roots all the way back to Louis Pasteur. I bring this up because it's important. That family legacy puts us in a little bit different of a spot. A lot of these diagnostic companies, don't reinvest as much as we do in our R&D. So actually, BioMary does more than double the standard investment. So 15% we give back into our R&D, and we see this in our investment. So we recently just opened up a new facility in Philadelphia. This is our XPro facility. It is houses our R&D and manufacturing for our molecular and genomics. So a lot of the new assays that we launch in partnership with industry are manufactured here. And you'll hear the term for us, augmented diagnostics, go beyond the test. We have a lot of data analysts, genomics, metagenomics, things like that we're looking at for the future. With that, partnership with industry for the XPro program that we have at BioMary is super important. So instead of just us coming up with a test and saying, here, you guys need to run salmonella, here you need to run generic E. coli, we really took a different approach, and that was to partner with industry to then develop something that was unique and that could be applied to not just the customer we're partnering with, but above and beyond. And so one of those partnerships was here with a group here, they're in the audience here, was with Herbalife. This is one of the first big projects that we did in the dietary supplement space. So the Nutriplex assay is a simultaneous detection of the USP 2022 objectionable organisms. So your Salmonella, E. coli, and Staph aureus. What's kind of cool about this study or this assay and the study is that it's AOAC approved. It's the first assay and only assay to actually be approved, not only against FDA the BAM chapters, but also USP 2022. We got a lot of flack for doing it, but it has validation against it as well. Again, Herbalife came to us with a need. We wanted to address that. They also pushed us to look at not only just the assay at the end, but also the prep and the labor that was involved. So it's a single-step enrichment, a universal enrichment for all 3 targets. And they did a lot of presentations afterwards to show the labor savings and the value that it brought its organization. And then just one other project, nicely set right after probiotics, but another group that's here in the audience, Now Foods. We all know them. They're very vocal and very passionate about their quality and probiotics. They came to us again with that need. So it's not again us pushing something in the industry. They said there is a need for a multiplex PCR assay for simultaneous detection of a broad range of probiotic species. So they wanted that identification, minimal hands-on time. Everybody wants that, right? Fast time to result, and reduced costs, because there's a lot of costs I know when you guys send out to do this. The other beauty here is that multiplex. So being able to detect, and Now Foods does a lot of those, multiple organisms in one final finished product. So with that, we will be launching a species ID panel coming soon, probably in the next couple months. So if you want more information, let me know. But again, thank you for the opportunity to collaborate with the SoCal Consortium, and hope you have a great rest of the day. Thank you.
Hey, can we go to the stock? I didn't think we had slides, so we do. Okay, great. Okay, so I would like to welcome up our next platinum sponsor, John Gullick from SGS.
Well, I'm hoping everybody's having a great day today, learning a lot of new information. I'm John Gullick. As it said, I'm the technical manager and I run the team of auditors across North America. Specifically for this group's concerned, my team does dietary supplement certifications. So what is SGS? Who is SGS? We are a Swiss-based company. We have over 100,000 employees globally, offices in over 125 countries. We do business in like 146 countries. We're the largest player in what's called the testing, inspection, and certification business. With that said, I work for the business assurance portfolio. We do the auditing, the assessments, certifications. We're doing training and supply chain assurance. Those are our big bucket items we do. So I've also been asked to talk about a couple of the other areas of SGS. So SGS also, as you're all aware, has a lot of testing laboratories around the country and around the world. We have a great quality testing lab for QC type testing, routine type testing. And then we also have clinical study capabilities, and we also have good laboratory practices and good clinical practice facilities as well around the country. We also have a new group that we purchased last year. It's called SGS Nutrisource out of Canada. And they do consulting type activities that help you with claim substantiation. Also do certification for non-GMO, probiotics, cannabis, CBD, and a few other things on the consulting side to help you with your projects and making sure that you can get them to market successfully. With that said, the big thing that we wanted to talk to you about today, everybody's been talking about the fact that you need to qualify your suppliers and have a good supplier qualification program. Just so happens SGS just launched a new program called SGS Compass this year. What SGS Compass is, it's a program that works in the cloud that is fully manipulative. So you can decide and put whatever you want in there. So you can put your supplier questionnaire in this system. You can ask the system to ask your suppliers for all those different letters you want every year from them and all of this other information. Once you put your suppliers in there, it sends them an email. They upload it to the cloud. The AI part of the system then recommends what they should improve upon on the documents they give you. And then on your side, it gives you an email that says, hey, here's all the documents you need to review. And the AI portion can give you the option of saying, hey, these are the documents you really need to look at because they may not be as strong as what you'd like to see. And the nice thing about it, you know how every year you have to go back and ask for more documents? The system automatically emails out every year. It says, hey, re-upload your new GMP letter, reload your new debarment statement, reload your BSE, TSE letter. It does all that for you, keeps it all in one place. You don't have to upload it from your email system and then put it into some type of SharePoint system or up in a file sharing service somewhere. It's a really neat thing. For those of you who've managed supply chains using a spreadsheet, the last one I did had 800 suppliers with 8,000 ingredients, and that didn't include the distribution channels to get it to me that you also had to qualify and kind of keep track of all that stuff. I would have loved 10 years ago, 15 years ago to have this software package. So it's a great system. So with that said, anything we can help you with, we're glad to be here to help you. We have our team here. So our good tagline, SGS tagline, when you need to be sure, call SGS.
Okay, thank you for that from our platinum sponsors. So now we're going to go to break. We're going to take 10 minutes. So you guys can stand up, shake your legs out, use the restroom. Guess what? There's more food out there. So please go eat it. So come back in 10 minutes. Well, wait, before you go, hold on. I want to give you guys the rest of the agenda for the afternoon. We have two more prime speakers. And then we're going to have our expert panel where we have tons of questions I heard coming in online. And if you guys have any questions, we're going to try to get all those answers. We have a lot of time to try to get that done. And then after that, we're going to go ahead and dismiss our online folks if they want to leave, because we're going to do a networking exercise called speed dating. If we have enough time, I think we will. But they won't be able to hear that, so we dismiss them. And if anybody wants to stay, because it is Friday afternoon, you guys can stay and participate in that. So with that, go ahead and take a break, and we'll see you back here in 10 minutes. Okay, welcome back, everyone. Can I get your attention, please?
Yep.
Attention, attention, attention. Oh, whistle broke now. Can't do it again. Okay. All right, everyone. Thank you for coming back. We're going to continue with the final couple of speakers for our final program. Okay, and I want to offer an apology and a thanks to our next two speakers. They're both here from the East Coast, and we made them wait until last. Okay, so but first I want to introduce Graham Rigby. He's the president and CEO of the American Herbal Products Association, APA. Over 20 years of experience in health, wellness, and nutrition, Graham has led innovation and product development at New Chapter, Organic India, Care of, and the Infinite Garden. He also helped launch Ingredient AI, an AI-driven insight platform for the supplement industry. Graham holds a BS in economics from the Wharton School of Business at the University of Pennsylvania, and he's passionate about the role of botanical nutrition, technology, and holistic health. He's going to give us an update from APA from the industry's perspective. Would you please welcome Mr. Graham Rigby?
All right, I'm going to do this Siobhan style. I'm not going to get as many steps as she did. Respect the game, but the mic is a little weird directionally, so especially for people online, if you're still tuning in on the East Coast, hopefully you have a fermented beverage in your hand. But yeah, it's great to be here. Thank you for the invitation. I got to see this event online in June and was extremely impressed. And just the quality, the number of regulators here, the information, the networking, the camaraderie. And then I want to start with just saying how amazing it was, Joy, to hear you speak about Ophelia and kind of remember her and these legends of the industry. It's a really amazing thing, and it's great to carry on her legacy. And today is actually Michael McGuffin's birthday, and so kind of in the same keeping, with Ophelia and Michael, we remember them and carry on. So thanks to the committee and everyone for allowing me to be here. This is my NASCAR, sort of slide in terms of my background. You saw the copy block. This is just meant to say, I come from industry. I've only worked in regulated industry, food, beverage, and then dietary supplements for about the past 20 years. I've worked for small companies, big companies, teas, protein powders, soft gels, two-piece capsules. I have not done gummies. Sounds like that was a good choice by me. So mostly because you couldn't get a lot of herbs in gummies. The amount, it's just you're very space constrained. Great for melatonin and other things. Respect gummies, respect the huge business. And then the past couple of years, I've been involved in digital health startups. And before joining APA, actually helped found two companies on AI. So I'm very excited to hear AI permeate some of the FDA presentations and others because it is here. So this is our industry update. I'm tag teaming with Dan Fabricant. We've talked about the different pieces. He's going to let you know what's going on with NPA. And I want to start off with an herbal update. And so a couple weeks ago, Herbalgram, in conjunction with MBJ and Spins, put out their annual herb update report. You've seen this. The industry in 2024 is $13.2 billion. And especially for this audience, who often doesn't get thanked if you're in a quality and regulatory standpoint, I want you to look at that chart and see where on the x-axis you fall in. When did you start in this industry? Because if you started in 2006, CGMPs became final in 2010. If you work for the FDA, if you're a contract lab like Eurofins, if you're, a raw material supplier, whoever in the room, it's you have contributed to this in a big way, right? And we can all see ourselves in that. And in many ways, it's like my husband's legacy started with just working for I'll here. There you go. Like,
So 145.
firms will continue to grow. Our help is the industry. I'm just giving context of what's happening from an e-commerce, at MJ in July, great event. They gave a lot of information. This is one that I found particularly compelling in that e-commerce can overtake other channels the biggest here in the next year or two. And the biggest category growth driver of e-commerce right now are herbs, specialty, and minerals. We heard Bob talk about colored minerals. We heard IPA, John talk like on the slide. We're in the, ready for takeoff stage. And then the last slide I want to show you just in terms of industry is what are the 5 major dietary supplement categories where the growth is. And so this is by health function, health benefit, healthy aging. You might have heard people care about that. Menopause, brain health, and this slide is a little bit confusing, and I apologize because the actual size of the category is in the data label, and then this is ranked by growth percentage. And so if people ask you to work on sports and active nutrition products, fitness and energy, that's a $12 billion category with a 7% growth rate. That's good. So these are all good. And then just within brain health, everyone cares about cognitive function. Everyone cares about obviously aging gracefully, and you can kind of see herbs driving that. And even within sports nutrition brain supplements, anyone take pre-workout products? Have a child that takes pre-workout products? Those pre-workout products, they no longer just contain caffeine. They contain botanicals. They contain things that help you focus, like bacopa. They can contain green tea extract for energy and all the rest of it. And so you're seeing herbs permeate the category in a way that is kind of how it should be. It's how they were, hundreds and thousands of years ago. And so it's really nice to see them come back with a flair. Okay, so everything's great. Herbs are growing. We have this piece. And then in April of this year, we got tariffs. How many people have had to qualify a new ingredient to get a lower cost piece in there to avoid tariffs? Oh, yeah. So even quality and regulatory people. What I love about this headline is you got all of the reasons why tariffs are like this. And by the way, President Trump is not the first president to use tariffs to promote, national interest. It goes long back. The reason there's whole law restricting it is because many, many presidents before him have used it. There's obviously, a differing point of view. And for those of you who don't like tariffs or don't want to think about tariffs, there's baseball. So thank you, Pittsburgh Post-Gazette. Okay, so what's going on with tariffs? I'm going to let Dan talk about the NPA and trades. Vitamins and minerals were exempted in Annex 2. You probably knew all about that. They're part of Section 232 investigation. Dan is going to cover that, and so I am going to choose to cover herbs and unavailable natural resources, which is what Secretary of Commerce Howard Lutnick has talked about. And APA is into coalitions. We obviously work very closely with the other dietary supplement trades. We'll talk more about federal policy here in a second. But on this piece, because it's so critical, and it's something that I was not expecting when the ball dropped on January 1st to be talking in front of the crowd about harmonized tariff schedule, but here I am. And I, have been part of a coalition with a lot of other folks facing the same issue. Cocoa, coffee, coconut, spices. These are, all agricultural commodities that grow and thrive, in climates that we don't have a lot of or at all in the U.S. in many cases. Tea Association, cocoa, etc. We have been advocating consistently for months with U.S. Trade Representative, Department of Commerce, Congressional Hill, the White House, etc. And then we got this big breakthrough a couple of weeks ago. There was an executive order published on Friday night, September 5th, which all of a sudden there's Annex 1 and Annex 2, which was announced in April, and Annex 3 appeared. And it provided a framework with which to get reduced or zero tariffs or botanicals and other ingredients that can't be sourced domestically. Great, sounds so easy. Let's just get those exemptions and do it. Oh, wait, let's get into actually what happened. So the framework here, and again, the thesis when you talk to Trump administration 2.0 employees is that one of the reasons the trade policy didn't work in the first administration was there were too many exemptions. And it's been clear when you look at the trade deals that they want to give America, US economy, US companies a leg up, and they're doing it through bilateral trade deals. You've probably heard about this. This is the same way that these unavailable natural resources are being deployed with regards to how we will get any relief in them. And so they have to be included in bilateral trade deals. Those trade deals have to be concluded. It's a little unclear what that word means, but certainly finished, announced, and put forward. And within Annex 3, basically, there's a provision that only items that are sort of listed within that annex are available for this. And the stakes are pretty big because, as you'll see in a second, this could mean, and it does mean, Japan just announced a deal on September 4th with the US that refunds are given to people that paid higher tariffs to the lower rate that's been agreed to. And so the stakes are pretty good. Annex 3 included 35 harmonized tariff schedule codes that members of industry, APA members, have been importing against. And so that's really good. Things like turmeric, things like green tea. It also had several dozens of others, including ashwagandha and others that were not included. And so it's a pretty complex issue. I'm happy to talk to anyone about it in more detail. But basically, India is right now in the major focus. The reason is this is one of the last big dietary supplement providing countries that has not signed a bilateral trade deal, the EU, Vietnam, Indonesia, Philippines, and others. So we've met with the India trade delegation at the embassy in Washington, D.C. a couple of times now, most recently yesterday. And Dr. Ajay Kumar, who's the Minister of Commerce there, is aware of this issue. We presented him kind of this list that we had collected from member companies and industry companies, ashwagandha, neem, senna, a lot of, trikadu, triphala, travanprash. I mean, like, there's a lot of great goods from India that aren't made domestically. And he really feels that there's a big possibility here. You might have heard in the news geopolitically, India is a little bit in hot water because of Russian oil and some other things. There was a delayed trip. You probably heard that the USTR delegation did not go to Delhi. They were there last week. And so there's a little bit of countering goals here because clearly we want more bilateral trade deals. That's a major initiative and goal of the Trump administration. And so there's a lot of emphasis behind this right now, and it's an area that we're deploying a lot of energy and effort, specifically because, again, if we can get refunds, if you think about all the things you've had to do, you're probably in these meetings where you have tariff pressures. If we can get some of the refunds and some of the biggest botanicals that are being used by your companies and by the industry, that would be really incredible. And we have to get them in the bilateral trade deal with which to do that. So that's kind of a quick update there. Now, you might also be asking, there's some lawyers in the room, but wait a second. I heard that there's court cases happening on tariffs, and what then? Is this all just kind of a couple of months, and why do we care? And this is an article from the Wall Street Journal, the end of August, that basically was recounting that the Court of Appeals upheld a lower court decision, trade court decision, that basically said, these tariffs that were passed under national security reasons violated IEPA. Again, you probably don't want to know all about the history of that. But what it does mean is that it's been appealed to the Supreme Court. They are going to take the case. They have taken it, and oral arguments are happening in the fall here. So that means that we might have a decision by the end of the year. And what does that mean? That means that by the end of the year, if they're overruled or if the lower court sort of decisions are held, then basically any tariffs that have been deployed against this will need to be refunded. And that's a lot of tariffs paid, right? So How that works and the mechanics, we're watching the Japan deal quite closely because there's a microcosm. CBP definitely has given refunds for duties before. But that's really important. And some of the key administration figures are already kind of signaling to what this is. Secretary Bessent on Meet the Press a couple weeks ago talked about, the need for refunds. But one thing I want to clarify that he said was those that are given for the fentanyl crisis, and there's 3 countries in particular that were noted for that: Canada, Mexico, and China. Those are not necessarily kind of looped into the same national security bucket as India, Vietnam, EU, etc., others that don't have the same sort of position or rationale that fentanyl was part of the reason for these pieces. And so last piece I'll talk about tariffs, and then we're going to move on to more fun stuff that we all love because the FDA is in the room, federal advocacy. And that is, this is not the end of it. If the Supreme Court says it's gone, there are other levers the Trump administration can use. Other sort of Section 232 you've probably heard about, that's for vitamins and minerals. Probably have not heard about Section 122, which is basically a tariff power that the administration has. It's limited in size and duration, but it is to impact trade imbalances. And so that could be up to 15% for up to 150 days. So it'd be limited. But again, the reason these advocacy and this engagement on a country by country level and working with countries is so important is because it will not end. Even the Supreme Court says this first go round wasn't there. And it's really important that we are educating, all of these important government officials on the role of botanicals and, where they come from, so that education also carries over into all of the other things that will happen the rest of this administration and obviously going forward. All right. So in May of this year, you probably all were part of or helped your company give comments, or you gave to the your trade association sort of the RFI from HHS, from Secretary Kennedy, looking for regulatory reforms. Everyone participated in that. In the trade press, there's been sort of the Dietary Supplement Trade Coalition, which is APA, CHPA, CRN, and UNPA. This letter to Deputy Commissioner Diamantis has been publicized. What I'll also say is that, and Dan might talk about it, but we've also gone to FDA with NPA on some of these particular issues. So we're in agreement on a lot. And what's important for FDA is oftentimes we hear the criticism of, you guys aren't agreeing on this issue. Why? These are things that those 4 organizations agree, and there's certainly one in particular that Dan and I have been to FDA on that are there, and that's really, we want to focus and provide the agency with things that they can do quickly that don't require rulemaking in a lot of cases, or there can be some selective enforcement or other ways to sort of go about that. And they sort of fall in 3 buckets: labeling, ingredient status, and specifications. And specifically, one of the pieces, obviously 21 CFR 101.4H refers to Herbs of Commerce First Edition, which was published in 1992. A few things have happened since 1992. Taxonomies have changed, all sorts of things have happened. And so we would love there to be kind of recognition that this latest edition is one for labeling purposes to make sure properly labeling. So we would love that to be included. Probiotic labeling. Consumers don't buy probiotics that cost a lot of money for 10 milligrams. Could be out on a limb here, but CFUs is how they buy it. And so that's something that obviously is really important to the broader dietary supplement industry. How many DSHEA disclaimers does one box need is sort of an open question, and one that we have pretty strong point of view on. One is the answer. That's obviously how the agency has done enforcement against that piece. And then we heard a lot about NDIs today. Glenn he kicked us off, right, saying that we're going to get more of the NDI guidance, which is great. Clarity on sort of ingredient innovation, how we can things move forward. We're in total agreement. We need that. So it's wonderful to hear the agency talking about that. But, draft guidance from several years ago on how to enforce NDIs as they're being finalized is probably one that can come back. The reason a lot of this is important is in a deregulatory stance, when you think about rulemaking, essentially the rule is 10 regulations have to come off for one to go on. And if grass is sort of being worked on and other things that have been signaled from the agency, we wanted to sort of provide several examples of things that could be done quickly. And obviously there's many more where that came from, but the point is here, what can we sort of action in the near term? And the last piece was just specifications. That kind of is signaling, can we follow USP as it relates to long-term specifications? Siobhan talked about in her presentation the balance of stability and overages and all these things. And so under USP for drugs, obviously you get the 90% minimum label claim at the end of shelf life. And so there's an appeal to see if that's something that can be done here as well. And on specifications, I think there was a great answer, and Siobhan had like the all-stars answer. It was super smart. I'm learning next year. You'll be up here with me. So in one of the responses to what's an appropriate standard for ashwagandha was with analytes, right? That was, one of the methods or specs. And my only addition to that would be that is appropriate for certain types of articles of commerce of ashwagandha. Specifically, if that's a 10-to-1 hot water extract of ashwagandha, that could be totally appropriate. If it's powdered botanical ashwagandha that's going in a tea, may not be appropriate, right? You're not controlling for that. You need aromatics, you need other qualities of that botanical. And so setting appropriate specifications for botanicals is a critically important thing. And one of the things APA and will continue to work with the agency and industry to give guidance on, because not all herbs, not all articles of commerce from the same herb are the same and should be treated the same. And so that's something that we'll continue to work on as well. And then I really appreciated Bob Durkin when he said botanicals are hard from a toxicology standpoint. And when you're doing self-affirm grass, there was, I'm not going to repeat what Bob said, just watch the video back, +1 to what he said. But what I will add, having done self-affirm grass myself when I was in industry, is botanical toxicology experts are different than chemical toxicology experts, right? When you're doing a chemical safety, you're not thinking about Southeast Asia and the food patterns of cultures for the past millennia. It's just not something that comes into it. And there are many different ways that botanicals are. That doesn't mean that FDA can't do it. They absolutely can. But I think as we think about regulation sort of forward, these something that we definitely get on give them to a soft over time. And then fully sort of saying and Kara in the spring, I asked her about coming from AI industry, and she was kind of didn't reveal too much, but Elsa came not long after we had that conversation, and it is here, and it is critically important and will completely change the face of the industry in very short time, and in ways that you might not be thinking about. You've heard, all these slides are AI created. Obviously not Commissioner McCarrick, he's not AI created, but so watch his YouTube. I think that's absolutely real life. But there are ways. Obviously, people are using AI in claims research and how they're summarizing data. These are things that need to be QA'd. There needs to be humans, but your employees are using AI every day. Does everyone have an AI policy right now at your company? Some? I see a few. Okay. So, yeah. How many people think their employees are using AI for work every day? Yeah. So this is something AI is being used for weeding. Not the robots don't look like that. That's just like a funny thing that ChatGPT did because it doesn't know what a weeding robot looks like. But it is being used for weeding right now in agriculture. It's being used in ingredient development, not just in pharmaceuticals. Okay, the human biome physiology, metabolic functions are being simulated faster by AI than they ever have. And so precision fermentation ingredients are coming here faster. And so this is a conversation we need to have as an industry. And so if you're interested, definitely come find me. We've just announced we're launching a technology and AI innovation committee that will have these 3 subcategories, and there's probably going to be lots more. But we need to have a conversation with both the agency and ourselves of setting the right guidance policies so we can use AI appropriately and we can have human QC. I've worked for 2 AI native companies. I cannot tell you how important human quality control is on AI output. It's extremely high. And so as we talk about this, the humans do have a role to make sure the amazing processing computing power of AI is being deployed appropriately to help our industry take it to the next level. And with that, I'm going to hand it over to Dan.
Okay, and last but not least, okay, this is our final speaker of the day. But we will have our Q&A session, and I'm told that there are a ton of questions that came in online, and I hope you guys have questions too. So we'll try to take as much time as we have allotted to answer those questions. But our next speaker, again from the industry side of the update, is Dr. Daniel Fabricant, President and Chief Executive Officer of the National Products Association, the nation's oldest and largest nonprofit organization. I got a long bio here, and he's staring at me right next to me. So I'm gonna, yeah, he doesn't want me to read it all anyway. So yeah, this man needs no introduction. Dr. Daniel Fabricant. Thank you.
Thanks, Mike.
Good to see you, man.
Thanks, Stephen. I really appreciate it. And thanks to Joy and Nora. I think I'm the only non-board member that's been to every one of these this year. So that's pretty good. So good to see old friends. Good to see some of the new people. We'll see if you make it. All right. A lot to cover. And thanks, Graham. You teed up a lot of it nicely. It's really a pleasure to be here. Though one thing you guys don't realize it, but you owe me something. We'll take care of it. I had to miss one of our key personnel's birthday was yesterday, so flying in here and missed that. So we'll make it up to him. So we're going to cover this largely, some recent NPA actions, advocacy wins, current priorities, importance of engagement. You heard a lot about tariffs from Graham. Didn't quite hear the whole story. There's a bigger picture. Some good stuff, developments late, but the early developments have saved the industry a lot of money, kept consumer pricing down. When you have a consumer price index, as I'm sure you all know, anyone in marketing here? Yeah, they know consumer price indexing. So CPI is tough right now, so people are having trouble spending more money. So it's great that we've been able to alleviate costs while still keeping quality up and those sorts of things. At least that's what the slides from the FDA folks showed, that, quality, we're doing okay still. But, we'll hear more about that later. But really happy to have Glenn here, as well as Siobhan. Gary, not so sure. But I appreciate them moving Gary into my slot because I usually try to keep people up after lunch, but Gary gave everyone indigestion, so there's no way you guys are going to sleep. So really good. So Gary, way to scare the hell out of people. Your reputation precedes you. Hey, we're here for you. What we're seeing in Congress and with FDA and states, I think you heard great stuff from FDA. There's some stuff going on where you hear a lot about MAHA. 2 and 3 are kind of combined. No one's against MAHA. Of course, we want to make America healthier. But I think you've got an administration that's learning to work with the folks that have been at the agency for a long time and have institutional knowledge, which is incredibly important. And there was a little talk about the grass thing. Just hold on to your seats because that's going to get a whole lot more interesting in the next couple of months. So we are old. We're going to be 90 next year. First trade association in the space. So to the rest of you trade associations, you're welcome. It's really important. We represent about 500 members, about 10,000 locations. We have retailers as well. Generally, our members stay with us a while, about 15 years on average. Our board includes the great folks at Now, GNC, Vitamin Shop, IFF, NutriBulk, Ghost, really wide range of businesses, Leaf, Cereal. So thank all of you who are here, especially California businesses, short distance, and those who travel even longer. Thank you very much for coming. This is important and good to discuss the topics. So, and I saw the folks from IPA talked about what a trade association is. I think the key thing this day and age is value and values. Who's fighting for you? Who's actually fighting for you? Things have changed in DC a lot. You can't just be a talking head anymore. That's nice. Everyone's got an opinion. There's this great new thing called Twitter. I'm sure you've heard of it, where everyone clearly expresses that in a pretty widely spread manner. So there's got to be a little more. Folks have to work behind the scenes and fight. And so that's really important that you know what you're getting into and that they are fighting. This is from our fly-in day this year. I think Petra's there. You see Adele. See a lot of friends and family. So thank all of you for coming to that. We're doing a lot more of that. It is important. If you don't come to DC, and you should, make sure you at least work with your local your constituent office and have people come to your facility from your congressperson's office. Make sure they know who you are. As you heard, we are a regulated industry. Surprise, surprise. As Alon said, tell your story, and that's your story. As we are a regulated industry, there are about 6,500 associations in DC. There are fly-ins every day, multiple fly-ins. DC, despite popular belief, only has so much oxygen to go around. So everyone is sucking it up constantly. So you have to make sure your story gets told. So thank you for that, Alon. It was very well said. All right. So why do we have to have it? And it got cut off at the top, but at least the internet's still on, so we're good though. So why do we need to come? Why do we need to show up? Why do we need representation? Why do you need to participate? People love us, right? We're making America healthy again, right? That boy. Not necessarily. 55% of members of Congress were once in state legislatures. Well, isn't that a good thing? Not necessarily. Bad ideas don't just come from Washington, D.C., despite popular opinion. A lot of media coverage, public interest, commercial forces, regulatory frameworks. You'll hear again and again that the drug approval process is the gold standard. Well, it's the gold standard for drugs. We're not drugs, so that's an important consideration. And it doesn't work for everything, as you can talk to some fine folks in the back. There was this great place called Purdue Pharmaceutical a few years ago. That drug approval process might not have worked so well. So with all that said, it really is a lot now about being able to frame the discussion. And there's such a shift digitally that everyone's an expert. So even more important, especially the folks in state legislatures. So this is important. I hope, can we play that back there? There should be a button to play it. If not, that's Kyle. So I missed his birthday. This was him at the Mass State House. Long story short, he got berated by this lovely woman who's chair of the health subcommittee who told him, there we go. Will it play?
Not only telling you that, the FDA is telling you.
I'm not worried about FDA's telling
They're the
you.
chief regulator of something.
No, the FDA is not actually overseeing eating disorders and healthcare illnesses with children.
They're not. That's cool. Because last time I looked, MedWatch is in Massachusetts, and National Institute of Mental Health has a definition for eating disorder that would fit the criteria for 3500A. So the notion that FDA isn't monitoring eating disorders, there's a lot of drugs that lead to eating disorders, things like that. So this is unfortunately the information that's out there. Now, she went after Kyle a little bit and got reprimanded by the Speaker of the Mass House. Surprise, surprise, I wonder how that happened. But it's important to know that this is what's out there. No matter what you think, and to Alon's point, when you do a quick chat GPT search and look at AI, it's really important now more than ever to gets told, because there's this sort of thing out there where, this woman, I'm sure, loves to protect children and everything else, but also doesn't care what FDA says, as she made clear on everything else. So it's important to recognize that there are folks that sometimes get a little bit ahead of themselves when it comes to these issues. And states have been one of the biggest issues to the industry over the past probably 8 to 10 years. It started in Mass, actually, where they've gone after us saying that products are leading to eating disorders. We've beaten in Mass every session of that Congress. The only one that's come to state law is in New York. And we've been very lucky here in California, because I think if anything like this was to come into place in California, the rest of the country would have age restrictions and other restrictions. Now, the challenge with these bills is they're not written by anyone who has a real expert in how the law is implemented, how the Federal Food, Drug, and Cosmetic Act works, from claims to quality to adverse event reporting to everything anyone here does when it comes to regulatory affairs, right? We have really 4 pillars. We have ingredient safety, NDIs, GRAS, we have AERs, we have GMPs, and we have claims. So when you see legal proposals that really gut all 4 of those, it makes for an interesting patchwork. So this is something that's coming fast and furious, and it's not just based on what's happening in this industry. A lot of the GRAS discussion has led to discussion on food uniformity, on having one set of rules, not 51 sets of rules. So stay tuned on that. But this is even more important why it's really critical to get involved now and have some of these discussions, because I think a lot of times the folks at the state level may not know all the burden we do have. So Graham covered some of this. So Now, you guys in the back can't raise your hand. Everyone knows what the unified agenda is, right? How many people have looked at the unified agenda? Okay, so I did one good thing today. Know what the unified agenda is. Go into your Google right now, go on your cell phone, type in FDA unified agenda, look it up. It will tell you what's coming down the pike from FDA. This is where the notice of proposed rulemaking on grass is. This is also where the NAC proposed regulation is. Those of you that aren't familiar with that, you should be. We sued the agency once upon a time. Now, that doesn't mean I'm upset with the FDA folks. It just meant we spent more time together. That's all it means. So, with that said, and also talks about the exemption from IND studies. So look at the unified agenda. You should be familiar with that if you are in regulatory affairs or any sort of quality function, because things that are posted there generally affect you and your work. So really important, because the grass issue, and there's not much meat on the bone there, but it does give a timeline, looking at something around October to have a discussion on grass. The larger discussion is, it appears, and looking forward to the Q&A, it appears that the agency is going to move towards requiring going forward some sort of notice to the agency. Now, I think from a policy standpoint, we are largely the only country in the world that when a new ingredient gets put onto the market in the food supply, now this is on the food side, not the dietary supplement side. Dietary supplement side, we do have to notify. But if you have a new food ingredient, you don't have to notify the agency per se. You can self-grass it and nobody has to know, right? Genie goes in the bottle, shut the bottle, throw it on the beach. A little bit odd. So that's what they're trying to address. The mechanics of addressing that are a bit more complicated. For instance, for our industry, we heard, I saw a nice tennis match earlier between Bob and Siobhan. That was nice. We can continue that on the pickleball courts. But there is the grass loophole for whatever that is. And the grass loophole is confusing to a lot of folks, rightfully so. But I think the real challenge is that folks have done this process where they've grassed an ingredient, haven't told the agency, haven't notified the agency, stuck it in a food product, and then stick it in a supplement. And so how is the agency supposed to know that happened? So having some sort of trigger date or grandfather date is really important. I do have to say one thing, and we did submit a joint letter with APA, which was great, on amending 10193 and the disclaimer, really important. But the other trades, there is an authoritative list of ODIs. We have it. No one else does. So this is important. And the agency actually does use it time to time. I don't ever expect an official citation, just, a card at Christmas time. So it's really important that, we check the sources of these things and we have a real clarity going forward. Another piece that's critical is it always seems like we're playing defense. Well, not so fast. We are trying for the 10th consecutive Congress to get FSAs and HSAs through. It is closer now than it's ever been before. I think you heard me say that last year. So you can, pinch yourself right now, and then next year when I say the same thing, you can certainly correct me. However, the difference is, I think we'll see some support from HHS pushing IRS to do something. Now, as many of you know, the folks at FDA, there's one agency they don't like either in the federal government, that's the IRS, because nobody likes the IRS. So, but I think it is something they are looking at and seeing what's possible there. So keep your fingers crossed. And then trade is a bigger issue than just tariffs. We have a problem with dumping, big time problem with dumping. We have our friends to the north. Anyone here Canadian? I'm not going to hold it against you, don't worry. But we have a challenge where Canada, with some milk solid products, colostrum, some starting ingredients for probiotics, some whey ingredients, some premium whey extracts, have been, I'm not going to accuse them of fixing prices, but I'm not going to not accuse them of fixing prices, but there's some questions. And so there are other issues. There's gelatin issues on dumping. There's a lot of issues like this that are going on and pressing the industry. So these are things too to pay attention to. If you're not familiar with the ITC, definitely follow what's going on in ITC because it guides prices and also guides quality parameters. What's the easiest way to undercut a price? Generally, lower quality materials, things like that. So something to keep an eye on and be mindful of. All right, our current priorities, as we said, hopefully it won't be a priority again next year, FSA, HSA expansion. And Graham touched on this briefly, and I'll go quickly too. Drug preclusion reform. We've had to sue the agency twice now. Matt Anania from Cellmark is here, Matt, and Brooke was here earlier from IR, but she left. They really were critical in making sure NMN stayed on the market. We have a lawsuit currently active against the agency on NMN.
Now, while it has been stayed, so FDA can make a decision, there was a previous decision made on an earlier lawsuit on NAC, which we talked about, which is at the reg writing, at least OMB stage, which is promising. So if there's a reg saying, hey, something can walk in both worlds, the secretary does have the authority, which they do per statute, but uses the authority to say something is both a drug and a supplement. There's reason to believe, and I will defer to the FDA colleagues in the back, once the government does something once, generally they keep doing it. So not always, but usually. So that's a good sign. But it still begs the question of if the industry has to sue the government every time these disputes come up, not really an effective way for the agency or the industry. Frankly speaking, the agency is probably more expensive. I think there were at NAC anyway. There was my understanding was over 20 lawyers thrown at from OCC thrown at that issue. So it's important that we find a way to resolve some of these issues in a more I don't even know if efficient is the right word, but in a more strategic manner. So something to consider. And then you'll see Senator Durbin, who has been a longtime critic and foe of the industry, is finally retiring his spurs, going back to Illinois. He will more than likely try to move pre-market. I think someone said my favorite word is registration or something like that. So yeah, it's pre-market approval. When you have a list and you're effectively making e-commerce in charge of setting what's on shelves, that's really should be a non-starter for everybody. It's an approval scheme and not one that particularly helps anybody, just adds to costs, which passes down with consumers. So, but these are our priorities and really should be the industry's priorities. I'm sure we can come up with a bunch of others like, hey, let's help Charlie Brown finally kick the football from, Lucy holds it. But I think realistically, these are some of the issues that still need to be resolved largely, especially the drug preclusion issue. But there's more. We have dietary guides this year. You should have a pretty good draft coming up in October. Now, why is that important? That's important because as we're looking at chronic disease differently, there's a chance to really redefine what essential is, which is important for the industry. Essentiality is now things like vitamin C for scurvy. So anyone run across a pirate in the last, 20 years? Right. Not a whole lot of scurvy going around. However, it's important that we understand why we're picking the targets we're picking for essentiality. So that's something that, and the administration is willing to discuss this at very high levels. So it's really important. We touched on drug preclusion. NDI enforcement, I think that's a critical piece, and that ties into the grass piece. I think, and very fortunate that I think, and Glenn said it best, I'm going to ask Gary and Siobhan a question now, and they can answer it on the panel. I think you guys asked people how they've determined their ingredients are NDIs on inspections, which I think is great. I think people should be prepared for that. And certainly it shows they're taking these things serious. Now, we need to see enforcement be uniform. We can't have one company submitting something and then somebody making a chemical alteration, using bacteria, using something else, and respins just saying, hey, it's the same. I'm going to ride on their coattails. So there needs to be some clarity there. Grass, as I said, is going to get a whole lot more interesting. Looking forward to the panel and discussing that. And trade. So can Congress get anything done? Not necessarily, but they were very helpful to the industry on tariffs. In March, we went over when they first started calling for some of the IEPA stuff. We were sending them lists. I don't know if amino acids is misspelled, but I'll talk to someone back at the shop. But the big thing is this, is we aren't done yet. Annex 2 exemptions in the first 2 months span. So from April to June-ish saved the industry about $250 million. By the end of the year, that'll be over $1 billion. And there were some botanical ingredients on there, not a ton, but some peony and things like that, which is significant. So certainly having folks, and this was from back when his Senate, it's interesting. For someone who's talked very positive about the industry, there still seems to be some misunderstanding of how it works within the Food, Drug, Cosmetic Act. So important to keep this all in proper context. But I think the key thing is this, is as you've seen this year, and if you haven't been paying attention, government can change your business quicker than anything. We have some folks who have, like we talked about, NDI enforcement, that we want to see enforcement on. We want to see a pathway for NDIs. We want to see a pathway for NDIs and things like NAC and NMN. Peptides, nobody really touched on. Peptides are something that everybody's interested in. People are working on peptides from dietary ingredients, dietary proteins that we eat every day, but they're also working on the pharmaceutical side. So having those things lost to just be therapeutics versus being health products, that's something that should set off alarm in everybody. And how do you set up a system that really satisfies both of those? So as we talked about, tariffs were a major victory for us in the industry. And as Graham pointed out, there is some room to negotiate on Annex 3. I will give one word of caution on Annex 3, and I think Graham touched on it. I heard from companies right away saying, well, we can't grow ginkgo in the United States. There are ginkgo trees all over every major city street everywhere because they are great accumulators of heavy metals. And they do a good job. They put them on heavily trafficked streets because they keep the air and they keep the sidewalk a little cleaner. We have them all over DC. You walk anywhere near the Capitol, there's ginkgo trees all over the place. So when people say, well, these botanicals can't grow in certain locales, make sure you know what you're talking about. Make sure you're exactly clear on that. And to Graham's point, if it's a country like India that is insistent on buying Russian fuel, and that probably won't be something that spurs a formal trade deal to get worked out. You have to be very aware of those issues. There probably won't be a long-term trade deal resolved in the next 6 months, I would say, with either India, China, or Russia for some of these geopolitical reasons that everybody loves to watch the Sunday talk shows about. But good things to keep in mind as they pertain to your business. So good time to also talk about reshoring, and there's a real appetite for that for the industry. We're looking forward to the end of the month and see what happens on NMN. There was a 2-month extension of that case, so we should have a decision by the end of September. And as we said, with NAC and with that reg pending on the unified agenda, it'll be the first time ever the secretary has used a reg that says something can be both a dietary supplement and a drug. So stay tuned. And Graham covered most of this. Anything new added to Annex 2 would have to go through 232 review, but there is room on Annex 3 for, as he said, natural resources, natural materials. I would also caution folks, some folks have also talked about fish oil not being covered and things of that nature. I think that's a tough fight to have. The White House and trade representative, no matter who's in office, always wants to stand up the U.S. fishery industry and things like that. So certainly something for consideration if that's an area you want to dive in. Just something to be mindful of, and we will certainly be continuing to meet with the folks at the White House, trying to add more to the list. So, and we know we put that call out to our members, as has Graham, and I think that that's really important that folks continue to engage with the White House, with the trade rep on adding these things to the list. So, certainly participate early and often. So there's Jim Emmy, chairman of our board, the CEO of Now Foods with Dr. Oz at the MAHA. That was the release of the first MAHA report. That was a group we took over the White House back in March, start talking about the tariff relief that we were able to get. So it's really important now more than ever to get involved, get engaged. It's critical for what happens. And I think to Jim's point, it's well said. We do have a window of opportunity right now as an industry we need to take advantage of. There are election cycles, they come and go. We've never had a secretary say things as favorably about the industry. At the same time, there's some questions about what's going to happen with grass and so on and so forth. So have to stay tuned, but have to get engaged. This is critical. We've had very good dialogue, and I want to thank Alon. He certainly did a lot of work early on with the folks in Kennedy's shop as he was running for president, and certainly helped us with some key contacts. So thank you for that. And we've had some there's a lot more coming, but I think we've had a great interface so far with the folks in the secretary's office. So stay tuned. So got to pay the bills here. Become a member. Ideally, I think you should become a member of us. If you aren't, I will find you and email, call, tastefully done, of course, nothing over the line. But it's important. Come to DC. We have the largest fly-in, and we do spend a lot of time on Capitol Hill. Kyle, who was up there earlier, he spends a heck of a lot of times up there a lot today. And like I said, you guys, I missed his birthday, so you guys are going to help me wishing him a happy birthday because he's critical for the industry, whether it's testifying in the states or beating on the doors of members of Congress on a day in, day out basis. That's just what the industry needs. So with all that, again, I really think now's the time more than ever. If you're not involved, happy to see Bob here. Bob wasn't at FDA when I was at FDA, but I think it's really important to have a chance to interact with folks who speak the language of FDA. Probably during the Q&A, Gary and I could tell a somewhat funny story, no names, of some recent dialogues we've had. And I think it's important. It is important to have those relationships, have those contacts, and have have the ability to, even if you don't agree, have the ability to discuss some of these things with folks at the agency. They're hard. They're working hard as hell. That is, and I think Glenn undersold it today. I thought it was 25 cents of every dollar is an FDA regulated good in this country. So, but that's important. With all the cuts, with everything else, the agency covers a wide range of turf. So you really do have to engage, and that's not. It's not always as natural for folks who haven't been at the agency. I think it is for the folks who have. So really important to get involved, influence. And with that, I know I see the eyes fading, so everyone needs a little more coffee. And for the speed dating, I'm going to need to see your financial profile before we talk. So with respect to that, if you need anything, email me. But thanks again, Nora. Thanks for everybody here. And I guess we do the big Q&A now, Stephen. All right. Okay, you can take that and put it on the table. Yeah. So now we're going to do our big Q&A session. For all of the speakers, you are invited up to the table. It's our panel of experts, and we have enough chairs. Okay, and I want to invite up a couple of committee members as well to join the panel. Joy, you coming up, and Nora. Okay. And I know there's more experts in the audience, so if it's have a chance to answer a question from the audience, we will allow you to do that as well. Okay, so I heard we have a ton of questions from online, so we're going to go back and forth. Question online and question in the room. So go ahead, Jocelyn, start us off with the first question from our online viewers.
Okay, so the first question is for Bob. Can botanicals be utilized for color, and how would you present it on a product label?
If you use it for color, it's a color additive. As we talked about this morning, it would have to be in a regulation. So it depends on which botanical you're talking about. There are botanicals that are approved as colors. There's even a couple that I believe are kind of grassed in a way, but it depends on the specifics. You have to reformulate with something that meets the regulation, and the intended use in that regulation has to include dietary supplements.
Do we have a question in the room? Don't be shy. This is your opportunity. There we go. And from the room, please state your name and company and then ask your question.
Sure. Will Tim Paragon. I actually have a question for Glenn on something you touched on during this Q&A. My apologies for making you stand up. So today during your key speech, I learned that OI will be leveraging L for risk analysis that will feed into OI as investigation priority. I have a question on what kind of information database is being made available for ELSA, and if the agency has any concern for possible AI hallucination that seems to be common for these kind of generative AIs.
I mean, ELSA is really an internal AI system that was developed for the agency. I very seriously doubt that ELSA is going to be made available publicly outside of our agency. It's a learning, and that they've had some issues with it, but it's a learning in progress. A matter of fact, we just started a brand new project on the ELSA to the point that they're going to probably make it comprehensive, and the goal is they're going to have. Let me see if I get the name right. It's going to transition to a bumper it's called Halo. Virtually every center, that means food, drug, devices, everybody will be feeding into this one major AI system to really help us do our job. But ELSA is going to be an internal system.
Was regarding I believe the ELSA or the Halo will be based on Claude, I'm going to guess, which is common for the generative AIs. And I've been recently hearing about a lot of generative AIs having AI hallucination problems. So does agency have any concerns regarding that?
I mean, Sure, there have been some, but I think it's a work in progress, continuous. I mean, sure, sometimes it's giving you some answers, you sort of scratch your head, but that's how the system learns, really through the interaction. But yeah, I think we'll get there. I think the agency is committed, the commissioner is committed to doing it. It will become part of our jobs. It will not replace the human, but it will be there to assist. The goal is to decrease the amount of administrative burdens that we have so that we can do more. But it's going to be additive.
Yes, the next question is for the full panel. Is the SHEA 1994 still relevant, or do you see an overhaul or modernization of the SHEA in the future?
I mean, I think you've got the biggest challenge in the food drug. DSHEA is an amendment to the Food Drug Cosmetic Act. I think there now 230 amendments. Food Drug Cosmetic Act. About that, 230. You should know that. You should know that. You should teach that in your 340 course. Well, that's not an amendment, but DSHEA was an amendment to anyway. There's got to be something done, not just for dietary supplements, but foods overall, because you have NLE, you have some state preemption on NLE. Now you have states going all different ways on food regs, including dietary supplements. California, we just got an exemption on that infant food, Freudian slip, infant food rule, which is like a double Prop 65, right? I mean, I thought infant foods were covered under Prop 65, but now they're not just covered, but they're on double secret probation. So I think as you see more of these sorts of things, you've got to address the state issue. You've got to have one set of rules. You can't have 51 sets of rules. So I think that's the biggest, if you will, thing that has to get addressed first with not just dietary supplements, but all food regulations. But, you're going to hear some folks nitpick about, we want this, we want that. We want to, I love the folks that want to recognize third parties for inspections. It's like the best thing FDA does is inspect and test. I mean, I think that's what anytime there's any sort of polls, that's what Americans expect, right? So, let's outsource that. I mean, it's ridiculous. But people will come up with their pet projects. But again, and this isn't to cast aspersions or stab at anyone, but it's just kind of. I think some of it's oversold.
I think my first answer to that question would be yes. You heard all about today, 1994. I mean, there are a lot of additions and evolutions and innovations that are talked about, but the core framework of DSHEA and look at the CGMPs that were passed, and then all of the categories that have gone after us now, cosmetics and others that are kind of having their own awakening moment. We're in front of them, and so I think just sometimes nothing's black and white, right? It's all evolution, but the idea that a lot of that core foundation won't sort of be in place with some of these evolutions, I think, is probably just to kind of balance both.
So yeah, I mean, the shade obviously still is important. And it's got good bones. It has a good structure to it. It's an avenue to market. It takes safety into consideration. I think one of the issues is that FDA's boxed itself in where that's the only analysis they do is safety. And they've never embraced that the standard for food is a reasonable certainty of no harm, where the safety standard for a supplement is a reasonable expectation of safety. Congress chose different words for a reason. And I think FDA regulates supplements almost from a safety perspective like they're foods, where they don't allow a risk benefit equation at all. It goes back to like the alkaloids case the ephedrine alkaloids case where FDA said, if there's any risk, it's too much risk. If we can articulate a risk, it's too much. And I wonder if DSHEA would go further now with how advanced we are from 94 till now in science, 30 years, to better articulate what the safety standard is to allow more ingredients on the market.
I really hope I don't get myself in trouble for saying this. Because again, I don't work for policy or enforcement. Foods came out with 117 with the emphasis on preventative controls and preventive controls for safety. And I feel like dietary supplements has not taken that step. We are still in the reactionary phase. No, I'm talking about like the idea of thinking preventatively and the regulation. Yeah.
I don't know if that's right though.
No. I think in any update to DSHEA, clarification of language and thinking more preventatively would be helpful.
The counterpoint I'll offer to that is 11170 requires you to set specifications that you're supposed to understand your ingredients, your product, and your manufacturing process.
Supposed to.
Well, that's the regulation. It's 11170, and you're supposed to build those into your specifications. You're supposed to identify every hazard possible for your product and build it into your specifications for that product. If you're using a botanical, it's heavy metals, it's pesticides, it's whatever. So where 117 allows you have to have a food safety plan. You have to identify every hazard associated with your manufacturing process and your ingredients and make sure they were addressed. 111 should do all of that if you're setting the proper specifications and following them.
And it should, but instead, when the investigators are going out, what they're seeing is a lot of companies have not thought about these things. And instead, the investigators are coming out and saying, okay, well, you're putting these ingredients into the products and you've looked at it and said, I put the botanical into this glass and I add hot water and I drink it and I say, yep, that's the correct identity. Looks great.
To your point, it's shocking that consistently, since I think it's been kept track of, the GMP observations, one of them is you haven't set specifications for your components.
It's still the top.
It's shocking. It's if you follow, yeah.
So clearly 111 is the solution to the problem. It's just we need better guidance and compliance to that, right? I think is sort of what I'm hearing you say, and I think that's what we hear. And I think often we also, with the agency in the room, they have to deal with the worst of the worst. Those people are not here. They're not on the Zoom right now, right? And so like we have to recognize that in these comments and certainly do that.
Anybody here adding your tea to the hot water and drinking it?
But for those of you that are here and care and have that, it is incredibly foundational and does sort of, so it's complicated, but I think that's where, you know, we sometimes meet in the middle where we're talking with the highly responsible companies. You're dealing obviously the ones that are, or they just need education. I think that's also right. And so that's also a path forward. It's like, how can we continue to rise up the whole industry? We know it's going like this, so we need to do this in order to protect consumers and obviously just improve overall compliance.
So for our FDA colleagues, change the subject, keep the peace. A lot of conversation over the last years about making sure there's harmonization as far as inspector training across the country with regard to dietary supplements, as well as that they're at the right skill level to get your trainings, etc. Any report cards on progress? I know there's been a lot of changes in the FDA. There's been a lot of staff reductions. Where are we at today with sort of that quality of training and of the inspectors?
So in January, we had our first class that was required to do on-the-job experiences. So investigators in the past used to not have to have any sort of official training once they went to a dietary supplement class. As of January, everyone must pass an on-the-job experience with either Gary, myself, or an approved coach that either Gary or myself has said yes. You are a good teacher. You don't just show up and ignore the person you're training and do nothing. And B, you actually know the regulation. January, we had our first cohort. They are all through. We have 11 coaches now nationwide who are approved to go out and train the investigators independently. So they're good to go. I spent 10 weeks on the road, and Gary is currently in the middle of like 10 weeks on the road. We have fully revamped our investigator class. We are in the midst of launching an advanced investigator class for Q3 of this coming year with the University of Mississippi. So that one will be laboratory based. So all of this conversation that Gary gave you on, hey, you need to be being with your quality people, making sure that they know how to look at raw data and look at the machinery and investigate your third party as well as your in-house. Yeah, we're sitting our investigators down with the PhDs and the machines and They're going to be running those machines and looking at the data and running the samples and looking at bad data and good data and like maintaining columns and all of that. So that, yeah.
The question is that they've never done that before, but they're learning to ask the right question, look at the data from Mary and Siobhan. Whereas traditionally, they would go through. Nobody would look at it, nobody would question. Because they didn't have the contact, didn't have the training. But now they do. So I would advise you to listen to what Gary and Siobhan are saying because they're going to ask the question. That's how they're being trained.
And the last one I want to point out is last year we went to every single division and we trained over 600 investigators, compliance officers, managers, anyone and everyone who wanted a refresher on specifications, testing, labeling, the lab, anything else we covered? Yeah, those were the big main areas, but over 600 individuals were in the Office of Inspections and Investigations were retrained.
But I will tell you that these are the individuals that have been conducting independent inspections. And when industry comes back and says, we've had 10 inspections by the same investigator, typically, I wonder why, and we've never had a violation, never had a 483. You come and we have a 20 item 483. Understand that those investigators might have been the ones that were nominated for a coach. And under this coaching program, they did not hit the elements in our internal feedback forms to be able to be qualified as a coach. But to answer your question on report cards, yes, please be mindful that not everyone just passes. It's not a free, you get in kind of card.
Don't be shocked if like 2 or 3 of us show up to your facility because we're doing a lot more training. Being there in your facilities is how they're going to learn.
Send as many people out with us as they can in an attempt to get trained, understanding half of them might not get qualified. Just to give you kind of a base. Again, I'm not giving you the percentage.
So what happened to those that went training? So what happened to those that got trained and did not get qualified?
Give them another opportunity.
Okay.
Turn in the same rating for that as it is Mr. Bonaventure went to our board for the current one. They're the ones being exerted. The coach is there to be able to supply to them where their deficiencies fall. If that coach cannot give them the right answer or go to the right place, you're able to explain that answer to supply them evidence for that junior investigator, that new investigator. It's going to result on Siobhan and myself. If that is the case, we're really training both of those at the same time. And it isn't uncommon for a compliance officer to want to go out too, to have a better understanding of what it means when these are putting into reports. The goal is to have consistency in your report writing so the division has expectations at first line management, up to division directors, and then on to the center. That they have an expectation of a report should be. In return, industry will be able to have an expectation because we'll have consistency in our reports and how we uphold the regulations, which has not existed for this agency until about the last year. And it's going to take time. This is global. This is not isolated to Denver only or California only. This is for everyone. Be patient. We're getting there. Just 2 of us as quickly as we can. Okay?
I have a question. Can I ask a question? We started out talking about safety, and then we went to dietary supplements and the new auditing and the training for the auditors. And I wanted to ask a question of Siobhan and Gary. The amount of dietary supplements that you have audited who have non-compliance, have these non-compliance become safety issues or just non-compliance issues, not involving safety of the products?
The summer has been rough. It's been a 50-50 shot for me this summer. It's been rough. I don't think I can tell you any more than that because of confidentiality, but this summer has been rough, Joy.
Joy, I think that it's become apparent into more investigators what testing and compliance specifically for micro is. I alluded earlier that chemists, I'm sorry, can go from equipment to equipment. It didn't work. It didn't work. We'll dilute it. We'll do this. We'll do that. That mindset is in micro in a lot of these manufacturers. And I'm not pointing fingers at anybody, but it's consistent that we see retesting and we see testing in the compliance and incorporating third parties. So you screen positive for something and you send a fresh new sample to your third party. That is quintessentially testing and compliance and using a third party for micro to do it. You carry forward whatever that pre-enrichment broth is, and that is a safety issue. And I would say we see that quite often.
But not everyone.
No, it's not everyone. Please. Not too many, but not everyone. Okay, Jocelyn, next one online, and then we have one in the room.
Sure. This one's a two-part question, so I can kind of get 2 for 1 in here. But for products that are made for our company, we're not a manufacturer. Do we need to qualify the labs we use for verification the same way that the co-mans do? So a co-man is making a product, they qualify the lab. Does the person that the co-man is making a product for need to also qualify the lab? Second part to that, what is the FDA's position on reduced testing, aka skip lot?
So since I spoke today, I'll answer the first part of your question. That distributor is still required that whatever they receive is not adulterated or contaminated or mixed up. They're still required to be able to either rely on the manufacturer's C of A and invoice and what they're receiving to match their order, or if they choose to, they can send it out for third-party testing. If that's what they choose to do, you're going to fall in the same alignment of what I spoke about today.
But rely the predictive analysis after they have done verification.
For the contract manufacturer, yes. Yeah, but not for the third party. That's it, lab. If they're going to do that, it's only if they're going to ask for additional testing. Well, hang on. Jocelyn actually had a second half first. Okay.
So what if the lab is actually in the manufacturer's facility? Do you do a supplier qualification plus a lab qualification as well, or just qualifying the supplier is enough at that point? Yes. Got it. Thank you. Yes. All right.
From the regulatory but more practical side too, what's your relationship with the supplier, with the vendor? Are you buying out a catalog or are you setting specs? If you're setting specs, then you have a lot more obligation. If you look, there are 2 cases you want to be familiar with. There are 2 terms at the agency that are quite important: control, direction. So there's a case, Daughter-like, that people, corporate execs from a brand went to jail, and there's Park Doctrine too. So if there is control direction, there's a lot more obligation you need to be aware of.
Understood. Thank you.
If you're setting the specifications, you have the responsibility then. That's arguable. And for the first question, should they validate the lab or verify the lab? From a business perspective, why wouldn't you? Why wouldn't you want to know that you can rely on your lab results from a risk mitigation perspective? Or I just think it flows that you'd want to validate the lab.
Manufacturer has the in-house lab. So we buy the material. So the manufacturer, of course, uses our specification, produces the material, but they also test and send it to us, and we take their COFA. But we also do some sort of testing at our end when we receive it, but that falls in that skip lot testing, which is the next question. So
Even outside the laboratory, if you set specifications, you have to have the basis why they're the right specifications. You've taken responsibility for that now into 111.
Second part of that question, Jocelyn?
What is the FDA's position on reduced testing, aka skip lot testing?
I still have a citizen.
Oh.
Thank you, Gary.
It's still the citizens petition has never been answered on that.
Well,
Yeah, I think so.
I asked about that. If there's no response, there's no response. There's probably a reason why there's no response. That's not the reason. So it's for a subset in your finished product. You have to do your testing. What we're going to fall back on is what is your statistically valid sampling plan for that finished product. And when you break it down, is your statistically valid sampling plan appropriate for the size of your finished batch? So not every sampling plan is going to be valid for the bigger sizes of finished product. It works for the smaller batches. And I think, Gary, you could talk more about this, but the bigger you get, the more it breaks down. And soon you're testing 3 units and you made, 500,000. You want to comment on that? Stop talking without a mic.
Oh, I thought you kicked them off. Attributes and variables are critical in when you establish that sampling plan. Is this B12 or again proprietary blend with 50 different botanicals, 7 different probiotics? Where are these sourced from? What's going on? What is your manufacturing? Are you a closed system like drugs? Do you manufacture in ISO 5 through 7 areas, or are you manufacturing on wood pallets in an empty warehouse that's full of mold? All of these things need to be taken into consideration when you want to incorporate a sampling plan for some type of rotational testing, right? 75C requires you got to hit them all at some point. And that's what you're creating that sampling, that rotational testing. Skip lot, I always refer to as maybe not the best practice because eventually you have to test everything. There is no, we're solely reliant on a C of A because we only did ID and we qualified our supplier and then we put it in the finished lot. And it never at some point in production of batches was it ever tested for the specifications you've created. So real careful with saying skip lot. I do like the terminology rotational testing to emphasize that you will hit everything that is a requirement of the reg.
And because we are the people that only have questions and poke holes in the sandcastles, what happens when you fail your specification? Have you now implicated all the batches that came before? You now have to expand out and investigate everything that you haven't tested leading up to the last time when you had a pass to make sure that everything else is fine. So skip lot in the short term saves money, but in the long term, oh crap, you could have a big problem on your hands.
So I'm going to ask you to discuss subset testing in terms of what 111 says, that you may select one or more lots based on a statistical sampling plan. Isn't that skip lot? Or if you don't want to use that terminology, that certainly is saying that you don't have to test every single lot. Correct? Okay, so now are we saying that we do have to test every single lot because skip lot is not acceptable? We're not saying that.
I think also in St. Johnson.
Go sampling plan. Okay, you haven't seen it. Okay.
And you need to requalify the product. That's the point. You have a qualification SOP for the product, right? You have to refill it. Yeah. Right. And the common practice is once a year, right? So I think to Gary's comment that, when it's proper setting SOPs and on qualification and then you fail and you got to go back and redo it. I think the one piece I just wanted to flag, there's a couple of marketing people in here, but testing on every lot is a marketing claim now that's out there. And so it's an agency issue, but it's also something that you should be aware of. What commitments are your marketing teams, sort of signing you up for? That it does not matter what your qualification SOP says. If your marketer is saying we test every lot, And so just be mindful that there are multiple factors at play here with the particular piece, not just sort of the regs and sort of the best guidance.
They can say we test every lot, but that doesn't mean they test every ingredient in every lot that has a label claim. Fine, right? Even those companies that market, we test every lot. There are some ingredients in those lots that are not being tested for various reasons. For some of them, there is no test method that's fit for purpose. There's reasons why some of these things don't get tested. So we have to look at the total picture here of what's going on. So if in how we describe the initial 111 now is causing some confusion because of the training and the testing now of how we're sending out the auditors, and I'm certainly not complaining about that, it's probably for improvement, then probably we need to maybe have another way of communicating to the industry, because a lot of companies who have multiple ingredient products, they have done their due diligence, and some of them have found that some of these ingredients cannot be tested. So we're supposed to verify those ingredients by production and process controls, which includes testing the raw material and making sure that all of the stages of manufacturing have been met to determine that the product does in fact meet the requirements. Also, testing over time is better. We're coming up with better methods. There's more equipment. There's all kinds of things that's going on that's changing. There were things that we couldn't test 5 years ago that we certainly can test now. So I don't know how we can put together some kind of training seminar to address the changes that's going on, the changes that have been made, the new technologies. Because a lot of the smaller companies out there, they're not on top of these things. But they need to be, because when you go into the facility and audit them, I can assure you they're going to fail if they are not aware of how we're looking at things today. How we looked at auditing in the beginning was different from now. Everybody has more training. Everybody has better understanding. Siobhan, she threw the preamble at me last time. I thought I was the only one who read that. He said, here's another lady who reads the preamble, and I've used it over all of these years to help train my clients. So now we have her implementing things there, and some of those things have not been really implemented over the last how many ever years we had the GMPs, 2010 or 2007 when it came out. So is there a way that we can do something about this and train the industry? For example, for FISMA, we went to training. I have a certificate for training for preventive controls. I have a certificate from the FDA group for training the FSBP. So maybe now we need to figure out how to go back and create certificates for training people in the dietary supplement industry, because those of you who deal in the industry, you know very well that we do have shortcomings in testing. We have shortcomings in spec setting. We're talking about that all the time with Siobhan and Gary, because everybody's not setting specs the same way. Some people don't even understand the difference between certain specifications. So we need to give them training, because some of these people are not really sure. They just don't know any better, and we need to train them.
I think that was the funny thing earlier with the Deshae question is Deshae passed unanimously. You can't get Congress to agree on pretty much anything these days. So there you go.
And yeah.
What's that?
And yeah.
I mean, I think there's ways to do it outside. I mean, there are definitely ways to do it. And there is. I know they cut some of the funding units. I don't think it's for your guys' training. I think it's just for the Center of Excellence research component. So there may be an opportunity there to divert that money. I mean, we can certainly look at that. I'm happy to, hey, if anyone's interested, it sounds like some folks are. I think we can certainly fly that flag because it probably makes a lot of sense. They used to do that joint industry and FDA session down at UMass a long time ago, but kind of before the GMPs got rolled out. But it may be time to look at something like that. So.
I have a question right here, comment for Shuman and Gary. So the industry, before you guys started to train the investigators in the past, so the industry are building protocols, programs with how they feel they can comply with the regulation, right? So for example, if they have a product of a multivitamin, multimineral, 20 analytes. So are we expecting for those 20 analytes to be tested every batch production? Or when we say rotation testing, when we talk about rotation testing, what does that mean? So we look at probably, so the industry, I probably not say everybody, but some of the industry members will look at grouping, right? So you have 20 analytes, you group them into 5 different groups. So you look at probably one fat soluble, one water soluble, one micromineral, one mineral, group 1, group 2, group 3, group 4. And then you rotate that. But before they do that, they will do first 3 lots, full testing, part of their verification step. Do full testing of the first lot, then you do rotation testing. So you do full circle. On the 5th lot, you did again. So if there is any content uniformity issue or process issue, you'll pick it up. So are you saying that now are the investigators trained? If you have 20 analytes, we're expected to say 20 testing every batch?
The investigators aren't trained. We're still in that process.
Oh, all right.
It's a process that occurs.
So we referred a lot to that 75C1 that you must select one or more established specifications for identity, purity, strength, composition limits on contamination. And Graham brought up the at least every 1 year general procedure. I would expect if you're doing rotational testing that you would spread out that 20 over the 1 year. That is rational to me. Yeah. Do you have a differing opinion? You are far enough. You are far away from me. I can't smack you. You have to talk in the microphone. Stop it.
I'll get right back. It's just the size of the batch. It's just how often are you producing this batch, this product. Just keep that in mind based on what you sponsor.
Okay. All right. We've had a question over here that's been waiting for quite a while now. Go ahead, state your name, organization, and ask your question.
Well, my name is Richard, and I do have some specialization in analyzing of probiotics, but I currently also work in the biopharma industry. I've got about 3 questions, but they're going to be pretty short, like a minuscule. One question. Well, they're all right. They're very, very short. Well, this goes to the FDA group. There was a statement that indicated that about 20% of the consumer products on the market are under the control or surveillance of the Office of the Inspection and Investigation. I would like to find out from you, of that 20% of the products on the market and the data that you do collect, what would be your suspicion that could constitute a fraction that probably would indicate some of those products shouldn't be on the market? Gary, I would also like to know from you, from the results that you presented that did not meet the criteria, was it because the labs that were producing those results were not credited? And if so, if they were, do you think it was because the equipment were not validated or calibrated, or the analyst was qualified but not certified? My third question goes to the person, I think John, that presented about probiotics. From the data that could be scientifically available in the scientific community, and probably there are results indicating that there is a range of probiotic strains that have been shown to have therapeutic potential. In your view, would you say that some products on the market would qualify to use the term therapeutic potential on their labels? Thank you.
So the first question I believe you had asked, I'm going to repeat them and make sure that we're understanding them correctly. You asked us of 20% that's on the market for probiotics, how many of them would be unsafe? We couldn't answer that for you. That wouldn't be fair to the producers of the finished product, producers of raw material. They're not here to speak for themselves, and I wouldn't put anybody on blast like that. So we don't really have an answer for that at this time. Your second question, I believe, was of some of the raw data that I put on the screen that was horrendous. You wanted to know if that was an issue with either the analyst not being properly trained or equipment, right? I don't know. I can't speculate that for you, but what the whole goal of driving that home was that quality must know this isn't something they can accept as a test. And regardless whether they want to communicate back with that lab to conduct the test again is independent to those operations. I wouldn't. I would want to search because if you're going to release data like that, I'm very concerned about what you're going to release next. Somebody in those labs, as the lab director, should have cut those off right away and not put their name or their seal on that raw data and submit it. They should have done another test or reached back out to the organization, the firm, and said, we can't perform this like we thought. But as for being able to diagnose what the issues are, that's not fair because I would have to be there to be able to take a full assessment of everything. They may not have the right reagents. I mean, I've seen in-houses where they're combining reagents for chemistry analysis that were supposed to be two separate steps, but they wanted to cut corners and they produced stuff similar to what we saw today. So yeah, I can't answer pinpoint specifically what's causing it, but it's the responsibility of quality when they receive that at the firm to not accept that product either for use in manufacturing or finished product for distribution.
I was 100% with him on some of those cases, and so I can tell you he won't, I will. It was 100% the person not knowing what they were doing. And when we asked him, hey, yo, it's not supposed to look like that. Why does it look like that? All he did was cross his arms and lean against a pillar. So, I think the probiotic question is down to you, sir.
I'm not sure I totally understood it, but I think you're asking current probiotics that are on the market as dietary supplements, do they have therapeutic potential? I think without knowing the specific strain and what you're referring to, it'd be hard for me to answer that question. The IPA advocates for the safe and efficacious use of probiotics as dietary supplements. Anything that has therapeutic potential is by definition a drug. And if, right? Okay, well, all right, Bob's going to fill you in on the particulars of that, but I'm not sure what you mean as far as therapeutic potential is concerned. Because to me, therapeutic runs afoul of treating, right?
Well, take vitamin C. If I sell you an orange and I say it's high in vitamin C, I just sold vitamin C as a food. Okay, I sold the orange for its vitamin C content. That makes vitamin C a food. If I sell vitamin C in a dietary supplement to make up a claim, now it's a dietary ingredient. If I sell vitamin C to prevent, cure, or treat scurvy, Dan's example earlier, now it's a drug. So to say something has therapeutic potential, it doesn't automatically make it a drug. A lot of probiotics on the market now might have therapeutic potential, but they've been investigated for safety as a dietary ingredient and to substantiate their dietary supplement claims. But that doesn't mean that they couldn't theoretically be therapeutic.
No, it's all based on the kind of claim. Yeah.
Okay, we are running tight on time. Maybe we have. Okay. All right. So I've been overruled. So this might be the last question.
Thank you so much. Hi, my name is Vincent. I'm a co-founder for a startup called Scoop AI. We help CPG brands, a lot of supplement brands, with like AI powered like operations and general claim review. My question was for the entire panel, which was like, what do you think should be sort of AI's role in regulatory and quality compliance? And what are some things that you might be excited by, and what are some things that you're a little bit concerned with, as we see growing AI usage?
More concerns than excitement right now. You have groups claiming to have substantiation files by AI. Like someone pointed out the hallucinate. I've seen a bunch of legal reports from different law offices written by associates and AI written that all have hallucinations, that all have studies that don't exist, misinterpreted. I appreciate what Glenn said about the machine's got to learn, but I think there's an element of it that you can't. Um, if you're going to have an expert memo, I hope the day never comes where FDA depends on AI to write an expert memo. I mean, I think you could use to call references and things like that, but I think if you're going to actually have the human element that's in the practice of medicine, right, as it were, I think that it goes back to the question about therapeutics: is what's the intended use? Can you use AI to gather references? Can you use it as a research tool? Sure, but in terms of uh, I think the assumption for at least me, former FDA, I think Bob, former FDA, we've had this conversation. I know Gary because Gary thinks like this. It, some these things are going to end up in court, right? And you bring in the laptop into court with you to testify.
So I have a couple of fun ideas. Um, you talk about labeling and things in the labeling with drug claims. Something that would be nice for investigators is to be able to scan in labels and have AI be able to identify things that are misbranding, things like hairlines or the supplement facts title goes the full width of the panel. Stop it. Stop it. I'm tired of showing up at all y'all's facilities and seeing this and it's all over to the left. Stop doing it. But to be able to have an AI tool that identifies that and highlights it and puts it in a little brick, and then an investigator can go in and say, oh, yeah, that's actually incorrect, and put that in their report. Also, to have a report system that the investigator can fill it out, they can have all of their citations, and then before it gets to the supervisor, Matt, the AI goes through and says, this is no action indicated, this is voluntary action indicated, this is OAI action indicated. So the supervisor gets a heads up from the AI machine that says, this is what we would recommend based on previous actions that this goes forward as. And then the supervisor goes through and does the human element and says, yeah, I agree, or no, I don't.
I think AI might be useful for like scrubbing websites, maybe for claims or things like that. I have a client who loves to use AI and challenge me with his AI answer. And you know what? They're not bad. They're 70, 80% right. What do you think that 20% could do to you if it's wrong in a legal opinion? Kind of matters.
Are you asking for industry too? Yeah. Oh, sure. Here's some of the things that you could do.
Yeah. Yeah. I think so. I think the one first rule of AI, you guys will agree, is that humans have to validate the quality when you're setting up models, right? So vigorous head nods here from the front row. If you can't see that, that is absolutely critical. Having said that, large language models in particular are excellent at reading, writing, and summation. In our controlled document-led CGMPs, there is a lot of that. And when it is pretty formulaic and there's not a lot of debate, there's a lot of SOPs. If we set the right specification template, let's say you're a contract manufacturer and you have 500 brands, all of a sudden you can use AI in a way that can generate a lot of these documents so long as there's a human obviously reviewing and approving those, right? And so like there's much like Siobhan was saying, it's an efficiency tool that gets you to a human who can kind of review and approve it. I think that'll be the piece as we go forward. And you're certainly welcome. We'd love to have you participate, in these conversations. Let's talk after. Because this is emerging, this is what we need to do. But I think it's very clear with the skepticism, which is totally validated, that until you get where people get scared is where you just let the robot go, let the machine go, and it's like, oh, we're going on vacation, let's go golfing. Like that's we're talking about life and death, right? That's why everyone's here. And so
That's the piece. But in terms of using it to deploy, make investigators more efficient, make industry more efficient, I think there's a lot of potential with the caveat that it's really got to be validated and there's always got to be a human in the mix at some point. And so that'll be the really key thing to figure out.
Okay, Andrea, what's our drop dead time to get out of here? Okay, so we're getting close on time, but I'm willing to keep going. You call it, boss. What are we doing?
So we then we're gonna have a big meeting.
Well,
We promised the person.
So part of our agenda when we send our invite is we're gonna have a speed dating activity for participants to have the opportunity to talk to anyone on the panel if there are either questions that was not answered earlier or talk to the industry experts that are here participating with us. So I think let's close this session and we will request our panels here to occupy a table and those interested to talk to those speakers, please feel free to go into the table. But please do not line up for Shuban's table. Please do not see, I mean, it's okay, but please do not monopolize the time. A lot of people still want to talk to them. So we need to limit ourselves to have you guys been into speed dating? You're like, oh, move, right? 5 minutes, move. Okay, but I'm kidding. Well, right? But give others the opportunity to speak to the rest of our panel. Thank you. Thank you, thank you. And for the for the virtual attendees, thank you so much. I know you guys will not be able to participate in this activity, but hopefully see you next year. Thank you.